Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
...4,6 δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία αιχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out.
It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
4,6 δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία αιχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς σε αυτή. United Group. Με τη δύναμη της φύσης.
Check this out.
It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow. First thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείτε το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
4,6 δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out.
It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow. First thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
4,6 δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς σε αυτή. United Group. Με τη δύναμη της φύσης.
Check this out.
It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow. First thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Good morning, ladies and gentlemen, distinguished speakers and guests. Welcome to the 5th Annual Greece Cancer Summit, organized by Economist Impact under the scientific auspices of the Hellenic Society of Medical Oncology and the auspices of the Hellenic Cancer Federation with the support of MSD. My name is Joan Hoey. I'm the analyst for Greece at The Economist Intelligence Unit and editor of The Economist's annual Democracy Index. This is the first time I am chairing this event, and it is an honor for me to do so. This is not the usual type of event that I am chairing. Usually I am moderating events about geopolitics, politics, economy, business, and so on. But this event and its content is just as important as all those things. Because in the end, the most important thing is our health and the health of our families, our loved ones, and the people close to us. And this is what makes this event as much a public interest issue as all those other things that the whole world is talking about at the moment, in particular geopolitics. Most people in this room today will have some family member or a friend or a relative who has had experience of battling with cancer. 6 years ago, my own husband died with pancreatic cancer. A year ago, one of my daughters was lucky enough to have an early diagnosis of breast cancer and to receive the treatment that she needed, including a mastectomy, and she's doing very well. So our discussions today are very important for all the experts in the field who will be speaking on our panels today, and it's very important that they get together and discuss what is happening in terms of our national cancer plans, in terms of developments in the field, innovations, and where we need to go in future. So we'll begin our discussions with a top-level view of where Greece stands in the fight against cancer. And I would like to introduce our opening speakers to join me on the stage, and I will introduce them one by one. And if you can come up and join me, and we can get our discussions underway. So first of all, I would like to introduce Adonis Georgiadis, Minister of Health of the Hellenic Republic, Xenia Saridaki Zoras, Medical Oncologist and President of the Board, Hellenic Society of Medical Oncology, George Kapitanakis, President of the Hellenic Cancer Federation, ELOC, and Cyril Shiva, President of Mid-Europe Region, MSD. Welcome all of you, and please join me on the stage. Yeah. Welcome. 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 Welcome.
Thank you.
Okay, so the way that all our panels will work today is that each of our speakers will make some opening statements and remarks for 5-6 minutes, and that should give us time for a Q&A, for some discussion afterwards, including from participants in the audience, should you wish. So I'm going to hand straight over to the Minister. Thank you very much for joining us today. I know you've got a busy day ahead of you in the Parliament today. Over to you.
First of all, thank you very much for the invitation. It's a great honor for me
being here once more in the Economist Forum, this day for maybe the most important discussion I have participated, the European Strategy Against Cancer, in which I'm proud to say Greece participates with a lot of ambition and with a lot of actions that tries really to produce a much better, not only healthcare, but in general care of the patient with cancer and their families. In this panel that I'm very honored to participate, you have two people here, Mrs. Zenia Saridaki, the president of the Association of Oncologists of Pathologists of Greece, and Mr. Kapetanakis, the president of the Association of the Patients with Cancer. I consider them my colleagues and members of my staff, to be honest, not personally as minister, because together the recent 15 months we managed to proceed a lot of things that we were talking about in Greece for many decades and other European countries had solved some years ago. First of all, we launched it and now it's in operation, our national registry of the oncologist patients, which was a huge plan and a huge action for our ministry with a lot of difficulties, to be honest, but at the end we managed to deliver, and I'm very proud that this happened during my term. I think it is something that will stay for many, many years in front. It will produce to the oncologist patient a totally different environment and to the doctors how to deal with this patient as better as they can. We managed to find a way to fund and put in our system, the reimbursement system, the biomarkers. Okay, since I started in English, let me proceed. Okay, the biomarkers, which was something that our patients needed it a lot, and we managed to do it. We managed to implement oncologist protocols, and through the registry to be able technically to launch the cyber meetings of the oncologist councils in the hospitals in order to find the best cure for each patient. These are things that are very, very important. And what we have to do now, because we did practical good things that are changing the environment, but now we have the biggest challenge for me personally and for the government to really be able to decide and to present to the Greek people our national strategy for cancer. The Prime Minister soon will invite in his office all the co-ministers that are implemented in this action plan and all the society of oncologists, doctors and patients to start a national dialogue that in a very specific period of time has to deliver this national action plan that I believe in 2025 will be ready to be launched and be implemented, which I think it is the most bigger challenge I have now in the Ministry of Health. But I can say to you again that I'm very proud that we have done a lot of progress during the recent months, and I want to thank them again. The second thing I want to mention is that I'm very happy that during the 10 years I was away from the Ministry of Health from my previous term to this term, the progress that the innovation has been done against cancer is huge, maybe more than any expectation. This is fantastic news because good companies like MSD now have the CEO from Europe here, and we thank him that he is participating here in Athens. You are very welcome here in Greece. And other companies, they're producing almost every day new therapies that are really expand the life of people with cancer and produce and provide them a much better health care service. And now we have the challenge to find the way to fund these fantastic new therapies. This is not an easy answer. I have to be very honest on that, because our needs are limitless, but our budget is limited. So we have to find an answer in a very difficult equation. But in people with good faith and reason, at the end, there is always common ground to find ways to do what they have to do, we as ministers, for our patients, and the companies for their company and their patients also. So I think the future is really very promising against cancer, and in Europe and in Greece. Thank you very much.
Well, thank you very much, Minister, for starting our discussions today. And I will turn now to Xenia Saridaki-Zoras. Welcome. Yeah, the clicker is on there for the PowerPoint.
Here. I will speak in Greek.
Of course.
I would like to thank MST for one more time. Along with ESMO, they organized this very important event. In our society, we are now celebrating 40 years from our establishment in 2025. We started in 1985. And I wanted to show you the slide with which I started last year, just a few days ahead of the minister signing the National Registry of Neoplastic Diseases, registry that was left in our drawers for a few years. With his intelligence and speed, two of his features, his attributes, he understood that this was an important action, and because a picture is worth 1,000 words. In 25 February 2025, a year later, this registry is now a reality for everyone. And these are the images, these are the things that we are able to show you with our excellent cooperation between ESMO and the ministry. You see the test environment. Quite a few oncologists were able to see this. We get the information. We log in with our credentials. This is taken from our own practice. You see there are my patients. I've entered them in the test environment, in line with all European guidelines, very functional, very specific, very easy to use. A couple of things we need to add. There's, of course, a lot more to be added, hopefully in the future, but a couple of things that we can now add. And finally, Greece can have some data. And so this is the environment as you see it. And what is important is that as of February 24, approximately 30 doctors, most of them oncologists, have logged in, but not all of them were oncologists. There's a group of doctors that can enter their patients in the registry, and still it is not mandatory. More than 100 patients have already been registered. And I think that for something that is not mandatory in this condition, this is very important. We at ESMO are already continue to support the electronic file for oncology that we have now been working with for years. And the other important thing are the biomarkers. Again, this time last year, we were discussing the need of updating and renewing the list. And we had the consensus for the biomarkers created, 118 pages. We sent it to the ministry, and for one more time, with his intelligence and his excellent perception, the minister was able to materialize that as well with an announcement at the ESMO conference, Mr. Kapetanakis conference a few days ago. It is a reality. We have renewed the biomarkers list with very specific budget, concrete budget, something that will become a reality in the next months and will truly make equal the access of all oncology patients to the best and more innovative treatments in Greece. And until that happens, ESMO continues to support the oncology patients with 25 programs offering biomarkers to the patients and their doctors that need them. More than 6.5 million euro an investment on the side of our society, and especially for pulmonary cancer. We have given a lot of money from our own funds in order for our patients to be able to do these tests. There is no oncologist in Greece that has not used the ESMO programs. Another thing that became a reality during Mr. Georgiadis' term was the compensation of the controllers and the auditors. Another request from us, because these are oncologists that have been working very hard from their own personal time in order to approve the new medications, the new drugs, and we thank him for his efforts. And the other thing, as he said, as he mentioned, the oncologists in our society stand by his side. He has upgraded the role of our society in any action taken in relation to cancer patients and in any other program related to cancer. And finally, treatment protocols. This is the new step that, again, after 10 years that we've trying to work with them and update them, we started seeing them transition into the digital phase. We are now completing the first trial round, testing round. Quite a few protocols are ready, and a few of them within March. I will believe we will have the beta environment, the test environment, so the oncologists will be able to use those protocols that they know through the DICA platforms, so they can provide specific treatment plans to their patients. And this is a reality now. We at ESMO, let me mention that we invest in an outward mentality. We work with ASCO, with ECHO, with the Oncology Society of Cyprus, with primary healthcare programs, with very important programs. We invest in education. We host seminars and specific actions for oncologists with the Academy of Oncology, with our scholarships, with our research programs, with special scholarships with, for example, with Columbia University for young adults, with Christie at Great Britain. We're sending 2 people there in September, with excellent actions such as the academy and education for classical education under the auspices of our society. And of course, we invest in prevention and information given to our patients. On February this year, February 4, our action was one that we completed along with ELOC, discussing all the important steps taken this year. And of course, we try to make all the information about screening tests, preventive tests and vaccines and everything known to people. And since we're celebrating 40 years for our society, our motto this year and for our conference next month is we make time for what is important. And I believe that we have proven all these years with our people that we are doing all that we can for oncology patients in Greece. Thank you very much.
Thank you very much indeed. Turning now to George Kapitanakis, the President of ELOC.
Thank you. Καλημέρα σας.
Good morning, Mr. Minister, dear guests and speakers, On behalf of ELOC, we want to thank the economists for inviting us here and for allowing us to be the sponsors. It's my third conference that I participate. And when I start talking, I usually have my speech prepared, but this year I don't have a speech. I want to show you pictures. I was asked to evaluate what happened, make an assessment of what happened last year. And the thing is, a month ago, we have experienced historical times with the minister and everyone who participated in the ELOC conference. It's as if 10 years when condensed in a period of a few months. So making this assessment is a difficult task. The minister talked and within 4 or 5 minutes, he just mentioned very few of the things that were accomplished over this year. And we need to recognize that, and we need to work together and collaborate. And thank you, Mr. Minister, for saying that, for mentioning that we do collaborate, work together. So last year, when we left this conference, we were asked to give you our targets, our goals, what we expect to happen in 2024. And then I made this presentation, this one slide that you see with 10 goals. And these 10 goals were defined by us arbitrarily for our patients with no planning, the things that we wanted to happen in 2024. Now, let's go one by one to see what was already been accomplished and what we can do, because, you know, we are always looking for doing more. We want to be excellent in what we do. As Ms. Saridaki mentioned, we want to be better, and we want to thank HESMO for their help. So the first goal, pillar that we have said, with this prevention, screening, early detection program for HPV, the Fovigenimatar program, a lot was accomplished, and we have a great outcome. But there is room for improvement. Still, we see that prostate cancer, pulmonary cancer are high on the list, and also smoking. From the OECD report, it's something that we need to work on. However, we are doing good. We're doing better. And the second thing is better access to innovative treatments. So 24 was a difficult year. The results from the drug companies showed us that obstacles are becoming higher. We continue to work and try to find new financing tools and increase our spending so that we can do better. We believe that there's a lot to be done here. Our view is that we need to have a new agreement, more radical one. But truly, we have taken steps forward, and we have taken steps forward because, as Ms. Serdak said, for the first time after 10 years, we have now the ability to work with a framework for the compensation for the biomarkers. We are now talking about a new level of our collaboration. But there are some delays in this regard as well. You see on the right diagram, these are the treatments that are urgent for ESMO. There we have 50% access. We have some delays. We want to improve things. We know that the ministry is doing all that they can to provide each patient with what they need, but we need to work harder. The other thing we want to see is palliative help. There is the framework, palliative care. Yes, there is the commission from Stavros Niarchos and the ministry. We see the reports from WHO. We need 500 beds and only have 9. So we know that we have made some progress, but we still have not seen what we want. This is a request. This is what we need. And also, another priority is how we can deal with social inequalities. It's an important thing, and we see from Mr. Sirigo's report for lung cancer, we see how inequalities in lung cancer relate to specific citizen or age groups. And we see at the registry by the European about inequalities, we see that there is room for improvement. So that's something we need to work on. And over the summer, the law on mental health has passed, an important law that changes the framework, but we want to see how this can affect cancer as well, because cancer is, like you have mentioned, Minister, a social disease that affects the entire family, and we need the support for the families of the patients. At the same time, the other thing that we have asked for, support for a healthy lifestyle, and the program for child obesity, a lot of progress was made in our country. Digital transformation, I don't think I can add anything to what Mrs. Saridaki mentioned, and you also mentioned. This is a lot of progress was made over the year. We have the registry. Over the next months, we're going to start with the programs for digitizing the 12 oncology hospitals, and that will extend to other hospitals. Digital application for digital apps for patients, bringing patients and doctors closer together. However, survivorship and rehabilitation, these are the two things we need to look at. In survivorship, we have the survivorship clinic at Attiko Hospital, something that the ministry is working on and will expand once it is standardized to other hospitals in the country. But in terms of rehabilitation, there's labor issues, there are other issues that need to be addressed, and perhaps it's not for the ministry to handle them, but these are things that we need to do to take care in order to improve things for our patients. And lastly, another priority for us was to enhance collaboration between the international community and the Greek reality in terms of cancer. So what we were able to accomplish throughout the year, and again, we worked with all agencies, Mr. Minister, and we have accomplished to have a better collaboration with everyone, with all parties, and it's a different way to work right now. And with these few thoughts, always with people at the center, human-centered, I want to quickly evaluate a few of the issues that we had arbitrarily set as priorities last year. A lot of progress was made in some of them. Maybe we were extra overly optimistic, but we need to keep in mind that we are aligned, all of us, and the priorities of the ministry are aligned with our actions. Thank you.
Thank you very much, Mr. Kapitanakis. And last but not least, Cyril Shiva, President of Mid-Europe Region, MSD. Welcome, sir.
Thank you, and allow me first to say how much of a pleasure it is to be here, and a privilege to sit on this panel. It's really great to witness over the years the progress that has been done, and I really want to commend Mr. Minister for his leadership over the last year and a half, and the acceleration in the program and the progresses and the collaboration between the ministry, the Hellenic Medical Oncology Society and the President, as well as the Hellenic Federation of Cancer Patients. I think we all work for patients, but it's humbling to see that under your leadership and the collaboration that you're showing, patients really have a voice. and are present, and really that collaboration, we're not seeing it everywhere necessarily in Europe. So it's very humbling to just hear what you just shared, I have to say. I would like to touch on maybe 3 themes as part of my opening remarks, and you touched on some of them, of course. One is the fact that cancer is predicted to be the leading cause of death in Europe as demographics evolve, and how do we try to tackle, and what does it mean for all of us in Europe and in Greece. The second theme, and you touched on it, is the importance of innovation and competitiveness. Competitiveness is probably the center word over the last weeks beyond the healthcare, but in healthcare it's also extremely important. And the third theme I'd like to touch on is collaboration. And we just, see collaboration in action through a number of examples that you've shared, and how those are important within a country, but also broader in Europe. So on the first theme, reality is that the prediction are that as many as 1 in 2 European citizens will experience cancer in their life. I mean, that is also a statistic that gets us, to step back and reflect. And we're seeing significant advances. You spoke about the fact that there are more and more survivors, and that is thanks to improvements in prevention, in early detection, diagnosis, in treatments, in care. We have multiple examples that I could use there. I mean, recently the American Cancer Society showed that in women vaccinated against preventable cancers, there was a decrease in 70%, 69% exactly, of cervical cancer from 2013 to 2021. If we look at early detection, breast cancer patients that are detected early, 9 out of 10 have a chance of surviving. If we look at new therapies, we see, for example, in metastatic melanoma that 5 years survival is now up to 50%, I think, compared to 5% some years back. So we see progresses. Now, having said that, I mean, more needs to be done. We need to continue progressing. And on multiple fronts, on the front of innovation, but also, and you touched on it, on the front of equity. What we see across Europe and within countries is inequities in terms of results within socioeconomic groups. We see that, for example, there's an interesting statistic that 10% of the EU citizens would say that they delay getting care because of financial restrictions, despite the fact that largely in Europe we have universal care provided. But when you go a little bit deeper in that statistic, it goes up to 20% in people that report low income, compared to only a few percent in those that obviously have a higher income. So there's a lot to be dealt with. The other aspect that is important and is really to witness the progress that you've all touched upon. I think it's impressive to see that you've had progress in prevention in Greece, in multiple now screening programs, whether it's breast cancer, cervical, colorectal, whether it's the work that you're doing with the National Registry. I mean, this is paving the way for significant transformation and for the ability to use data also in the future for more evidence-based decisions. It's also really humbling to see the progress that you're doing around digital solutions. I mean, we talk a lot about digital solutions, but having Greece today and patients in Greece being able to have access to digital solutions, being able to be managed through the entire healthcare system in the future, being able to have their medical dossier access, whichever physician they will consult in the future will be key. So I think we see progress, but more is needed. On innovation and competitiveness, I mean, maybe just 2 points I touched on. One is, at the time that we're really seeing how important it is to have a strong Europe. I mean, the EU, the pharmaceutical industry invest 23% of the global research in Europe. It's not a bad number, but it's decreasing over the years. So we need to continue under your leadership having strong regulatory framework in Europe and incentives to be able to drive research. I mean, because when we have that vision and when we work in such a collaborative fashion as we do in Greece, even though not everything would be perfect, we see that we're able to do a lot. A company like ours in Greece, we have the largest clinical footprint in the country. There are more than 71 clinical trials at the moment that we're running in Greece, close to 500 patients in clinical trials, 60 of them in oncology, some in our most advanced investigating medicines, like our neoantigen therapies, and a colleague of mine will talk about it this afternoon. So we can do a lot. And developing a comprehensive cancer care goes from research, from the bench, to the bed of the patient. And that whole ecosystem is what leaders like yourself are trying to build, and that's what we as a company are committed to contribute to. And that brings me to my last point, is really the importance of collaboration, partnerships. We here in the room, I recognize a number of people. Just as we were starting, I was discussing with the WHO lead. I mean, we need those partnerships between public, private, scientific societies, large organizations to come together and really help build comprehensive cancer care. So I'm really looking forward to the conversations throughout the day. And thank you again for your leadership and having us here.
Well, thanks all of you for starting off the discussions, and obviously what you've set out is a huge number of issues, and so there is a lot to talk about, and I'm sure we'll get through all of this during the rest of today. But we have got about 22 minutes for Q&A and a discussion. So maybe I can start off with a few questions, and I will ask the audience if you want to take the opportunity. The Minister is here, and representatives of these important institutions. So if you do have questions, I'm very open to taking them. But let me start off, Minister, I guess with your closing challenge that you said the government is facing is developing this national cancer strategy. And you talked about the Prime Minister's intentions to invite all the ministers and engage the oncology specialists and also patients in a national dialogue, and to launch that this year. So I wonder if you could just tell us a little bit more about that in terms of your priorities, the Ministry's priorities for this coming year.
First of all, since my colleague addressed in the Greek language, you permit me to switch to the Greek language?
Yeah, sure.
Firstly, I would like to thank Mrs. Saridaki and Mr. Kapetanaki for the beautiful words. It's not a matter of leadership, if I may say. We have a team. This is teamwork. I'm doing my job, which is to take decisions, but you are doing the main, the important decisions are taken by you. No minister can do what we have accomplished in Greece just because he or she is a good minister. What we have accomplished is that we have developed this team spirit, which is something very good, with you, with the cancer patient associations and everyone, because all these people are interested in taking our country forward and offer a better quality of life. I'm not saying we can solve all issues. Mr. Kapetanakis set out 10 priorities. We took steps forward in all 10 of them. I see Nikos Iosif here, my friend from the Deputy Minister's office. Let me say that our strategy on screening, the Phofis Genimata program and the digital mammographies and the cervical cancer screening programs, we know that we have new vaccines coming in, and the HPV prevention issue, which is a big issue, and we fully support these initiatives, because ahead of this challenge that Mrs. Hoy asked me about, in order to make it to this point, prevention turns out to be even more important than originally thought, because if you are to deal with a disease that has went out of control, this will cost even more. So if you do it early enough, you can save money from your limited budget in order to channel this money where you really have to. So the challenge is not just a theoretical issue, it's a core issue of our strategy in order to make it to the final destination, let's say, to the final point. And allow me to say that the progress of Greece in the past 2 years has been amazing. We managed to pull together things that we have been discussing for decades. That's why sometimes I become furious when I hear the opposition saying that everything is going bad, where everything is black. No, it isn't, because I know that we have taken steps forward, and I know that. Now, the National Plan on Cancer. This national plan is not only up to the Ministry of Health. A national plan is not just about how to facilitate the patient finding the drug. He or she, the patient, will find it one way or another. Indeed, we have delays, Mr. Kapetanakis. I want to be honest with you. Closed budgets lead to counter incentives to the companies in order to bring new drugs in the market. We have the clawback, the rebates, and perhaps companies will set Greece into the second level, let's say, of countries. We are not going to run out of drugs. We will use the effort for that, but there will be delays. You know that we're talking about establishing a new innovation channel with additional funds in order to approve therapies that we consider to be extremely important. And I'm fully responsible about that as the government. I'm responsible for making sure that the patient gets the drug, and to get the drug as quickly as possible, because sometimes in the case of cancer, one day matters. It's not an issue of luxury. It's a matter of life and death. It's a battle. So the government, the state, has to improve itself in this respect. And we do try, believe me. It's a difficult exercise. It's not as easy as it might sound. But I think we have been able to display, to have progress in the past. The Prime Minister has showcased his interest to mark the importance of this meeting by being there himself. It's not a matter of the Ministry of Health. Yes, perhaps the Ministry of Health ranks first, also for psychological reasons. But this plan affects also the Ministry of Finance, the Ministry of Family, the Ministry of Labour, because a cancer patient has to change the way he lives or she lives, his family's life, his social status, his performance and productivity drops. It's not just the fact that he needs a drug in order to win the battle against the disease. No, we're talking about a major change in his or her life, not because of their own will, but it's a change enforced on them violently. That's why the state, the government, has to intervene and say, let me help you cross the river and manage this abrupt and blunt change that has been imposed on you in your life. We understand that. We have discussed with people, and that's why all competent ministries will put things in order. We will have a specific timeline. Actually, we will set milestones, because I'm not interested in saying that, okay, it was during my spell that the national strategy on cancer was announced. Okay, it's great for PR reasons, but I'm not interested in doing PR in politics. For me, politics stand for applied science. I want transparency. You can check what I said 1 year before and what I'm saying right now, because yes, talking is great, but I might be here 12 months after the last installment of this event telling you the same things. But one might say, dear Minister, you told us 10 things last year, but you did nothing of them. No, we weren't able to accomplish 100% of what I said last year. I want to be honest, we weren't able. But in the case of economists, you raise the bar very high, because in a very few months' time, we have to make such a huge, to deal with such a huge challenge. But we will do it. We are on the right track, and dealing with cancer in Greece has entered a brand new era. I'm proud of that, and I thank you for that, because if it wasn't for you, this would have not been a reality.
Very much. If I can turn to you now, Xenia, I just wanted to ask a few questions of my own about the registry.
Okay.
And you did say something. So, of course, you were emphasizing that this is not a mandatory requirement. So I just wanted to know to what extent this has been promoted, particularly for the patients. And do you have your own expectations or even targets in terms of take-up? You said, I think, 30 oncologists are using the register so far, 100 patients. Do you have some expectation for that to increase in the course of this year? Obviously, it's early days still. And just if you can say, on the basis of that take-up so far, what are the benefits that you have observed?
Mm-hmm. Okay, thank you for the question. I'm going to switch in Greek again.
It is still not mandatory. I've stressed that it is not mandatory, and even so, under these conditions, quite a few doctors, most of the 30 doctors are oncologists, but not all of them, so different specialties have used it, meaning they have registered the patients. And if you also consider when they started, the working days are practically less than a week. So that does not mean that we had 100 patients or 150 approximately that we have in Greece in that week, but it means that it is a tool that the doctors want to use. They are testing it. And in my view, they see that what was truly our goal when we were creating it, they see that it is user-friendly. So what we are interested in right now, at this stage, is to coordinate with the data from the EU, therefore the mandatory categories that have to be, the fields that have to be entered, so that the information is complete, the registration is complete, is very few, but we have a tool, as the Minister mentioned, that is more advanced because aside from those very specific mandatory information, it can also record treatments, biomarkers, neoplastic diseases. So it's something that is to complete the electronic folder. So I would say that I'm happy with it. I don't know if the state, if the government is, but I'm happy in how the doctors have embraced this initiative and how they work with it so far. And again, I stress the fact that it is not yet mandatory because that shows their intention, their willingness to participate in it. Of course, it will become mandatory in order for doctors to be able to make prescriptions or give drugs or go to surgery, and then you will see the numbers rising immediately. So I believe that next year at the Economist conference, as the Minister said, we will have thousands of patients registered, and for the first time the country is going to have this primary data that's going to allow it to formulate a better strategy.
Thank you.
Just to clarify, until the end of the year, we will have the electronic patients folder, which is a great project. And we're going to present the first phase quite shortly. When we have this folder ready, the registry will be mandatory. The doctors will not be able to issue prescriptions if their patients are not in the registry. So in a year from now, everyone's going to be registered there. It's still not mandatory because we're not just starting. It wouldn't be rational to the doctors to say, okay, we just made it, go there and use it. There's a transition period. We're going to give them the opportunity to adapt to the ministry, but to the registry. But at the end of the year, the end of 2025, it will be mandatory. But we don't need to make the registry yet another reason to fight in Greece. It's a tool. And something even more important. that the ministry with IDICA and all of us that designed and implemented the registry, we believed it was necessary that the registry to be open to all doctors irrespective of where they work, because in those 12 oncology hospitals, we're going to start with the oncology patient file, but it's not just them. So the registry, it's something that's going to cover the entire Greece. It involves all doctors that are that have to register their patients. Oncologists are the main category of those, but not only for the 12 hospitals. So these are two parallel projects, and I believe this is going to produce all this wealth of data that we are looking for.
Well, clarified lots of things. Mr. Kapitanakis, so you're still setting out very ambitious agenda for 2025. So I guess if you had to really say what the key areas or priorities for this year, what would they be? Well,
λοιπόν, να πούμε...
Let's say that what I presented, this assessment, this evaluation had to do with our priorities last year, those arbitrary ones that we have set. And today, at the end of the conference, we're going to again set an agenda that is for this year, and we are going to present it at the end of in the end. But of course, the implementation of what has already started is going to be a priority. Of course, we need to monitor the application. We need to look at that, because these very important projects, and I need to congratulate Mrs. Sardakis, because if she was not the leader of the team for the registries, maybe we wouldn't be talking about them right now. So again, congratulations on that. She did an excellent job. She coordinated a very difficult team, took some difficult decisions. It was not easy what she had accomplished. I couldn't have done it without the government gazette, without the law. So, okay, under these new conditions, we start a new era for oncology care, and what we want from that era is to make the life of cancer patients easier. We want to help them navigate the system. We want to help them give the ability to deal with all the red tape problems, with all the bureaucracy, because we still fragmentation, a degree of fragmentation between services. And my view is that this is all just from the past, what is haunting us still. So to give a more general answer, what we want is for the daily lives of the patients to be better. All these things that we've seen, we talked about, we designed, we want to see them in action so that patients can get the value that they need. Because recent reports are telling us that this value is still not part of the system. Yes, we are progressing, we are doing things, we congratulate each other, because truly we have set the foundation. But this has to make it to the people. And this is where we will be focusing this year.
Before I turn to Mr. Shiva again, I just wanted to give the opportunity to anybody from the floor. If you do have a question, would you raise your hand? I've got lots of light shining on us, so it's hard to see. So yeah, if you could even stand up and raise your hand. And does anybody have a question? I can't see anybody at this moment.
We were clear enough.
All is clear, yes. So let me turn to Mr. Shiva and ask, to bring maybe a more European or even global perspective, as you did I think in your introductory remarks as well. What do you see as the main opportunities and challenges for improving cancer care, taking this kind of broader lens of your experience, not? I mean, that's a kind of broad question, and should we be optimistic, really? You identified some of the problems at Greek and European level in terms of regulatory framework and so on that are maybe impeding progress in some areas. So, yeah, what would you say is the main challenge, but also the main opportunity here?
Well, that's a pretty broad question.
Yes, it is.
Let me maybe try to anchor my response on the journey that we've just heard is really taking place in Greece. I think there's a big part which is anchored around research. I mean, anytime we have progress in research, and not only in medicines, because medicines is only one point of intervention on a very complex patient care pathway. So progress alongside the entire pathway, we see better outcome. And I think here Greece has a strong heritage in terms of scientific leadership, very strong university hospitals, a number of leading also private centers, and that ecosystem that is working on really trying to pull research and evidence base and continuously look for progress is one of the important aspects. The second has to do with resources. And that I won't be specific on. It's not only a key priority in Greece, across Europe. If we look at data at the moment, you have 23% of the deaths that are attributed to cancer, 10% of the healthcare expenditure. So we see across all countries budgets and allocation of resources increasing towards cancer care, and it's a difficult equation. I wouldn't want to be in your seat on that one. It's a difficult equation, but it's an equation that is going to have to continue being solved for, because there's going to be a need for increased resources. The third is indeed speed of access and equity in access to innovation and broad innovation. In Europe, on average, the time from a medicine being approved to patients having access is in excess of 500 days. But with great disparity, a few months in some countries, up to 2+ years. And I think, and it was noted just before, Greece has developed a number of alternative access pathways to enable when clinicians, physicians make that decision to eventually offer patients the right therapies at the right time. Not always easy, not all physicians, but it is clearly one of the strengths of the country. And that is why a country like Greece, by the way, ranks in the average. You have countries where you have even greater access challenges. Now, I have to say that in my role, it's a key goal. I pride myself that with our teams, compared to an average of more than 500 days, if we took some of our latest medicines, we're at less than 300 days. So that's our job also. It's down to research. It's down to trying to address, unmet medical needs. So yeah, long answer to a short question, but it's multiple points of interventions that we need. And all this has to be organized, and that's why a national cancer plan is so important, through a comprehensive strategy. Without having a comprehensive strategy and data, because if you don't have data to really follow through your progress, it's hard for you to eventually, time over time, adapt your tactics and policies.
Well, thank you very much. That brings us to the end of this session, unless the Minister, you wanted a final word, because we have to move on to our next session otherwise.
Just a thank you to my colleagues that we work together, and a promise that we will continue to work equally hard to accomplish the rest of the targets. And of course, I accept that the implementation of these tools in the real world is a challenge for 2025, and we are going to succeed in it. Thank you, Mr. Minister.
maybe we can. We are moving on now to our next panel discussion, the importance of a national cancer plan. And we have 6 speakers. And I'd again like to invite all of you to join me now on stage. Tjeerd Albrecht, President of the European Public Health Association. Welcome, sir. How do you do? João Breda, I hope I've got this name correct, head of the World Health Organization Athens office on quality of care and patient safety, and special representative of the regional director and officer in charge WHO Greece. Thomas Hofmarscher, health economist at the Swedish Institute of Health Economics. Welcome, sir. Panos Kanavos, Associate Professor of International Health Policy, London School of Economics and Political Science. Welcome. Very good. Welcome, sir. Nicholas Tsoukalas, Director of the Oncology Department, Veterans Hospital 417 NIMTS, and General Secretary of the Board, ESMO. Welcome, sir. He's online, yes, that's right, via connection. And George, again, Kapitanakis, welcome back on stage. So we're going to follow the same pattern as the first session. Everybody has 4 or 5 minutes with some opening remarks, and we'll then have a discussion, hopefully. If everybody sticks to time, we'll have plenty of time for a Q&A. So, Mr. Albrecht, over to you.
Thank you. Thank you for the invitation to speak on behalf of the European Public Health Association, which I'm the president of currently, but also in the capacity of someone who has followed up on the development of the European National Cancer Control Programs. A lot has been said already. I would like to stress that WHO started these activities in late 80s, enhancing and supporting many countries around the globe in developing national cancer control programs. It is important to stress that they are public health programs, and some of the challenges that were mentioned in the previous session should be addressed by NCCPs. In particular, I would stress the mapping of the range of services and activities that need to be delivered in order to meet patient and population needs. Mapping of needs is one of the principles that should be used in designing an NCCP, and I couldn't agree more with the last speaker of the previous session that, of course, in that sense, registries, data are extremely important. I know that clinicians are not very enthusiastic about data collection, and even some of them not even in data analysis. But in the end, eventually, we all would like to see how we perform. We all would like to see outcomes of our work. which means that we have to register what we are doing. The second challenge is, of course, something that has not been mentioned yet today strongly enough, but I'm sure that Joao will pick up on this later as well, is the primary and secondary prevention. Europe's Beating Cancer Plan has laid out very big ambitions in supporting interventions in all 4 key lifestyle determinants, especially tobacco, alcohol, but also in nutrition and physical activity. Of course, all these activities need to be met and transposed into the national legislation. Alongside with primary prevention that I have just mentioned, you have obviously the challenges of early detection, screening, which is an important contributor to population level outcomes, especially in terms of downstaging and better survival. My own country has been very decisive on screening programs, and we were, for example, able to actually break the curve of incidence for colorectal cancer, which is now in decline because of the massive detection of precancerous lesions which are removed and therefore do not lead to invasive cancer. The next thing I would like to mention, George has already spoken in his presentation about this, are the so-called societal, social, and economic needs of patients. So obviously they are not the ones that are going to be solved by the healthcare system. It's a governmental mission. It's a mission of inter-ministerial collaboration, but it's something we have to envisage. People will finish their treatment. Many will be successfully treated, but unfortunately, some of them will have impairments because of treatment. Some will lose an organ, so their function then capacity to return fully to normal life will be limited. So rehabilitation and psychosocial support needs to be in place, because otherwise the person is going to end this period, turbulent period of their life with many challenges, so to say. In that sense, of course, I will return back to care and also access in general. Access to the different services that fulfill patient and population needs are of course crucial. Cancer is not a disease with small costs. So it is one where societies across Europe have committed important resources. And obviously, I agree that we will have to continue doing so, in particular because of the good outcomes. Finally, let me say that, of course, building a national cancer control program is also one of the mechanisms of demonstrating success, because obviously when you have a compilation of advanced targets, data analysis, then in some years later, duration of NCCPs may vary. Usually they are 4 or 5 years, sometimes even 7 years. But you are then able to show the progress. And in spite of many of our critics who say, yes, these programs will give results in 30 years, that's not true anymore. We know it's evident much, much sooner. Within 5 to 10 years, you will see important improvements. Thank you very much.
Thank you very much indeed. Over to you now, João Breda.
Well, Kalimera, good morning. Thank you, everyone. First of all, really appreciating the invitation. It's always a pleasure to be with you, particularly to commend The Economist for taking forward this conversation and particularly for bringing together so many and relevant stakeholders. Also, I would like to take a minute or a couple of seconds to congratulate all the women in the room, because it's the International Day of Women today, so congratulations for that. It would be good to have more women in the panel, but maybe next time. But in any case, as a man, I would like to congratulate you. It's a very important day, I think. We all know, it was said before, cancer is a leading public health challenge, not just in Greece, in Europe, globally. Addressing it effectively really depends on having really a good plan, a roadmap if you like and if you prefer, because it's really about making sure that we can coordinate, that we have a systems approach, that we have integration, that we really combine prevention, early detection, high quality treatment, and palliative and long-term care all together. This is maybe the elephant in the room, is the difficult thing, bringing all of this together. We can't just do one part very well. I think it's obvious for everyone. We have to do more on every dimension, particularly starting with those which are really around prevention. I will talk more, of course, about that because it's very important. It's also about ensuring quality of care. Quality of care in cancer has a wide variety of cross-European countries, and therefore we really need to focus more on quality and particularly on outcomes that matter to patients and their families. So this care needs to be safe, effective, people-centered, and equitable. It's not always the case. So any action plan really needs to deal with this, and I know that so many efforts. I commend Greece and the minister for the steps taken in the last years. Having elements of an action plan, having a cancer registry, having a very good screening program, these are really steps in the right direction. But we all know that more needs to be done, no doubt. And we still have gaps. We still have gaps on prevention, on screening, and in terms of treatment access. This is why a cancer plan is essential to provide the structure and the evidence-based response. In these plans, quality of care and patient safety are central. When it comes to cancer, this is probably one of those conditions where quality of care has a wider variation and really requires a lot more attention. We know that the complexity, the opportunities to be working more on personalized medicine or using genomics or using the potentials of AI and all of that makes it even more difficult to address issues of equity and to address issues of quality. Therefore, we really need to do more there. As we advance the technology, the innovations, these innovations are not just about new genomic treatment, new medicine. They are also about social innovation to tackle issues related with cancer, like well-being of patients, like patients that are recovering from treatment, as it was very well pointed out before. Innovation is not just about technology. Innovation is also about the way we deal with this in a social way, in a more equitable way. Needless to say that if you think about smoking, this is the elephant in the room. Your adolescents in Greece are using more and more vaping. Greece is one of the countries with the highest smoking prevalence. This has to stop. I went to a bar with my team the other day. It's forbidden to smoke, but everybody, all kids were smoking. Vaping, by the way. We need to target the tobacco industry hands-on. This is important. It's unacceptable. Drinking is still an issue, although Greece drinks less than other southern European countries, but still there is an issue with drinking. Obesity, you have one of the highest prevalences, actually the second, on childhood obesity in all of Europe, only beaten by Cyprus. You have a very good plan, a lot of work being done, but we need to keep an eye on the ball. And this is very important. Obesity is related at least very clearly with 8 cancers. Some of the most prevalent and pervasive. So we know we have to do more there in the areas of prevalence. Levels of physical inactivity also tremendously high here. So it's really about, the question for me is, can we take a comprehensive approach? Can we do all of this like an orchestra where everyone needs to play in the same way so that we have a very nice, elegant final result? For me, that's the main question. That without addressing the issues, for example, of smoking, you can throw all the money you want in treatment. It's never going to be enough. Thank you.
Thank you very much. Mr. Hofmoscher.
Thank you very much. Good morning, ladies and gentlemen. I have some slides. I'm going to stand at the podium. Thank you very much for the opportunity to be once again part of this conference. My key message today is that measuring and monitoring the performance in cancer care is important because what gets measured gets done. And let me give you some background. 2 years ago, we started an international initiative with the support from MSD, aiming to facilitate the exchange of best practices in cancer care across Europe. It's had its background in the launch of Europe's Beating Cancer Plan and the fundamental question of how to turn political commitment into action. As we just heard, one recommended way to take comprehensive action is through a national cancer plan. And with this in mind, we created a cancer dashboard for Greece. We launched the dashboard in October last year. You see it here on the screen. It was very much a team effort. We got great support from Dr. Selina Saridaki, representing ESMO, and from George Kapedenakis, representing ELOC. So we're really, really proud of this work. And on my second and already final slide, I'll show you the big overview of the dashboard. It's crowded. There are lots of content is on this in this overview. Lots of colors, many rows, many columns, but it all follows a clear structure. And let me walk you through this. On the left-hand side, the first column includes 7 areas, starting with governance, then disease burden, then economic burden, which are 3 contextual areas when we talk about cancer care. And then we included the 4 pillars of cancer care. We included prevention, early detection, diagnosis and treatment, and then survivorship. And for each of those 7 areas, we included a number of key performance indicators, KPIs, that are supposed to measure the performance of Greece. And of course, we did not include everything. We could have certainly included even more KPIs, but we had to start somewhere. And in the second column, you see then the status quo of Greece's performance for all of these KPIs, and you see that they have different colors. Red color meaning that Greece is below a European benchmark or the European average. Yellow color meaning that Greece is close or at the benchmark or close to the EU average, and green color meaning that Greece is above the EU average or the benchmark. The third column then simply shows you which KPI that we used. And the fourth column is also very important. It shows you whether there has been any recent policy development, any action being taken, with green color meaning that action has been taken, legislation has been put in place, yellow meaning that there are plans to do so, and red color meaning that there are no concrete actions yet being planned. What is then the general picture that we see here? If we look at the second column again, at the status quo of Greece, we see that red and yellow color dominates. So in most of the areas, it seems that Greece is still below or close to the benchmark. But when we look at the fourth column, the recent policy developments, we see actually lots of green color. And this is a positive sign, and I think we've already heard it this morning from the Minister of Health, because there has been a lot of action being taken very, very recently, and we need those policy actions first to be able to change the status quo in the coming years. So it actually looks very promising. Let me also give you two examples. One that was just mentioned, smoking. In the area of prevention, the status quo is in red color because the smoking rates in Greece are quite a bit above the EU average. But the policy development is in green color, simply because the tobacco control ban has been included in the National Action Plan for Public Health. So action is being taken. And the second example that I would like to give you is biomarker testing, also something that has already been discussed this morning. The status quo, we put it here in red color. And also the policy development is in red color. And this is because we published the dashboard in October. And back in October, there were no plans yet to improve the reimbursement situation of predictive biomarkers. Now, probably with the announcements having been made, it should probably, we have to change the color. Instead of red color, it should be yellow or even green color in the coming months. And this emphasizes actually a very important point that I'd like to make, that this dashboard is not a static view. It should really be a dynamic tool. And in my opinion, such a dashboard should be updated at least once per year to really reflect the current situation. With that in mind, I'll already like to round off my presentation. I hope that this work with the dashboard can inspire the creation and introduction of a national cancer plan in Greece, hopefully taking a comprehensive approach, hopefully including measurables and very clear goals and KPIs. And then also once the plan is there and is being implemented, trying to use a dashboard-style approach to monitor the implementation of the plan and all of the promises made very, very closely. Thank you very much.
Thank you very much. And now, Mr. Kanovos, London School of Economics and Policy.
Thank you. Thank you, Chair. Θα ήθελα να ευχαριστώ πάρα πολύ για την ευγενική πρόσκληση.
Thank you very much for the kind invitation. First of all, two very brief comments on what Joao and Tid mentioned. Something that has to do with personal responsibility in terms of health. Each of us is fully responsible for their health, and of course the tools that we have in the national health system, whether they are about prevention, about screening, or whatever, we need to be informed of them and use them. The second thing has to do with what Joao said, that for the smoking prevalence in Greece, of course, the law being implemented is part of that. It's not just about civil responsibility, individual responsibility. It's about upholding the law, and the authorities need to take play their part as well. So I don't want to reinvent the wheel here. I think having worked in evaluations of health technologies, negotiations and everything, I think for me it's very important to talk about the elephant in the room. Of course, detection, screening is an important part, but there is also treatment, how we can deal with the cancer. And of course, there's a lot of discussion about innovation. But I will ask two questions. What is innovation and how do we fund it? And of course, all drugs that are approved by the American or European Drug Federation are new, but maybe not all of them are innovative. And in terms of cancer, I think we have many markers, many indicators for innovation. In previous discussions, I've talked about a very important value framework that has contributed greatly in this area. It's the ESMO value framework, the MCBS, which is used, I think, very frequently by governments in different countries to evaluate how innovative a drug is. So if it's a drug that truly improves life expectancy or simply gives us just a few months of survival. Of course, these two drugs are innovative because they have something to offer, but something that is truly innovative is going to really improve on our life expectancy. So it's going to get a higher score, let's say, from this evaluation. So We're talking about how we can also evaluate this information and how we can fund it. And most of you know that assessing health technologies is part of our daily lives in many European countries. Of course, steps have been taken for the HTA. It's an important factor, but it is not as powerful as it should be in two aspects. First of all, the accurate evaluation of a new technology, which criteria is used in order to provide the compensation for a drug based on its degree of innovation. And also if there are protocols, not only based on clinical efficacy, but on financial efficiency as well, efficiency in terms of cost. And this is a problematic area. I know that in our country, there's a lot of activity. The project by WHO and for the alignment in regulation, and there's also a project for improving the health care technologies. So we need to look at how we measure clinical performance. I would say that in my 7 years of working with the HTA committee, I haven't really seen a report about the grading process and the clinical performance evaluation. Also, we don't have the financial criteria to give us a guide how we can negotiate for the compensation for a drug. And also, we don't have protocols to lock in the prescription process. And according to a research survey from our university, 50 to 75% of all drugs, orphan drugs included, with cancer indications, 75% of those drugs is approved with restrictions, which may be clinical restrictions, meaning that we have restrictions depending on a patient subgroup or prescribing restrictions, meaning that there's a leading institute, a center, an oncology center that cannot prescribe a specific drug. So this is my introductory. These are my introductory comments. There's a lot of discussion in Greece for innovation funds. I know that this is something that is happening, but maybe at some point, maybe during our discussion here, we could address the potential criteria for including new cancer drugs in this fund. Thank you.
Thank you very much. And yeah, I'm sure we can address that in this discussion and subsequent ones. I think now we're going to have our connection with Mr. Tsoukalas at the Veterans Hospital. If we have that connection, yes. Can you hear us, sir?
Hello.
Hello. I hope you've been able to follow the discussion so far, and we're handing over to you now to make your opening remarks. Do we still have the connection live, or have we lost the connection? Okay. We seem to have lost the connection. Let's just hang on 1 second. See if we can get Mr. Tsoukalas back. Yeah. Okay, let's move on, and I'm going to turn again to you, George Kapitanakis. And
okay, thank you. I have also a presentation, so thank you very much. Well, μιλάμε για εθνικό σχέδιο δράσης για τον καρκίνο.
So we're talking about the National Action Plan for Cancer. We heard the minister before sharing his vision about this plan, and his consideration of whether this plan goes hand in hand with the European Action Plan against cancer. And this is that's important, that we place health at the center of every policy. For me, it was asked to discuss the NCP from the viewpoint of the patients themselves. In other words, what should this plan include? What should the key points of such a plan be? So this is Maria. Maria and her pathway in the national health system. Actually, this graph was made by AI. So I told the AI that I have Maria dealing with these issues, and that's the image, the picture that was generated. It's not far from the truth. So the patient's journey is often disrupted and turbulent. What do I mean? We have to emphasize on the fact that there is a gap between policies considered and true life, the implementation of these policies, in other words, what we live day in, day out. What I love using as a quote is that we have many truths, but reality is one. So let's see how we can fulfill this reality. We need a plan to do that. We need a plan. We have to understand that this is a dynamic issue, and we have to have a holistic approach. So if we were to describe what patients need from such an NCP, is the following. They want access and equity. They need someone to navigate them in their cancer journey. They need support in their fight of financial toxicity, and they need support for survivorship and quality of life, in terms of survivorship and quality of life. So starting with access and equity. You see the picture in the middle. This is an individual, according to the recent OECD, that's according to which 76% of Greeks have no trust to the NHS of our country. And down below, you see that in the list of unmet medical needs, our country ranks second from the bottom. And at the top, we see the fields, the areas we should focus upon in order to remedy the inequalities in our society. Mr. Kanavos was very eloquent before, talking about clinical valuation or clinical assessment. We have the ESCAT and the clinical evaluation scale. I showed something in my first presentation about that, according to which the drugs, the medicinal products that are considered absolutely needed and required, 50% of them are difficult to access in our country. So this is what real life is about, not something that came as a conclusion of some clinical test, and which is of course meaningful, but it might not be related to the reality. That's something very, very important. Second point, navigation in the NHS. At the top, you see what one faces when diagnosed with cancer. He enters a maze. We need a patient navigator, someone. We need someone to guide the patient from day one. We need digital records, health digital records. We need the EMRs, the electronic medical record. And of course, we need multidisciplinary boards. This is very important. So coordination and navigation for the patients are of critical importance for the patients. And when talking about financial toxicity, here you see the out-of-pocket expenses following Luci's study. And you get the figures, the facts and figures for Greece. In Greece, the load the burden for cancer patients is huge. And at the bottom, you see the bureaucratic obstacles for patients when trying to find some support. We try to help there, but we can do very little. Now, survivorship and quality of life. Survivorship clinics is of major importance. We have to be more active in that. Before I talked about palliative care. We have also to talk about labor issues, work, and we need laws and regulations to provide this statutory support. Now, before we talked about the gap between policy and the real world. And given Mr. Hofmeicher's presentation before, whom I would like to congratulate for the amazing tool they were able to build. We worked together. Their final outcome was amazing. Allow me to say that, yes, the NCP should include clear targets. And in this context, we have to take into account the data, the experience we have from patients. Currently, they are not taken into consideration. We hope that this new tool, as announced before, the digital app, in the context of the digital transformation of our country, this will provide us a way to systematically register the patient experience related data. We need these tools. We need this tool. It might be the one that will help us build a strategy, assess it, and adjust our action plan every now and then, so we can understand where we're moving, where we are heading at, what are our strengths, what are our weaknesses. We always have to take into account population needs. I was asked to discuss about the elephant in the room, not the prevention. The elephant is the treatment of the patient, but it is equally important. In this context, we need to review the role of patient organizations. We need these organizations to have a say. They have to co-design the model. They have to co-design, to co-implement these plans. And they have to be one of the stakeholders that will carry out the independent monitoring or evaluation, you call it whatever you like, on these new tools and see what works and what doesn't work. And that's our role to some extent. We also have to ensure that the NCP works for the patients. It's for the benefit of the patients, so they can improve their life and face cancer more easily. There has to be transparency and accountability in this NCP, and we have to have inclusion. Inclusion in this new NCP is important. Last but not least, we need a national cancer plan that will be launched. It has to be a promise kept. What I mean, it's not just a plan to just a paper placed in a drawer. No, we have to turn it into reality. We also have to understand that if we do nothing, it will be as if we foster these delays and the uncertainties patients struggle against. And last but not least, we have to understand that, as it was said before, it's a team job. We have to work together and take the next steps forward together. Thank you.
Thank you very much. Do we have Mr. Tsoukalos? Okay, I hope you can hear us now and we can hear you.
Hello.
So over to you. Hello. Please go ahead.
Hello. Good morning. I'm sorry that I'm not here there with you. I'm in Poland. So I enjoy already the discussion. So let's turn now to Greek. So
we know that cancer is an important public health issue. Recently, developments in oncology have been tremendous, and we know that currently we have advances and innovative therapies and treatments that relate both to early detection, prevention, and treatment of cancer patients. However, the best way to use all the above developments is judged by whether we have a comprehensive NCP, both for early detection and prognosis of cancer and for proper treatment of the disease. Regardless of the innovations and the developments in oncology, the value of prevention and early detection remains priceless. For instance, a healthy lifestyle, working out, quit smoking, as mentioned before, protection against sunlight, screening tests, mitigation of stress-generating sources, let's say, and secondary prevention and detection of cancer is also important. For instance, colorectal screening tests, breast screening tests, etc. So the contribution of an NCP is very, very important by means of healthy lifestyle promotion courses or training courses in schools for drinking and smoking, and with universal screening programs for the general public. We also know that the best way to deal with a cancer patient is to have proper classification of the cancer and early diagnosis. We know very well that the tissue-based identification of the tumor is very, very important. In our case, this applies greatly to the incidence of lung cancer. So, in order to properly deal with solid tumors and oncological patients, we need a multidisciplinary approach. It's a very complicated process, it's very demanding, and it has to be based on the collaboration of different professionals from different expertise. So an organized work of medical board or a medical team has a huge impact on the survivorship of the patient. So the NCP also in this regard is very important. For instance, when it comes to the operation and monitoring of how medical boards operate in the case of oncological patients. We must never forget that every patient is individual. It has his or her own particular characteristics and psychosomatic identity. We have to apply the principles of oncology, following the principles of holistic medicine, personalized and precision medicine, and this should be the basis of modern oncology. However, currently, the best finding prognostic and early detection biomarkers and being quick in administering a treatment are pending issues and represent major challenges for the oncological community. And of course, we need more clinical research and studies for that. In some of these challenges, AI has come to the rescue. It's a very important development, and it has been used in various oncological segments abroad. Ending. Given the above, we see that the value of an NCP is undisputable. That's why the Hellenic Society of Oncology, in collaboration with the Hellenic Federation of Cancer Patients and other organizations, and always in collaboration with the Ministry of Health, work together to build the National Cancer Plan for Greece. Ending. Some of the achievements of the work of our society are the following: the early detection policies, the Neoplasma register, which is now a reality, and the regulatory framework for the use of biomarkers. Thank you very, very much.
Well, thank you very much indeed, all of you. Really very interesting panel and so many questions raised. And unfortunately, we have very little time now for discussion, for various reasons. We've got about 10 minutes. And so I guess I'm going to play devil's advocate here from the chair to ask a question that has come up, which kind of poses itself, really. Several questions. One is about the kind of balance between individual responsibility, and which many of you talked about, individuals' responsibility for their own health, and the role of the state, I guess, because we're talking about here, from the beginning, Mr. Albrecht, about designing or transforming into national legislation education or about tobacco, about drinking, about smoking, about nutrition, and so on. And I guess the question is, how far can we go in this direction without having a kind of counterintuitive result? Without, if people think about a nanny state that is now extending into so many areas of people's lives, we know that policy doesn't always have the outcomes that we desire, and sometimes has counterintuitive outcomes or generates a reaction. So I guess that's one question. What is the balance here between education and promotion of education in all these areas and intervention or putting more demands on the population? The other question is also about a balance. What is the balance between the kind of national and the EU level here? Because obviously health is one area in which member states have
autonomy, largely, to determine policy. But in this particular area, we are talking about the creation of national cancer plans and member states. Obviously, there's not a one-size-fits-all approach, but clearly there's lessons that can be learned from good experiences in some places. So these are questions about balance between individual and the state, between how Greece develops its own plan according to its specific circumstances and what role the EU can play here. And I have a final question, and I'm doing this because you can pick and choose what you answer because we haven't got much time. My final question is about screening and how we evaluate the efficacy of different screening programs. Somebody mentioned that the screening of colon cancer has been very effective in terms of, we can see in the numbers, in declining, in early detection and so on. I know there's more, and maybe the cervical cancer and the HPV, something that the UK has big experience of, effective results. I think there's more controversy probably about the breast screening programs and the efficacy of those programs. So how do we evaluate those as well? So there's 3 questions from me, and you can choose whichever you want to answer. There's many other questions that got raised. Unfortunately, we will carry on through the day and we will try and address those, but we can't address all of them here. So maybe we'll start, do we have our online still? Yes.
Yes.
Yeah, so maybe I can start with you. We'll go.
Yes.
Yes. Which question would you like to answer?
Yes, I would like to answer the question about the education, mainly for young people. I think, and also πιστεύω και η εταιρεία ογκολόγων.
I believe, and HESMO as well, and the ministry, we all believe in the importance of education and education on health education rather, for young people. There were some pilot programs for smoking, stopping smoking, something that we also organized in partnership with the ministry, ESMO did. And the point was to make the message known about better, healthier lifestyle in relation to individual responsibility as well. And there was the argument raised that these efforts, especially among young people in schools, high schools, and at universities, maybe they could have they could be more effective. And these young people can be the ambassadors and relay the message to their families and have a multiple effect, especially to improve prevention and quality of life and increase responsibility in terms of health issues. And of course, all that would lead to less cancer prevalence.
The Kapitanakis.
Thank you once more. In relation to screening, I presented a slide earlier about the gap between policy and real life. And that's where I mentioned that the role of patient organizations is to bridge this gap in order to have the result, the performance that we want. And I believe that participating in the design process and the organization process and implementing those campaigns by the cancer patient organizations, this can help our outcome and can give a dimension that will be closer to real life conditions. In relation to personal responsibility, individual responsibility, cancer is something that all of us need to, in order to be able to address it, all of us need to make a commitment and a degree of compromise as well. So there is individual responsibility, there's social responsibility, and all of us need to accept them, civil society and the scientific organizations alike. And let me say that the pandemic showed us the way, and the way forward is that we need to act united as Europeans and look at how we can address certain issues. We don't really have a national plan, an NCP for cancer, and that truly diminishes the effort that is being made. But it is also an opportunity and a challenge, because 4 or 5 years later, I believe that what we are going to create is going to take into account the problems and all the that have not been dealt with.
Schedule. So maybe to keep now maybe to one question. So let me ask Mr. Cannabos now to.
Just one, μία πρόταση μόνο.
Just one sentence on screening. It is effective and cost effective, but a necessary condition for that is to have great participation. What society needs to do, what the states needs to do, is to have those KPIs that we mentioned, so that over time we are able to increase the participation of our citizens, the people who actually go to do the tests. Thank you.
Mr. Hofmarscher.
Yeah, maybe I can also just quickly say something about screening. I mean, the very point of screening is to detect cancer as early as possible, because the earlier we detect it, the greater the survival chances, but also the cheaper it is to treat a patient. The treatment costs are lowest for an early stage cancer than for a late stage cancer. But I think in relation to screening, the programs that exist and are recommended by the WHO, we know them. The question for me is actually how we will deal with women that have been vaccinated against HPV. When they eventually reach the age of being screened, should we screen them? Because the HPV vaccine will protect them. So I see very little benefit of screening them. And it will no longer be cost effective to screen millions of women, knowing, based on the evidence from all of the HPV real-world data that exists, that they won't get cervical cancer. So the question is, at what point in time are we going to abandon cervical cancer screening, actually, which also saves money to the government?
Thank you. Yeah, very interesting point there. So, Mr. Breda?
Yeah, on screening, very simply. So WHO, there's 3 cancers, right? It's colon cancer, breast cancer, cervical cancer. This is where the evidence is. The cost effectiveness was very well pointed out. The others, at this stage, at least while the evidence builds, they can do more harm than good, and they could cost a lot of money. They will be more clinically focused, therefore maybe not so much of screening. So these 3 for sure, I think at this stage better to focus on making sure that these work really well. That would be our point. On the education, it's very, Adam Smith, the father of economy, and this is the economist, he said, you should use price policies to target behaviors that could be harmful for the individual and the society. So I'm a strong believer in education. We need to educate about healthy diets, physical activity. On tobacco is really targeting the industry, is making sure that we implement price policies, higher costs, that we actually help those who want to quit smoking, do it in the context particularly of primary care, has all been described. This part of the WHO FCTC. So I don't think it's about really a nanny state, it's about the balance. We really need upstream and downstream measures. Yes, education, very important, but also we need to use other policies which are related with access. Otherwise, people who are from, for example, vulnerable groups, and they cannot, for example, go out in their neighborhood and do physical activity. How are you going to address that? So you need system-wide measures, not just the education. So yes, absolutely education, but clearly for behaviors that affect health determinants is not enough. Thank you.
Thank you. So last word to you, Mr. Albrecht.
Thank you very much. I will continue where João finished, and I will touch a topic I'm sure is very close to your heart, and that's commercial determinants of health. So the point is that, yes, we talk about nanny state and we talk about individuals' responsibility, but also individuals' right to choice. We know from Google-driven marketing approaches and so on, that of course our choices today are not always based on our own decisions. They are guided, and the same applies to some of the unhealthy habits. This is particularly delicate in terms of new tobacco products, especially nicotine products, where we see that the industry, with the excuse of deflecting people from smoking tobacco, actually causes new dependencies on nicotine. And we have now population-based evidence that these so-called safe safe nicotine practices are actually conducive to smoking. So what we get now with vaping is they don't start smoking at 15, but they start smoking at 17 or 18. So this is everything that we gained. So this is absolutely, I'm a very strong advocate against vaping. This is no safe option, not to mention other negative stories. So final word, it is important to equip the population with the knowledge and the information to make informed choices. That's all.
Excellent. Okay, please join me in thanking all our panelists. Thank you, Mr. Tsoukalos, for joining.
Thank you very much.
Thank you. We'll have a quick photograph and we'll move. We've got one more session before our networking coffee break. So I'll introduce that panel in one moment. Okay, the final panel now before the break is looking at Greece's investment in cancer prevention. Just to say before we start that Irini Ayapidaki, the alternate minister at the Ministry of Health, will not be able to join us, unfortunately, via connection, because she's in the parliament and she has a problem now, technically, to join us. But let me welcome to the stage our distinguished panelists, Konstantinos Syrios, Professor of Medicine and Oncology at the National and Kapodistrian University. Welcome, sir. Please have a seat. Theodoros Iorastos, Professor Emeritus of Obstetrics and Gynecology at Aristotle University of Thessaloniki, will be joining us via connection. Hopefully that is established now, that connection. Amanda Tsiri, Professor of Medical Oncology at the National Kapodistrian University of Athens, Chairman of Internal Medicine at Attikon University Hospital, is going to give us a recorded message. We have Nikos Iosif, President of the Human Health Intelligence Organization, Chief Executive of Brains ICS. Welcome, sir. And we have a commentator, Manuel Salustros, Associate Professor of Oncology at the University of Thessaly. Welcome. Please have a seat. Okay. Again, we're going to proceed, as previously, with some opening remarks from our panelists, and then we can have a conversation. So,
let's start with Mr. Syrios. Over to you.
I
think we all know that prevention is better than cure. We all know that prevention policies and programs have been turned out to be very effective following clinical studies when dealing with cancer. And I'd like to link that with the previous discussion. That's why I'm saying that I was quite alarmed when I heard someone saying, with no reaction, that there is personal responsibility. It was mentioned before. Prevention is an issue, is a matter of personal responsibility, of individual responsibility. But what does this mean? Does this mean that if you don't participate in screening tests or prevention programs, which means that he's not or she's not responsible, so he or she is not entitled to care? We say that prevention is important, it saves lives, it's great for a patient and for the society. The risk is moving to the other side of to the other end of the pendulum and punish those who do not take care of their in terms of prevention. So, and that's something that happened yesterday. A young boy of 20 years old was speeding. He was drunk. He went way over the speed limit, and in Sparta he had a crash and he lost his life. So shouldn't this person be allowed and entitled to health care when he was transferred to the hospital? Should we punish the smokers when we have tobacco companies promoting their products everywhere, supporting and sponsoring all types of events, when the tobacco companies is way more active than other social stakeholders? So yes, screening is important, yes, prevention is important, but no to punishments. Actually, a politician tried to introduce the term tax on sins, which means if somebody smokes, then he or she has to pay a tax for his sin that will be used for his treatment. Should this tax be also applied on chocolate eaters? Should this sin tax be paid by those who have more than 7 sexual partners? Because we know that when you have more than 7 sexual partners, the risk for HPV increases rapidly. So let's stick to the scientific stuff. Let's get serious. Let's remain humane. And personal responsibility, individual responsibility, yes, but it's up to the state to train, to educate people, nothing more. Then it's a matter of free will. That remains the cornerstone of our civilization, and I do not accept putting that aside.
Excellent. Important points, I think. Yeah, that probably don't, get said too often in this era of sin taxes, which we have everywhere. So yes, thank you very much for that. Now, do we have the connection with Theodoros Iorastos?
Ναι, μα ακούτε?
Can you hear me? So, thank you very much. Thank you for the invitation to be part of this really interesting meeting. Firstly, allow me to fully concur with what the previous speaker said, Mr. Syrigos. I believe that individual responsibility is not individual when it comes to health. Responsibility lies in the hands of the state, of the government, that has to persuade all citizens to follow correct practices. It's not it's unacceptable talking about punishing someone who's not responsible personally. That the physician, the doctor, is there to take care of the patient, nothing more, nothing less. Now, talking about prevention, it was mentioned before that the 3 types of cancer that WHO considered as very important for screening tests are the lung cancer, cervical, and colorectal cancer. But there is one type for which the WHO, for the past 5 years, I think it was 5 years ago, the WHO has said that the medical community will be able to eradicate this type of cancer in the coming 100 years. And we're talking about cervical cancer. So currently, it is a gift from the skies that we can talk about secondary prevention of cervical cancer, the same way we do for breast cancer and colorectal cancer, but we also talk about primary prevention, and this is the vaccination. Vaccination protects an individual from getting affected by this virus, and if you have no virus infection, then you have no cervical cancer. It was mentioned before that if we vaccinate everyone, and I'm talking about the children who from the age of 9 onwards should be vaccinated against HPV, then in a few years' time it won't be cost effective to have the screening tests. On the other hand, there will be no need for screening tests since the virus will not be transferred from one individual to another because of the full coverage of the vaccination program. Let me say at this point that the HPV vaccine has been introduced in Greece in 2008. 17 years later, although we have no official data and statistics, the coverage against HPV is no more than 50% in girls of less than 15 years old. The WHO has asked for this particular age group to reach 90% until 2030. You know the 90-70-90 strategy dictated by WHO. The organization believes that if we have 90% of the girls below the age of 15 vaccinated by 2030, and if we have 70% of the girls tested with 2 screening tests by then, and if we treat properly 90% of women with cervical or pre-cervical cancer, then we will be able to eradicate this type of cancer. And there are countries which in the coming 5 to 10 years will have reached this remarkable milestone to be able to say that we have eradicated cervical cancer, which means less than 3 cases in 100,000 in 100 women. So in Greece we have reached 50%, and this is because health professionals try to inform the general public, but this is not enough. It is the government, the state, that has to inform the people about this type of cancer, which for the very first time in the history of medicine we can eradicate, we can dispose of. And by means of the vaccination we might be able to get rid of 5 or 6 major types of cancer in the future. So it is up to the state to let the people know that yes, all children from the age of 9 onwards should be vaccinated. The guidelines are here, but apparently this is not enough. Also, the state should force or make it mandatory to the colleagues carrying out the vaccination to keep a log of that, because currently there is no data on immunization coverage against HPV in Greece. Last but not least, the issue of screening. There is a lot of discussion over the past months in Greece. We know very well that the Ministry of Health has launched an action, not a program, on screening, because a prerequisite for a national screening program is to have an ongoing, to secure ongoing funding with no end date. This action that was launched in Greece a few months ago will be funded by the RRF for the coming until for the next 9 months. It's great. It's a positive bit of news, but it's not a long-term program as we know it. It will end in 9 months' time. The ministry believes that the money will be found, the funds will be found in order to go on with this action, but we are 8 months before the end date, and there's no such case. It's not probable that will happen because Greece is one of the very few countries in the EU with no cervical cancer screening program, and for other types of cancer as well. Second point, my last point, is that we have the issue of inequalities. Greece is a particular country in terms of geography because of the layout, the insularity. Women there do not have easy and secure access, guaranteed access to health units. That's why we have mobile units operated by the ministry. That's something a bit problematic. Many initiatives have been taken, they failed to deliver, and especially for the case of cervical cancer, it has been found that the specimen, the sample for the test should be taken by the individual itself. In the US, in the UK, and elsewhere, they have established a program of self-sampling. So the woman herself may take the stylus and use it in order to take the sample. This will cover will help us overcome many problems. And although perhaps this will be the case in the future, this is not the case so far. I believe that there are steps taken forward also for this self-testing process, but we are still far away from the WHO dictated goals of 70, 90, 70. It would be good to have a proper wave of raising an effort to raise awareness amongst the general public. And as I said before, whatever we successfully did against COVID 3 years ago when the state took on raising awareness, we have to do the same thing for other diseases as well, with cervical cancer being the first and other HPV-related cancers. Thank you very, very much.
Thank you very much indeed. Lots of ground covered there, some important questions. So I think we're now going to hear a recorded message from Amanda Tsiri, Professor of Medical Oncology at the National Kapodistrian University of Athens. Do we have that message to play, please?
Apologies, we don't have sound right now in the booth, the translator's booth. Okay. That are going to talk about prevention. Unfortunately, I'm traveling. It wasn't possible to join you. So cancer has become a pandemic. This is the information from Globocom from 2020 that show that approximately 20 million new cases, cancer cases, were diagnosed, whereas we've seen about 10 million deaths from cancer for both sexes and all ages. So this data shows, unfortunately, information is less optimistic for the future. So 2040, we expect to diagnose approximately 30 million cases of cancer and 16 million deaths from cancer. It seems that approximately 44% of deaths from cancer are due to known causes that can be prevented, such as factors, behavioral factors, smoking, alcohol, bad diet, lack of physical exercise, environmental factors such as pollution, and also metabolic factors, obesity, for example, and diabetes. This is related to many cases, many cancer cases. The information from International Agency for Research for Cancer tie cancer to specific causes, and based on this information, in 2021, Europe's Beating Cancer Plan has set some goals. For example, an environment free of smoke, smoke-free environment, reduction in alcohol consumption, the adoption of healthy lifestyles, healthy diet, exercise, reduction of environmental pollution and exposure to radiation and hazardous substances, and also prevention of cancers related to
Το κάπνισμα σχετίζεται με
cancers related to infection. So smoking is causing many deaths, not simply from cancer, but also from other lung diseases. So stopping smoking does not eliminate the chance of suffering from lung cancer. But the news for the new smoking products are equally disturbing, such as electronic cigarettes, e-smoking. We have cases related to many new cases related to this type of smoking in 2018, and we need to consider that vaccines are also important in prevention of certain types of cancer. For example, the HPV vaccine, which was adopted early on by Sweden, resulted in a reduction 64% of the risk of having cervical cancer if women are vaccinated before they reach 20. In relation to women that have not been vaccinated, the vaccine is available to both girls and boys from the age of 9. And aside from cervical cancer, we also have other HPV-related cancers. So it is reimbursed to have the vaccine for boys as well. The World Health Organization recommends screening tests for cancer, cervical cancer, breast cancer, and colon cancer. Also, people with a specific risk profile, for example, people that have the BRCA mutation or heavy smokers. Also, prevention becomes more personalized for these people, for this individual. For example, for heavy smokers, the recommendation is to have a screening test for lung cancer, whereas those who have this mutation, the BCS mutation, they need to screen for breast cancer and other gynecology-related cancers. There is a degree of, there's no uniformity in the European Union in terms of how member states comply with those screening test programs. For example, for the screening test for breast cancer, we have between 6 to 90% among member states, which is rather worrying. So the doctor of the future must focus on prevention and not on drug treatment. I would like to thank you.
Well, thank you for that message.
Over now to Nikos Yosif, President of the Human Health Intelligence Organization. Welcome, sir. Can I just say that the clock is no longer working. Here hasn't been working. Now it is. Okay, good. Thank you.
Hello, everyone. It's a great honor for me to be here among you for the second consecutive year. I'd like to start by apologizing. I apologize to the translators, and then I apologize to you because, unfortunately, I'm going to switch up what I had planned to say. On the one hand, because we need to address certain things that we heard, and also, as the minister mentioned, as it happens, I'm one of the people working with the ministry and the deputy minister for the national screening test. So in the absence of the deputy minister, I need to clarify a couple of things. So first of all, these are not action plans. They are national programs for screening tests. They are national programs, national screening programs, because the RRF actions have an expiry date, and those programs are not only actions of the RRF, they are funded by the RRF, but they have passed by law, and the money for them are going to be available after the RRF funds run out, and we will continue to implement those programs. Secondly, in a country where up to 2022 we didn't have any screening tests, any national screening tests, now we have 3 such programs, and I would say let's stop judging and just get on board so that we can continue with these programs, continue to improve them, and continue to get results out of them. So the results that we have already is remarkable. Just for breast cancer, the beneficiaries are approximately 0.1 million. Women between the ages of 45 and 75. It's about women that maybe have not done any screening tests in the past, or maybe they didn't have any disease. So theoretically speaking, for a population that you consider to be healthy, you can find, after approximately 600,000 screening tests, so approximately 1/3 of the population, that can be an important result. If we continue to have more women passing, doing those screen tests, we will continue to find this virus 3 plus. So if that's enough or not enough, I cannot answer that. We need to get all of us on board, and then it will be enough. All 3 programs, screening tests, are for approximately 8 million beneficiaries. 8 million people can undergo these tests. I'm not going to talk about each of them because it is important to address a couple of things that we heard today. First is about participation. Those who talked about the participation is important. It's a main factor judging the success of screening test program. We need to have that participation, and it cannot be left to individual responsibility. We need, the state needs to find the ways to educate people, to change the mentality and convey the message about the value of preventive tests, screening tests. And what we do right now is we're sending information text messages to those individuals that have electronic prescription services, and we also have a campaign running in mass media for those screening tests. Maybe it's obviously not enough, but it's the first step. The second step, and if you look at the description of the programs, of these 3 programs, We have some intermediary surveys for the participation of the citizens. So we are going to continue based on the survey results, and we can identify the population groups or the areas in the country where the participation is low, and we can target them so that we can increase citizen participation. Second, it is only normal that the number one influence to citizens comes from their doctors, not from a text message, not from a TV commercial. So it is already planned, and we're going to enact it in the future to involve the personal physicians, the pharmacists, and those professionals in public healthcare centers so that they can promote citizen participation in screening tests, and mainly to those citizens that don't have electronic prescription services, and we cannot really inform them in any digital fashion, so they need to be informed through their doctors. Now, let me also mention that the citizens that have these electronic prescription services, the participation among them is 40%. Those who don't have these electronic prescription services and can only be informed through text messages, the participation rate there is at 10%. So there is a significant degree of significant difference. Also, another important thing, knowing how public healthcare system works, in order to increase participation, we need to solve the problem related to the mentality of the people. It's very strong among lower class symptoms or in areas, rural areas of Greece. People don't go to test because they are afraid that something is going to be detected. So we need to guide those people, we need to provide support to them so they can actually participate in those screening test programs. Also, another important factor for success is the quality of the services provided. I think we've not discussed this yet, and I will try to be quick. I see I don't really have any more time, but I'll try to say that all three programs that we're running today have very high quality standards for the lab and imaging tests. This is why we had some delay in order to define those criteria, and we continue to audit the labs and control the labs that are doing this lab and imaging tests, so we can ensure the accuracy of the results from the tests. The second thing is that we need to have a fast transition from the first screening test to the second, especially for when there is something found. And the only way to do that is to have the full participation of all the doctors, all healthcare centers, so we can provide the service to our citizens that need to undergo further tests. Without this participation, it's going to be a problem to implement the whole program. Also, we need to use technology. Technology is going to transform prevention. Already with AI-based diagnostic tools, we can, for specific types of cancer, increase the quality of the diagnosis and avoid false negatives. And also, through the management tools, big data that is available at the national patient folder, electronic folder, we can create secondary groups of beneficiaries, not only based on age criteria, but based on their clinical criteria, genetic criteria, or geographical criteria. I think that the future is going to be better and better, and all of us together, if we work together, we can be successful for the national healthcare system and for our citizens. Thank you.
Thanks very much. Indeed, that was very useful, especially given that we didn't have the alternate minister here with us. So finally, over to our commentator, Mr. Salustros.
Thank you very much. Πρόσκληση και εφέτος και για την τιμητική θέση σχολείου.
Thank you very, very much for inviting me, because it's really honoring to have me as the commentator in a panel including these esteemed colleagues and experts. This means that I have a very limited area to maneuver in terms of my comments. I have the previous speakers have covered a lot of ground. So allow me to comment on the progress already made in our country with respect to cancer prevention. The smoking ban law has been implemented and exceeded the expectations of many of us, and this has been a very important step to this direction. The NCPs for breast cancer, colorectal cancer, and cervical cancer, as mentioned before, are very, very important actions that we hope they will continue. And allow me to add the biomarkers reimbursement in the case of hereditary cancer. This is also important because it will help us identify individuals and families, very few amongst the population, but still these are the people who have faced the highest risk of developing some neoplasms. These steps evidence the importance of political will and the will to implement certain things. So it is important for the state to make up their mind, to decide that something should move on, organize the actions, and in the end, assess the said implementation in order to have further improvements. I totally agree with Professor Isirigos. There should be no punishing aspect no punishment against those fellow citizens of ours who ignored, let's say, the text message they got for the screening tests. The COVID model delivered back in the day for the vaccinations against COVID, but pre-screening tests is something a bit more complicated. So let me give you a couple of examples. In order to understand that the text message, the update is important, but the involvement of the primary health care professional or the doctor or the pharmacist is even more important. So a text message to ladies in the age of 65 up to 75 will cover a big part of the population, but it should never leave a 40-year-old lady be complacent on when her mother has been diagnosed with cancer. This lady is not within the realms of is not eligible for a screening test, but she is highly risky. And as it was mentioned before, if you have had a colorectal examination in the past, there's no need for an examination for hemoglobin in your sacrament. And I think we're a bit hasty because we went straight to the level of the citizens. Allow me to say a few things about the breast cancer screening process. We should have been much quicker in organizing the breast cancer, the early detection centers, in which the mammography should be accompanied with some evaluation by experienced professionals in order to create the diagnosis path and the cancer journey. I don't know what are if the statistics you shared before are equal to the global average, but I think that false positives and the stress to ladies will be mitigated if we have properly operating breast cancer early detection units. Now, last but not least, our responsibility when complying with the guidelines for screening tests. I think you have all, you all know. You have some examples from your own medical practice of ladies in the post-menopause period. They have a mammography, then they have another test. And these tests for the ultrasound might give specific conclusions if we have women with dense breasts. If we have such a case, then mammography should be more frequent, which means that the personal responsibility and the practices for universal implementation amongst the public might not deliver in this case. I dare say, yes, we have done the first step. We are ready to have more improvements. Screening as a process becomes better and more effective. We're going to have genomics entering the game soon. We will be ready to further optimize the process and the implementation of novel techniques in the future, and this will be reality soon. Thank you very, very much.
Okay, thank you very much, everyone. We've minutes now, so I wanted to focus on two things really: how to address some of the inequities, which some of you have talked about already, of inequities in terms of class, social groups, also Greece's fragmented geography and so on. And then secondly, how we can improve the quality of the screening and encourage participation. But Professor Syros, I wanted to take advantage of your presence to ask you to talk about something we haven't really addressed so far, which is the burden of lung cancer in Greece. If you can tell us a little bit about that and what sort of inequalities have been identified in specific regions in terms of access and services provided and so on, and how we can go about what would be a good approach to try and reduce some of those inequalities.
Thank you for the question. We must never forget that one of the most important factors for accurate detection of all types of cancer is the financial condition of the patient at an early stage during their childhood, not when they are adults, I mean when they're children. So by definition, all cancers, all types of cancer, are deeply class-based disease. If you truly want to tackle that, if you want to have primary and secondary prevention in place, then one should start by improving the quality of life of your society as a whole. Through this improvement, this improvement also includes education, training, in order for a person to live healthily, to take part in screening. I'm talking about training or education, not enforcement. You asked about lung cancer before. In this case also, lung cancer screening varies significantly compared to other types of cancer, where screening has been successful. In the case of breast cancer and colorectal cancer, all humans, they live in a certain place, they live in a certain way, they have a certain level of education. So all people have more or less the same probabilities to develop breast cancer and colorectal cancer. So approaching them and telling them about the screening process should be the same, like text messages, etc. But when it comes to lung cancer, it doesn't apply. Those who are more risky to manifest this disease, in the Western world, I mean, because in the third world there are other things that apply, are the smokers. So amongst us, we have many companies, many executives. Who smoke the most? Is it the executives of these companies or the warehouse workers and the drivers of their trucks? Who smokes first? Is it the owner of a factory or the minimum wage workman? Who smokes the most? The ones living in Kifissia, the northern suburbs of Greece, or the ones living in Perama, the shipyards? So we cannot have the same message conveyed in the same way to all people. What are the possibilities of a shipyard employee to spend time with lung cancer screening following the text message, knowing that this would mean losing one day's work, 1 day's wage? So we have to come up with new policies. Do you know that people suffering with any psychological or mental disease, and even those with depression, right? They represent 25% of the population of a Western country like Greece. However, they consume 55% of all tobacco products. So how are we to approach these people? Is it by means of a text message, an SMS? How do we approach those people living in mental clinics? So lung cancer is a different disease and we need different approach, an out-of-the-box approach. And this has nothing to do with what we're currently doing in Greece, okay? It's a global issue. The success of screening tests against lung cancer globally is below 5%. This means that those who truly need that, no more than 5% of those who truly need that take the tests. Some others who live in California or make some amazing amounts of money, or they do 20 kilometers of trekking or walking or running, and they never smoke. They are the top ones attending the screening tests. Yes, but they are not high-risk individuals. That's why lung cancer screening tests are unsuccessful. It's a very important disease, an endemic one, if we check the statistics globally, but we need a different approach for early detection.
For that. We've got about 5 minutes now, but it was great to hear because we haven't really discussed this, and I think some of those points have a more general application anyway in relation to other cancers as well, despite the very specific, nature of the lung cancer. On this, maybe we can focus on how to improve the screening programs. Yesterday I met with a female friend of mine, Greek lady, who was telling me that she'd had 3 messages, reminders to make screening appointments. I myself get these all the time in UK as well. And actually, I would say they're quite effective in the sense that you're meant to go and do these things. Generally, they're all quite unpleasant experiences, and we probably need to be reminded to do that. I mean, the good thing about the HPV and the vaccination now is that you've got a captive audience in the schools, and it's not particularly an unpleasant or invasive experience, whereas for most women, I would say that cervical screening, has been quite an archaic and unpleasant experience for most people, and it's good to hear that you would have thought that we would have had improvements before now, so it's good to hear that we are now seeing improvements in terms of self-screening. There must be easier, better, more pleasant ways to do this, but generally it's been an unpleasant experience. So, we need to improve the quality of the service, ensure the funding, but we also need to make sure that we are improving the actual techniques as well, if we want to encourage people. So I just want to give you all the opportunity now to, to talk about how that might be done. A lot of progress has been made in Greece. As you say, now we have the 3 screening programs. And we need to improve the take-up rate, the participation. So just some final thoughts really about how we can make sure that happens. So maybe we can turn to our online guest, Professor Ierastos.
Ναι, ευχαριστώ πολύ.
Thank you very much once again for the question. I'm so glad that you mentioned the self-test or self-sampling method. It's the future against cervical cancer. For those years that this will be the case, because it seems that vaccination will make it obsolete in a few years' time. Now, in reply to the comments before, allow me to say the following. Currently, there is an action in Greece, not a program, which is something very positive, yes, but it's an action. And this is proven by the following fact. I'm a clinical doctor. If I carry out an HPV test on a lady that has received the SMS and came to my office, and if the HPV test is negative, what am I supposed to tell her? What is she supposed to have it again? There's no written rule about that, no norm. So there is no program saying that, okay, you have the test, and in 5 years' time you have to undergo this test again. If a lady undergoes a mammography and it's negative, when should the doctor tell her to come back for a new one? It's nowhere written. So action is the term used, dras in Greek, is the term used in the law. The law passed some 2 years ago. So it would be a blessing to have the government finding the money needed and set up a long-term program for the coming, let's say, 30 or 50 years. Currently, there is no such thing. Second, the participation or the involvement of the state. You said that we all have to join forces and join the ranks in this struggle, which means health professionals, patient organizations, as rightly said by Mr. Kapetanakis before, and the state. We, the health professionals, do what we have to do. We let people know about that. The same happens with patient organizations. But don't you think that the state should also raise awareness amongst the women who know that they have to go a pap test, and she gets an SMS for an HPV screening test? She knows nothing about this HPV. What does this HPV stand for? So she has to be informed beforehand. And these ladies get the test message and they go on to have again the test pap, or pap test in Greek. There is no official information. The COVID case has been very telling in the state, in collaboration with health professionals and patient organizations, let the people know. The 17 years after we started, after the vaccines against HPV has been found, 17 years after that, the state has failed to let the people know what this vaccine is about, and we are now no more than 50% of vaccine coverage. And according to the statistics by the Health Ministry, we want to reach 90% within 5 years, although it took us 17 years to make it as high as 45%. Thank you.
Ask you, I know you want to come in. Do you want to say something briefly now and before, just very quickly?
I think that whether this is an action or a program, this is something only for the politicians to get their teeth on. It means nothing, but we have to have a starting point. But to corroborate what Professor Agorastos said, if I currently have, a CT on my breast, and I find that my arteries are blocked by 90%, but I have nothing else found, I don't know what to do with him. I cannot refer him for something else. Nothing else is scheduled. I have to improvise or to take initiatives. So the action is filled with gaps. The initiative or the program, you name it, whatever you like.
Joseph, maybe you could tell us whether you think the development of these digital tools will make a significant difference.
It seems that I wouldn't say we have failed, but we were not successful in raising awareness, it seems. If you go to the website and the technical sheet of the program, we mentioned that breast cancer, screening test every year, cervical test for the 21 to 29 once every year, for the others once every 3 years. It's on the website, it's in the informational material we have prepared, and then you get the referral. Colorectal cancer, yes, there is a guideline. Every 5 years, those who have had a colorectal test, they receive no message. So everything is there. The websites are the following: colon.gov.gr, mastografia.gov.gr, and testpap.gov.gr. Let me also say that programs are screening programs. This is the endpoint, the screening. these programs do not fund the next steps. It should, yes, of course, they should. The doctor is right, but these specific programs are screening. This is something you shouldn't say. That's an insult. That's an insult. That's something a politician should say, and I would go out and I would leave the room. This is not something that should be said in this room. So I find no cancer case, the patient is dying, I don't care. This is the end of the program. That's a shame. No, allow me to say something, allow me. Let me complete. Maybe you should rephrase it. Firstly, please listen to my entire sentence, my entire phrase. I said that these screening programs are not the end of the treatment pathway. The program might stop, but the pathway is here. It's up to other programs, and I cannot. So, if I find this person having blocked arteries, I'm a GP in Chios Island. Have you given me instructions on the website on what to do with him?
A kind of argument on the stage.
Yes. Do you have something on the website? What are you going to do? You are the doctor. You are the one to decide. Thank you. Thank you. Okay.
Yeah. To finish your remarks, please. His remarks.
So to summarize this argument, they're not having a disagreement. I agree with the concern of Mr. Sirigos, and that's something I mentioned before in my opening remarks. We have to start from the structure. We need a structure that will accommodate the patient, the female or male patient, run the screening test, and identify the journey, the pathway for the diagnosis or the treatment. Currently, we are working on the voluntary mode. It's a non-mandatory screening, and we're discussing about the next step following the result of the test, which sometimes it's vague, uncertain, or maze-like for those who undergo a screening test. I believe that the first step has been taken. It might have been a bit hasty, but let us accept that the first step is half the way. Taking the first step means is covering the half the distance. Let's hope that the coming governments, the current leaderships will improve and expand this program, because we need it.
Thank you. Well, unfortunately, we have come to the end of this session. We've gone a bit over time. Obviously, some strong views being expressed here, but I think we've also heard that there is a clear pathway here. We have established screening programs now. Everybody involved in this discussion here today is has a keen interest in making sure that those are rolled out properly and improved. So thanks all of you, including our online guests, for the discussion this morning. We've got a networking break now for half an hour, so please enjoy your coffee and we can carry on these discussions. Thank you. Please join me in thanking our panelists.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμή του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτή. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμή του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία αιχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με...
Please to take your seats because we're going to start our next session very shortly. So, yeah, please grab a seat and we'll get started. Thank you very much. Okay, thank you, ladies and gentlemen. We're going to get the proceedings underway again. We have 2 sessions now before we have our lunch break. The first session is looking at the value of early detection, and we're going to hear about some interesting case studies during this panel. So I'm going to introduce our speakers one by one. We have an online connection to start with. That is Yannick Romero, who is the Senior Knowledge and Advocacy Manager at the Union for International Cancer Control. Welcome, Yannick. Now, to join me on the stage, may I invite Corina Pateli-Bell, who is the President of the Fair Life Lung Cancer Care, to join me, and please take a seat. You're welcome. Kostas Athanasakis, Assistant Professor in Health Economics and Health Technology Assessment at the University of West Attica. Welcome, sir. Take a seat. Sofia Lampaki, Reader in Pulmonology, Lung Cancer at the Pulmonology Clinic of Aristotle University of Thessaloniki. And we have our commentator, Hippokrates Korantzis, medical oncologist at St. Luke's Hospital in Thessaloniki. Welcome, sir. Okay, and let's get started. We're going to go first to our online connection, Yannick Romero. Over to you. We're going to hear a few minutes from everybody and then have a discussion. Thank you.
Thank you. Kalimera says. Can you hear me well?
Yes.
Thanks. I would like first to thank the organizers for giving me the opportunity. And sadly, I cannot travel today to Greece. And Greece is really close to my heart because, it's really my second country. My wife and my children are Greek, so I'm really missing their country. I'll be back very soon. Today I want to present the work that we are doing within the Lung Cancer Collaboration, and I will share a few slides if you allow me a second, and if you can see them, I hope so. So today I wanted to really, in terms of showing that what we do at UICC, we are based in Geneva and we are addressing cancer control as a whole, but we have a program which is called the Lung Cancer Collaboration, really to drive the commitment of coordination between the international and regional aspect of addressing lung cancer and specifically lung cancer survival. Really briefly, and I think that it's an important slide to show here, is our membership is composed of organizations that are addressing a whole range of different aspects of the cancer control community, academic institutions, cancer centers, cancer patient support groups. We have 40% of our member organizations that are cancer patient groups, professional associations, and so on. So since, these are the latest numbers, but around 1,200 member organizations are members of the UICC within 170 countries. So we have an international reach, and we work together with our members, and HELOC is one of those members. And talking back to lung cancer and early detection of lung cancer, these are few numbers about lung cancer. Almost 2 million deaths from lung cancer out of 2.4 million cases annually. So it's really above all the other cancers. It was shown that early diagnosis really improved the survival rates from less than 10% at stage 4 to about 60% at stage 1. And it also reduces the healthcare cost by 2 to 4 times compared to really late stage, so stage 3 and 4 lung cancer. It was shown also that early detection and treatment for survival, we saw that, but we need concerted efforts. And this is why I showed you about the coordination between the different members that we have at UICC, but also with the different stakeholders, the UN agencies, the WHO IARC, for instance, the WHO headquarters, and within each region. But without those coordinated efforts, the lung cancer deaths are predicted to increase by 2035 already. We recently issued a paper in the Lancet Oncology in January 25, looking at different aspects of the cancer control continuum. And I'm sure that you discussed that this morning. I saw the program, that in our study, we saw that only 12% of national cancer control plans have a strategy on lung cancer screening or early detection. If you compare that to other cancer types like cervical cancer or breast cancer, it's 89 or 90% for both of them. So you can see that there are discrepancies and gaps into addressing other types of cancer. And I'm just talking about lung cancer, but if you look at other cancer like oral cancer or colorectal cancer, these are similar numbers. So the World Health Organization recommends combining that public awareness, the work that we do, health services, and really equip the healthcare workers in countries with timely diagnostics just to decrease the mortality and to support the lung cancer care pathway. So this is some background about the work that we do. What are the objectives of the program that we have at UICC, the Lung Cancer Collaboration? If you look at the yellow box, it's really to work, as I said, with different stakeholders with similar interests. Air pollution, because we know that air pollution is one of the aspects of lung cancer as a risk factor, tobacco, obviously, but also NCD organization, other civil society organization, patient groups, as I said, and also private sector, public-private partnerships are key to really support our programs. We want to focus on the lung cancer care pathway. So this is the blue box, raising awareness on lung cancer, about the whole cancer, on the whole cancer control continuum, prevention, early detection, treatment, survivorship, and also accountability of the different policymakers and the governments and so on, and the patients. We conduct global and local advocacy. So we integrate our lung cancer advocacy briefs and in the lung health resolution. So a few weeks ago, we integrated all the lung cancer care pathway into a lung health resolution during the WHO Executive Board in Geneva. So that helps also to work with the country representatives, policymakers, and also experts on the ground. We support technical guidance development. So we work with WHO and WHO IARC on cost-effectiveness studies about lung cancer screening, and also development of lung cancer screening handbook. We started a contribution agreement with WHO IARC to develop that kind of technical guidance, and it will be released, we hope, in early 2027. And finally, and this is the work that we currently do during these events, it's really to encourage the information and sharing at the global and regional level, and connect with the different networks and our members in different countries. So, as I said, as an achievement, we have a contribution agreement with WHO to develop that technical resources, and we work with the different member states to have integration of lung cancer screening and lung cancer care pathway in policy documents. And today, I have one question, maybe for the panel and for the audience, is what actions need to be undertaken in your home country, in Greece, to make lung cancer control strategies developed and implemented. So thanks a lot, and Efraisto Parapoli. Thank you.
Thank you very much, Mr. Romero. And over to you now, Corina.
Yeah, I think I'm going to do the presentation from the stage. Is that okay?
Yeah,
okay,
sure.
Thank you. Okay, καλησπέρα. Ευχαριστώ πολύ.
Hello, thank you for the invitation and the honor of being here. As a representative of Fairlife, I'd like to talk about one of the greatest challenges for public health, lung cancer, which, as we know, is the #1 cause for neoplastic diseases, and unfortunately, those that are being diagnosed at a later stage. The results, the conclusions were discussed during a fourth conference that was on early detection and prevention and equal access to innovative treatments. We heard from the experts to confirm what is already known, that early detection saves lives and reduces the cost for the national healthcare system. The data is clear. If someone is diagnosed at an early stage, they can the survival rate increases up to 80%. This is very clear, and the need for implementing screening tests to answer the question for our country is very, very urgent. We don't have an organized control system. There is no clear information and education for lung cancer, and there's a lot of inequality. The ministry, as of June 2023, has the guidelines that may not be enough, but it is an important step to start the pilot programs which have been published. One issue that is very important is educating the patients and the public in general. How many of us know that a cough or a sore neck, sore throat, or a pain on your back may be a cancer symptom? And this is where we need to take action. Through our actions about the action named Lung Health, we visit different cities in Greece, and we see that people want to learn. And once they learn, they become educated. Once they trust us, they listen to us. It may take a while, but then they do actually take those screening tests. We offer free of charge screening tests, and I want to thank Mrs. Labaka for the 250 screening tests that they have offered to us, but it's not enough, and we cannot substitute the state. As we talked about before, the stigma is something very important. It's there, and we feel it from our patients. People are afraid when they are high-risk patients. They are afraid to take the screening tests, to undergo the tests, and in combination with there's no funding, that creates a sense of guilt, and it is a problem. So inequalities, as we talked about before, another problem. And geography or income should not determine access to early detection. Next slide. So I'd like to present the Global Lung Cancer Coalition results, a survey that was carried out for the first time in Greece with participation of Fairlife, and essentially confirms everything that we just mentioned. 91.3% of Greek people responded that screening tests are necessary for Greece. Also, 37.8% responded that they are not aware of any lung cancer symptoms or risk factors. And 40.5% responded that they have less sympathy for lung cancer patients, and that is directly linked to the stigma. And this is why we did an excellent campaign in Europe, Ask the Right Question. And we continue to work through our meetings on a monthly basis with stakeholders and with the general public. We need to go to the general public in order to do the screening tests, same as they did in the UK. You have to have the van stationed outside of the supermarket. This is what we want to do. With the message alone, things won't work. We know that in the US, they spend a lot of millions and only 5% undergo the screening tests. And to conclude, a few more numbers. What happens after the diagnosis? 40.2% of European patients about 10% of the participants in the survey were Greeks, and we will get the results for Greece separately. But 40.2% of European patients feel uninformed in relation to their diagnosis, and an equally high percentage has not received the right information. So all this has to be taken into consideration. It is necessary, and this is our appeal, to have those screening tests in Greece. And let us not forget that we are not simply talking about numbers. We are talking about human lives. We are talking about families that will not have to lose their loved ones as early as it happened in my own family and with thousands of other families worldwide. Thank you.
Thank you very much indeed. And now, Assistant Professor Athanasakis from the University of West Attica.
Σας ευχαριστώ πάρα πολύ για την πρόσκληση να είμαι εδώ σήμερα και να μοιραστώ.
So thank you very much. It is with great pleasure that I attend this event in order to share some insights on the issue of early action against cancer. Last year, the slides, yeah, okay. So, we kicked off this discussion last year when we tried to identify the concept of early in cancer care management. So, in the slideshow, great. No, let me stand up perhaps because I cannot see them. So, we tried to create a conceptual map of the term early. Early has to do with how quickly we react against the risk factors. Early detection, early access to treatment, and early access to advanced or differentiated treatment alternatives. We have to keep that in mind. So in this context, I will try in the following 5 minutes to share with you some case studies showing that early intervention might be beneficial in multiple ways: financial, social, medical, etc. Let's start with the first stage in the time continuum of this disease: early prevention via vaccination. We do have vaccinations against cancer. One is the HPV and the other is the hepatitis B vaccine. So in this field, we had some major developments in the past years. We have new recommendations for vaccinating girls of an early age and then boys. This led to an important uptake of vaccination. In the age 11 to 18 for HPV has reached 57%. What is really pleasant is that new cohorts, girls of age between 11 and 12 years old, the vaccination has exceeded 80%. What is particularly important is that in 2023, which was the first full year in which boys were vaccinated, we have had 76,000 vaccinations of boys. And this is important. Why? According to the Good and All survey presented in the previous conference on health finance in December, every year, because of this virus, and this virus is not visible, we lose 7,000 life years, of which the biggest part are productive ones. So we have financial and social burden that may be, mitigated thanks to vaccination. A big part of that is thanks or due to vaccination. Last year, we had the follow-up survey of the patient journey for women with cancer. So the study showed that some things went well, according to this study on the journey of breast cancer patients. The first thing is that perhaps women are activated more easily. On the other hand, the health spent against this disease has not changed, which is not good. And some other things have changed maybe because of the pandemic, and this is the fact that we have very high, very big waiting lists, and the psychological burden for the patient. This means that the system has specific drawbacks or obstacles that we have to exceed, we have to overcome in order for patients to have a specific journey. The problem in oncological treatment in Greece is that we do not help people navigate in the health system. They just get the diagnosis and they just thrown in the sea to swim, as we say. Another important part has to do with access to proper treatment, access to the best treatment path, according to the slide. In November, we shared some facts and figures on the financial benefit when reimbursing biomarkers. What would be the cost to reimburse biomarkers currently needed in order to steer an oncological treatment? It's we're talking about 57, some 7.5 to 10 million euros. And we also identified the potential benefit if we use this technology, which is apparently necessary. It's not in the slides, but let me show the following. We have cases in which the use of biomarkers has an ROI that starts from 1 to 10. From every €1 spent for biomarker access, we get 10 euros coming back, returning to the health system, up to 1 to 20. This was great because it led to new decisions taken, because now we have underway the scheme for reimbursing the first wave of biomarkers. And that was the study that was proposed by the study, to have a dynamic process in order to identify new biomarkers and reimburse these new biomarkers when they enter the system. Last, another important bit has to do with early access to the new cancer treatments and quick access to treatment lines. When it comes to pharmaceutical policies, an important aspect is the time, how quickly one has access to the new cancer treatments. So we considered that using a set of cancer indications in the case of PD-L1 drugs. The benefits are multiple, and they may be seen in a wide spectrum of our outcomes. Characteristically enough, early access to these biomarkers would bring a decrease in projected deaths with a reasonable cost. So we have to be very open-minded when it comes to the costs. We start with the clinical data, we go through the economical data, but we have to end up with the social impact. That's all for now. I will be at your disposal for any questions. Thank you.
Thank you very much. Over to you now, Sofia Lampaki.
Καλησπέρα και από μένα. Ευχαριστώ πάρα πολύ την Οργανωτική Επιτροπή για...
Thank you. I would like to thank you for the very honoring invitation. Let me show you now the 8 years of lung cancer screening results and the example of the Papa Nicolau Clinic, which is the respiratory disease unit in the of the University of Aristotle. As you know, the aim of LDCT screening for lung cancer is to early diagnose the disease when the population is still symptom-free. We have some positive studies. The first one was the major US LSCD showing a decrease of mortality up to 20%. And then we had the big positive European study, the Nelson one, that led to a decrease of mortality up to 26%. The important thing is, according to that study, is that there was a decrease of mortality in women that reached 63%. The second conclusion was that apart from lung cancer, through the low-dose radiation X-rays, which is the main tool we have very quick diagnosis of other diseases like cardiovasculars or chronic or COPD. This means that although we have positive studies for screening lung cancer, we see that in Europe these programs have not been widely adopted because there are some concerns, one of which is the increased radiation exposure. Let me say that a low-dose CT radiation is 1.5 MV, when the normal chest X-ray has a 10 MCV, and the total exposure 50 MCV of radiation. As for the false positives, let me say that the highest rates ever found was when the threshold of the earth was at 4 millimeters. Now it's at 6 millimeters, and this has dropped significantly. The false discovery rate, that is. And as for the point of criticism that we are invasively treating indolent cancers, a meta-analysis 3 years ago in ASCO showed that even these nodes, if we let them be, more than 80% of them turn into cancer ones. As for the NHS costs, it's quite high, the cost to diagnose someone with cancer. We need 130 up to 200 CTs, but in order to diagnose a woman with breast cancer, we have to have 645 to 1,024 mammographies. 3 years ago in Vienna, in the World Lung Cancer Conference, we had the first study showing the cost effectiveness of the pre-screening program against lung cancer. In Europe, the only countries that have included pre-screening programs against lung cancer in the universal coverage is Croatia, then it was Poland, Croatia and Czechia. We have many European countries in which we have pilot programs underway, screening programs. Taiwan is the first country that has implemented a pre-screening program also for non-smokers, with a lung cancer detection rate that reaches 66%. According to the updated WHO guidelines, the high-risk population for lung cancer is the people aged up to from 50 to 80 years old with at least 20 year smoking history, and those currently those who have quitted within 15 years ago. In the Papa Nikolaou clinic, we have a pre-screening laboratory at the pilot stage. Until today, we have screened 3,000 smokers and former smokers. I have to thank Mrs. Pateli and Fairlife for the support, because thanks to their actions, this program was made known across northern Greece. The people we screen are above 45 years old. We have focused mainly on their smoking history, not their age group. We have a screening rate that is 3%. So, which means that we have diagnosed 90 people so far with early stage lung cancer, and all these people have undergone an operation, and the false positive rate is 5%. Another important piece of information about the survey is that 50% of the people screened have been diagnosed with a COPD that has not been diagnosed so far, 15% with cardiovascular diseases, and 12% with ILD. So we do have the facts, we do have the studies, the positive ones, showing that there is a benefit out of screening tests when it comes to morbidity. We do have the facts. We have the cost effectiveness study showing that there is a big benefit, especially when the assessment of the nodes is done using the Nelson method. And I think it's high time the screening test for lung cancer makes its way to Greece. Thank you.
Thank you very much. And let me turn now to Hippocrates Kourensis, medical oncologist at St. Luke's Hospital in Thessaloniki.
Yes, I would like to thank the organizers on my part as well for the very honorary invitation. And let me start with the phrase that to prevent is better than to treat. And it's true, Greek patients are rather blessed in that they have access even to innovative treatments, even to drugs that have just been placed in the market in the US or in Europe. The problem is that patients enter the doctor's room when they are already at a late stage, and especially in the lung cancer cases, even with the new drugs, approximately 1 out of 4 patients can have a better survival rate. So we need to look at how we can prevent cancer. And we know that specifically for lung cancer, it's quite simple. It's smoking. The people should have the right recommendation. Patients should quit smoking, and that can start as early as in their child years. The schools, we need to make the anti-smoking laws more stringent. We need to access to provide all this information and education early on. But when someone has already started smoking, in those cases, we need the support of the state, the government, perhaps with programs to quit smoking, or we need to address and educate those smokers, heavy smokers. We need perhaps to lead them to get to learn about the symptoms that can help them detect, or rather send them to the doctor's office earlier to get the screening tests. We should optimize the air pollution control so that we don't have cancer in those cases. Also, in those patients living in remote areas, AI may help early detection. And one might think that all this can be very costly, but we need to understand that when you detect cancer at an early stage, those patients will get more limited treatment, maybe just a surgery or radiation therapy. So the cost of the treatment and the savings from that will be very important. Moreover, those patients can have a better quality of life. They will not miss out on the jobs. They can continue to play their part in society. So prevention and early detection may actually have a cost benefit here. So we need to look at those guidelines. We need to look at early detection in order to get the best outcome. Thank you.
Much to all the panelists. We have about 10 minutes, not long enough, I know, but it's a bit of time. But maybe what we can do first is we wanted to give the floor to somebody, Ms. Karamli, who wanted to give a short statement as a patient and share her experience with us.
Apologies, I cannot take off my mask. My name is Nicoleta Karamli, and I'm a lawyer in Athens. I'm 56 years old. I came today, and I want to thank Ms. Polochariniou for giving me the opportunity. I attended the conference last year for my personal interest. I am a woman practicing prevention since my student years as a law student. And I'm also a mother, a single mother with one daughter. I always led a healthy lifestyle and was working at the bank, the legal department for 24 years. And suddenly the bank fires me. You know that unemployed lawyers and freelancers in Greece don't get any benefits. If you are a lawyer, you're supposed to be rich, or a doctor, you're supposed to be rich. So immediately, my life is at a standstill. My daughter was also a law student. So all this trouble, I couldn't find a job anywhere. Everyone was admiring my CV and everything, but they wouldn't offer me a job. So I was unemployed with a daughter in school, facing tremendous expenses, and I was diagnosed with cancer. I was always practicing prevention. I was always aware. I was always taking all the tests, But because of all these problems, all this sadness, I was found with breast cancer. I did the mastectomy. I did a biopsy for my right breast, and our lives were turned upside down, mine and my daughter's, in Greece, because we're just not so many people in Greece, but we have excellent doctors, and the treatment part and the state of mind that it puts you. If you have the money to do everything that is necessary, then your mental state is improved by 100 times. I had to ask for help from anyone that could give me. It was not possible to get help from the private or the public sector. People would not believe me. There were no financial resources. Right now I'm broke. I'm here to become the voice of the woman living in a rural area or in an island, of all those people that are sometimes left to do alone. 10,000 euro was the cost of the treatment. I had private insurance, but they cut it short when I was diagnosed, and could not be reimbursed by the bank, by the insurance company. The state told me that there's no allowance for me. My pension is very, very low, and my daughter had to stop her studies. She was supposed to go to Boston to study, and she had to quit that. She's a young lawyer now. She's making she has a very low income, and we're two women alone. So, cancer needs money.
We only probably have about 5 minutes left. So can I ask you just to round up? It's great to hear your experience, especially in the context of what many of our panelists have said about putting the patient at the center of this. So just to wind up, and we can conclude. Thank you.
Yes, this is what I had to say, that I did my research. I was unemployed. I did my research. I had the time since May. If the doors are not opening, we're going to open them by ourselves. It takes 2 weeks to find all that in Greece. People do not go to take the tests for cancer because they don't have the money. We could be saving a lot of lives. A test, genetic test, that screening test, would cost 700 euro. It's not available to everyone. So it takes money.
Thank you very much for your experience. Important to hear that. So we do not have much time, but I do want to at least put one question each to our panelists. So maybe to go back to Mr. Romero. I guess, you told us about some of the key findings from the latest global review of national cancer strategies. So can you tell us how you think those should or could inform Greece's approach to early cancer detection?
Thank you for that question. All the work that is done, I think it's really based on I think I will jump on something else. I'm sorry, but what I've heard right now, it's the most important thing that we've heard, is the stigmatization of the patient, is the return on investment that we need to put. And that's present in the national cancer control plans. The return on investment that you put on the infrastructure, the modalities and the interventions that you have in terms of early detection, treatment, and access to care, access to oncology medicines. This is the most important thing that we've heard just right now. And we have to put that in a national cancer strategy. So the patients are served and they are well served. And it has to align with the universal health coverage, for instance, with the different initiatives that are brought by the government. And you have to we have to show that the government is engaged and involved also, and we have to make them accountable. So this is what I said: accountability, return on investment, patient engagement. Don't forget about them. So involvement of them, and don't stigmatize on cancer patients. That's the things that we have to keep in mind. Thanks a lot.
Thank you.
I'm not sure I replied to your answer, but I think these are the things that I wanted to say, because that was a moving testimonial from that patient in the room. Thanks a lot.
Thank you. No, that's absolutely fine and I would say to the other panelists, obviously respond to what you've heard from the other panelists, or indeed from this testimony as well. So maybe to turn to you, Ms. Patelli-Bell. Please respond to that. But I guess based on your work, which has been acknowledged by other panelists, very important work. What are the kind of specific strategies or programs that you have implemented to raise awareness, to inform patients, and what are the kind of key challenges there? What have you encountered in terms of patients' willingness to seek screening services? I mean, there's a few questions there, but...
I think
Generally speaking, Greeks want to have their ears open when it comes to prevention, but you give them everything ready-made. You raise awareness, you give them the tools, and you have to make them feel, the Greek patients feel, as if they're not alone. That's why we work closely with local communities, apart from conferences. Conferences are very successful, and if you check our events, they have huge attendance of thousands of people. So we have to work with the communities, the church, the municipal center, the KEP. KEP is the help centers for citizens, because as Mrs. Labaki said, we find 1 with cancer out of 100, 2 with COPD out of 100. Yes, this is what we have to do. We have to go to them. In Greece, we don't know about screening tests like my husband. My husband was very well educated, but he knew nothing about screening. So the insurance company paid 70,000 euros for the screening, and we paid 150,000 euros because he was semi-insured, to put it like that. So couldn't we save this amount of money for the NHS just by having a simple screening test early enough? So we have to have that. We all have to be aware of that. That's our job, our organization, etc., and the stakeholders and the government. And for me, this is the most important thing. Stigma, inequalities, all the things mentioned before are equally important. And of course, psychological support to patients once diagnosed. It will take a lot of support to them. That's why we're here.
Thank you very much for that, Mr. Athanasakis. I think you outlined the very clear, socioeconomic benefits of early detection and screening, and pointed to the data. We still have the question of funding, I guess, and investment in screening programs, screening services. How can we improve here in Greece, and what is the challenge here for Greece in terms of increasing and sustaining investment in these sorts of programs?
This is the 1 million euro, actually the many million euro question. We need data that will demonstrate or evidence the ROI. Prevention epidemiologic is very, very important in order to identify the cost for value ratio. So prevention has to be carried out in a very targeted way so it can be efficient. How and when and what to target is something that we can discuss and we can identify with precision. And of course, we can use standardized parameters like age or habits. In the case of lung cancer, there is such a thing, there is such a provision. That's something we have to use as a first-line tool. So, how can we add funds? How can we channel more funds in the NHS system in order to apply these tools? So we don't have a one-off use of these tools, but let's use them in a more systematic way. This is up to the system itself. We will have a very difficult, a very challenging demographic future, so it will be a challenge to be able to pool the money in order to cover the needs of the population. We have to become a bit more creative, if I may add. We have to find new sources of finance apart from the typical ones. There have been ideas put in place. We have submitted some of our proposals. For instance, taxing some unhealthy habits. But we also have to be a bit more creative and bold. The system, in terms of inputs, in Greece, is not viable in Greece as it stands.
Ms. Lampaki, could you just say briefly what in your program that you rolled out, your lung cancer screening program, what were the main challenges that you faced, and I guess then what are the successes that you would identify?
The main challenge we face is how to handle data. We have no problem attracting, bringing people to us for screening because we run a lung center. We run a center where we have many lung cancer cases diagnosed, so it's quite easy for us to let them know about that. That's why we have a very high screening rate compared to the international literature, because many of our patients are relatives of former patients, and we also pick the patients that have a very heavy smoking history. What we need and what we struggle every day is to find the resources and have the right people employed and properly handle the data we collect. These things have to be digitally stored, have a big data set, including also reports, surveys, literature, in order to evidence the benefit out of these screening tests, not just for the patient, but also for the healthy population. But we also have to let our colleagues know from the primary healthcare system, because they don't know there is such a screening test for lung cancer. We hope strongly, and actually the Minister of Health has said that there will be 4 pulmonary centers, units for this screening, lung cancer screening tests across the country, and this will touch both the patients and the rest of the population.
Well, the panelists, Mr. Karantzis, did you want to say one final word? We've kind of come to the end of our time, but if you have one final observation to make based on what you've heard.
I believe that we have to make it widely known that early detection of lung cancer is priceless. Patient organizations have to be made aware of that through the patient organizations at an early stage, and there have to be campaigns launched to quit smoking, which is the main cause of this cancer.
I mean, thanking all our panelists. We'll have a photograph, and then we turn to our final panel of the morning before lunch. Okay, ladies and gentlemen, the final panel of the morning is looking at the significance of timely and holistic cancer care. I will invite our panelists to join me now on stage. The first is the Deputy Minister of Health of Greece, Marios Themistoklios. Welcome, sir, and have a seat.
We're joined by connection by Olga Balura, Chief Executive, First Health Region of Attica, Ministry of Health of Greece. Welcome. Mikhail Nicolaou, Medical Oncologist, St. Savas General Anti-Cancer Oncology Hospital of Athens and Vice President of the Board of HESMO. Welcome. And Paraskevi Michalopoulou, President of the Hellenic Association of Women with Breast Cancer and Vice President of ELOC. And we have our commentator, Maria Avgustidou, Medical Oncologist at Athens Medical Group. So I'm going to invite the Deputy Minister to start off our discussion on the importance of holistic cancer care.
Καλησπέρα και από μένα.
Hello from me. Thank you for the honor of having me here. Just a short introduction because I mainly want to have a discussion. Holistic treatment includes prevention and diagnosis, and I will try to mainly talk about what I work with has to do with from the point of the diagnosis and to the next steps, where our country was, what we have accomplished over the last years, and mainly what is our strategic plan, what we want to accomplish. I will start. Is Ms. Balaura with us? Okay. Okay, I see her through the connection. For the first time in our country, we are going to have a complete cancer center at Agios Savas. These are the people that led this effort, rather, so that our country can be one of those countries that have a complete center of excellence, of reference, where patients can get holistic treatment from the point of the diagnosis and for all treatment stages. We are going to have the last evaluation assessment in July to get the accreditation for the center, and the next planned step, something we have already started working on, as Mr. Georgiadis also mentioned, we have the important project of the digital patient file that will digital record that's going to make use of all new digital tools. We have registries for our hospitals, something that is already being implemented at Agios Savas, and there will be 11 more hospitals in the registry, so that we will have something new in Greece, something that will help us track the patient's progress through the system. This is going to help us systemize the information, standardize it, because even though we have information on how long radiation therapies or chemotherapies last, the information is collected in a non-standardized method, which makes the whole tracking process very difficult. We have a central monitoring, but the end users do not really have the tools to intervene. Now, in terms of the radiation therapy times, right now, with the exception of a couple of centers, I think in Greece, we have accomplished the target set by the European Union, which is 60 days, but we are still not yet at the European average. The other European countries, we're going to get to this target when we acquire the new machines, the new devices, and in 4 years from now, we will be ahead of the European average. Now, a new development that will come with a digital system, the establishment of oncology councils. It's something that is not done in an organized fashion or standardized fashion, and that in combination with the protocols that we will be activating, will give us the main guidelines and will give our doctors, those who work with cancer patients, a more holistic, spherical way of dealing with the problem and will help resolve a lot of issues. I don't have a lot of time, but it will help them provide better care to their patients. And to conclude, I see the clock here, specialization in exclusive care, our country, Greece, is lagging in this regard, but we have passed the necessary law, and until the end of March, beginning of April, we are going to announce the national plan for palliative care. We have prepared all the ministerial decisions that are specified in the law that was passed in 2022, so we can proceed to create palliative care units or establish a whole system of palliative care in Greece, because right now we have just one NGO that is active in this regard and some clinics, so we need to have the right structure within the national healthcare system, within our hospitals, or by creating a special unit. And just to let you know where we stand right now, we have 3 facilities that could potentially be used as palliative care units in Attica, and we will also have one that will be built with a new hospital, Theagenio Hospital. I'm not going to go into more details on the buildings, the facilities, just to give you an introduction, and then hopefully we can have a discussion and we'll see what kind of questions arise.
For that introduction. Let's turn to Olga Balaura, who's joining us by connection. Can you hear us okay?
Ναι, σας ακούω μια χαρά.
Thank you very much.
To give your opening remarks.
Ναι, βεβαίως. Συγγνώμη, νομίζω ότι θέλετε κάτι να με ρωτήσετε.
Yes, of course. I thought there was a question. But, well, thank you for inviting me here. You know, cancer patients is a new model for healthcare service provision that has been recognized internationally, focusing on oncology patients. And Greece right now is taking a significant step to that direction through Agios Savvas leading the way, the hospital. As the minister mentioned, we are in the process of being accredited, and we believe that in June, we have already passed all the reviews, so hopefully in June we will officially get the accreditation. So as you realize, this development is very important for the Greek healthcare system and for oncology patients in specific. The comprehensive cancer centers, as they are called, focus on 3 main areas: clinical care, research, and education. CCC is not limited to treating cancer patients, but also studying its causes, developing new prevention methods, and testing innovative treatments. At the same time, and this is very important, we train new oncologists. It trains new oncologists in new technologies, and therefore it is obligated to transmit, pass on knowledge to new generations of doctors. CCCs operate under specific guidelines. They are being accredited, and this accreditation requires high quality of services, extensive research activity, and collaboration with other similar healthcare providers. We have such centers in the UK, in Germany, in France. So as you realize, it is very important for our country to have a comprehensive cancer center for oncology patients. And I'm mentioning this because the operation of CCCs has immediate benefits for oncology patients, as it offers access to personalized treatments and clinical trials for new drugs. And also, as the minister mentioned, they are obligated to follow scientific procedure in how they treat patients. Doctors treat patients in a holistic manner, not individually. It gives them access to innovative treatments. CCCs must actively participate in clinical trials, which gives patients access to new drugs. And they emphasize the quality of life of the patients, including providing mental support and palliative care. Also, they promote knowledge, they improve their strategies for combating cancer, fighting cancer. In this way, we can actually treat cancer patients holistically. So the decision, the accreditation of Agios Savas as the first CCC in Greece will mark a new era for Greek oncology care. This endeavor is supported by the Ministry of Health, and it includes funding standing at €2 million. It's a very important figure, perhaps the only funding that is given directed to the provision of quality healthcare services in order to upgrade our infrastructure and in order to be able to follow the international standards at Agios Savas. So this accreditation, what we expect from it, we expect an improvement in the quality of healthcare that we provide, since our patients will have access to more advanced treatments through clinical trials. We're going to develop research in Greece as the center by our attractive research programs and new funding. We are going to enhance and support and educate our new scientists as we are going to become a center of excellence. And also, the center will mark a great step, creating new prospects to create networks of comprehensive care for oncology patients. And at this point, I'd like to mention that the accreditation for Agios Savas is not just a recognition for the quality of its work, but an opportunity for our country to upgrade the oncology sector as a whole with everything that entails for the oncology patients. For the Greek system, it is a modern and competitive approach for fighting cancer, and investing in such centers is not just a matter of health, it is a matter of social and economic growth as well, as through this accreditation, Greece becomes a leader and goes into the next level when it comes to the treatment of cancer patients, especially in Southeastern Europe. Thank you.
Thank you very much. That was great in terms of setting out the benefits for the patient, for the scientific community, for the healthcare system overall. I hope you're staying with us. I had one question. I know you have to leave by 2 o'clock. Do we still have the connection? Yeah, okay. Because I realize you're under a time pressure, so just to interrupt the panel and just to take the opportunity to ask you one more question, because I think you gave a very good and full exposition there of the work and what you expect to achieve. I just wanted to ask you a bit more. It's great that you have this €2 million funding. Is it possible that you will be able to leverage funding from the EU as well, from other channels of funding, from other collaborations? How do you envisage this unfolding in future?
Yes, first of all, let me apologize for apologies for not being able to stay. I have another conference that I need to attend. This is why I don't have the time. So at the first health region, we have already used some funds from EU, and right now through the EU NetCC program, we are in the process of being certified. We have the clinic of Mr. Dimopoulos at the Alexandra Hospital that is also proceeding to get a certification as through this network. we get a certification for a specific type of cancer. It's like a center of excellence. So yes, we do use additional funds from the European Union in order to certify more of our centers as center of excellence for oncology patients. That's one aspect of it. And when you have a comprehensive cancer center in Greece, that gives you the ability, that gives you an extra ability. And we have seen this in Agios Savas from the first days of us being in this accreditation process. It becomes a magnet to attract more funded programs. Right now, Agios Savas runs more than 3 European programs related to the pathways of oncology patients. In fact, a few days ago, we have given the pathways of our oncology patients to other centers in Europe so that they can review our process and adapt them for their own centers. And this is why we're getting this funding. So as you realize, it is truly a center of excellence that can give new abilities, of course, to the patients for the treatment that they receive. And also, it is an important step for new scientists to use these programs and develop more.
Much, and thanks for taking the time for joining us this morning, given the time constraints. Really appreciate having you here and hearing in detail about your experience. So thanks. Thanks very much for that. And feel free to go whenever you need to go. Thanks. So let's turn now to Mikhail Nicolaou, medical oncologist at St. Savas General Anti-Cancer Oncology Hospital of Athens and representative of HESMO too.
Thank you very much. We will discuss the issue of home care and how this should be configured. Let us not forget that the oncological patient lies at the center of whatever we do. Any kind of service that we design, unless it fulfills his or her needs, then this service means nothing. This service has no meaning. So we have to identify the categories of patients where home care would be of essence, would mean something for them. And we have 3 categories, actually. The first one is the service offered by the doctors and nurses in an environment which is familiar to the patient. I'm not saying they're home. In our case, in the ECOTHEN program, we would administer treatments to a cancer patient, a breast cancer patient, in an elderly home. It was an elderly home for people with mental issues. So for them, this was the familiar environment. We also have personalized care that it's another category relating to the everyday conditions. I mean, we have to train them how to get their drugs, how to stay, how to protect their hygiene. And we also have another category, the ones who have some minor support needs. People who cannot eat, they cannot cook a meal because they have no caretakers. These are the needs, not minor, just needs. So we have to organize the home care scheme or network and include this service as well. In our country, we have a fragmentation, we have regions and municipalities trying to cover everything. So allow me to share with you actually this is the testimonial of the first patient accepted by ECOTHEN in an event organized by the Ministry of Health in December 5th. She actually emphasized on the mental link between the doctor and the nurses who visit the patient at home. And she said that I feel this doctor as if he is my child and I can have a chat with him as well. Things that in the hospital, in the clinic or in the hospital or in the environment of a hospital, I wouldn't be able to do because I would feel as if I'm wasting the time of the doctor and taking the time of other patients. As the minister said before, Agios Savas has been successful to make it in the big OECI network. And talking about the long-term care to oncological patients, we have Ecothen being included, and we have included also the part of the home, the training of patients at home, and the pain management issue. We must never forget that, especially when we're talking about people treated at home. These kind of actions, these kind of programs like Ecothen come with a great share of benefits. We have described them in the past. Of course, personalized care and the opportunity given to a patient to have a quality life is something priceless. That's something evidenced by the studies we have done in the past. We have the OECD questionnaire, we have NPS surveys, and we have had other surveys with Kostas Athanasakis surveys on the patient satisfaction. So it seems that Ecothen delivers something really important for the patients. In Greece, we don't talk about the gatekeeping. In the first year, we administered 1,000 treatments. Although the plan for the full deployment of Ecothen talks about more than 4,000 treatments per year. So if this is done, then we will be able to release beds from the hospitals in order to provide quicker access to other patients. So gatekeeping is a very important dimension and a very important component when it comes to better flow of patients, because it allows us to make use of the primary healthcare system and customizing treatment per patient. This is a way to decongest the national healthcare system. And we must never forget that an ally to this end is modern technology. We have used that technology. We have used this technology in the context of Ecothen by providing intravenous medical medicines remotely, and now we're discussing about a program for the remote access to patients. And given the ministry-led campaign for the EMR, the electronic medical records, and the training courses and the applications put in place offered to the patients, we can now easily design the visit of a patient to smart hospitals. And this is my last slide, showing how we can develop a new department, a new division in a hospital that can remotely intervene, offering benefits to the patients. Thank you.
Now, Paraskevi Michalopoulou of the Hellenic Association of Women with Breast Cancer.
Σας ευχαριστώ πολύ. Θα ήθελα...
Thank you very much, and I would like to warmly thank for inviting me here. I'd like to thank you for that. I'm so glad because I will be able to share some data on breast cancer patients with the minister. That's truly important. Firstly, I will share with you what we deal with on a daily basis with the healthcare system. I'm talking about the breast cancer cases. According to Lobocan, for 2022, we have had 2,097 new cases diagnosed and 2,500 deaths, and 9,000 new cases diagnosed. This is the slide including the data I'm sharing with you. So, as of July 2022, we have the FOFI Γεννηματά screening program underway. Figures will change, of course, because the figures here are the ones shared by the Deputy Minister during the ELOC conference. But Mr. Nikos Iosif before, in the previous session, said something else because, figures have changed. So, The Fofigenimata program refers to 1.5 million women of an age between 45 and 74. Some 650,000 women have already taken part in the program. 135,000 have been referred for an ultrasound test, and 40,000 have been referred for additional screening and investigation of the case. So, currently, women that have not yet been tested in the context of the Fofigenimata program amount to 1,450,000 women, apologies. Maybe some of them have no screening tests. Maybe they're not eligible under the Fofigenimata program, or maybe they have their own test in their own way, usually having their own X-ray specialists. Mr. Schiff told us that 6.5% of them need additional screening tests. So, in these 1.4 million women, we reach a point of 96,000 women who need additional tests. We also have women below the age of 45 that have been diagnosed with breast cancer, with a huge impact on their lives, just indicatively the issue of fertility, plus the women of more than 75 years. So if we take into account also the thousands of women who have suffered breast cancer before 2022, at any stage, they're receiving treatment, they're just being monitored, or they have an impact on their life. At the same time, we have women with advanced or metastatic breast cancer. We're talking about 30% of the patients who have additional needs, and women with hereditary cancer, 5 to 10%. That means a very complicated screening requirements. And we also have healthy women, relatives to the previous ones, who have to undergo screening because if found positive to mutations, they need a very complicated treatment. So out of all that, you can understand the multitude of needs that exist. Allow me also to say that according to the last survey by the International Research Organization on Cancer, in the coming 25 years we will have an increase by 38% of the number of diagnoses and an increase by 68% of deaths. So the WHO took on an initiative against breast cancer, aiming at reducing global mortality by 2.5% annually. This should be our goal as well, to decrease mortality, to decrease recurrence, and to identify, to be able to provide the right treatment to every woman with the right follow-up care. Given the Greek experience and the international experience, after the screening test, which is the first milestone in order to control breast cancer, having accredited comprehensive breast cancer centers should be our next goal. Currently in Greece, all categories mentioned before, all these women I mentioned before, who have diagnosed with some findings and need additional screening tests, are not referred anywhere. They have to find a doctor on their own. They have to navigate through uncharted waters. Out of these 187 hospitals in our country, we have no accredited breast cancer center. In Greece, we only have one private hospital offering something like that. So, specialized breast cancer centers represent the main prerequisite for offering quality healthcare services to breast cancer patients. What are the benefits out of such a center? We have specialized health professionals there. We have a multidisciplinary approach. Therapeutic protocols get implemented there. We make sure that the healthcare is provided in the long run. Also, the patient journey is not chaotic. It takes place within a specific context with specific procedures. early detection and precise detection, because we're talking about health professionals that are specialized on that. Also, prevention of rare cancer types, management of women with hereditary cancer, treatment of men with cancer, healthcare for ladies at an advanced stage of cancer. So I will have no second intervention, just to make sure that I finish this introduction of mine. So these cases have to be directed to these centers. Also, we are also able to collect data and make sure that we follow international standards. By means of such a center, we can have collaboration with patient organizations in order to make sure that they get the right experience and they get the emotional support they need. We save human resources and money, and all this means accreditation and saving of money for the national healthcare system as well. See, research has shown that every woman needs 4.7 thousand euros in average to treat her breast cancer case. Let me highlight the initiative taken by MSD-LAS, which we support as well, and I'm really getting emotional about that. I'm talking about the initiative to study the requirements every hospital should fulfill in order to be accredited as a breast cancer center. This study has mapped best practices, existing networks, and accredited breast cancer centers in Europe, from which we can learn many, many things and exchange experiences. This study tries to map the Greek reality and also identify all the services such a center should offer. This study will be completed soon, and we will be happy to share it with you, and we hope it will be implemented. Ending, and I invite the Deputy Minister, let's maximize our efforts. Let's invest in establishing breast cancer centers in order to control this disease. Thank you very, very much.
Thank you very much indeed. Yeah, I mean, I don't like to interrupt anybody. It's just we're running short of time. So finally, we're going to hear from Maria, a medical oncologist at Athens Medical Group, to hear your comments on what you've heard.
Ευχαριστώ πολύ για την πρόσκληση για δεύτερη χρονιά.
Thank you very much for the invitation. I would like to start with a comment to the Deputy Minister. The time for digitization is here. It's long overdue. That will accelerate the treatment and the diagnostic process, that will improve healthcare for our patients and also contribute to transparency. The transparency in terms of healthcare provision is very important because it essentially optimizes, it makes doctors better, it makes the healthcare centers better, whether they're private or public, and it makes things better for patients. In the same logic, we have the establishment of the oncology councils. It has to be made into an institution. All oncology cases should get the opinion of the oncology council. And a short comment for palliative care, one of my specialties. We need to recognize it. We needed to introduce it in our country as a recognized service provision, because palliative care relates to the level of culture in our country and how we deal with even late-stage cancer patients. In terms of what Ms. Balaouria said, for the CCCs, she talked about clinical trials, about education, about and we need research. We need all these things, and by achieving this modernization and improvement in these indicators, we essentially create a system that feeds itself, because by maintaining a high standard of education for our doctors, we can provide better services to patients and attract, again, better scientists. So that's a righteous cycle. Now, for Mr. Nicolaou, I want to congratulate him for the Ecothen system that makes things better for patients and for carers and has decongested Agios Savas. My wish is to clear the path for home care services, and especially as part of a holistic cancer treatment, since in combination with what the Minister mentioned about digitization, that will help us improve the legislative framework for this type of services. Finally, to Mrs. Michalopoulou, the figures that you have given us were impressive. The updated information on breast cancer patients, an increase for diagnosis, an increase in mortality. That means that we need to optimize the services that we provide. And as you said, the journey of the oncology patient should not be a chaotic one, and it shouldn't be a chaotic one, especially for us, the oncologists that accompany the patients through this dark forest that may actually lead to the peaceful valley. So, thank you.
Thank you very much for those. So I want to give the Minister a chance to respond to, I guess, some of the points and questions that were put directly, just not least on the question of digitization and accelerating this and data collection. Maybe good to hear more about the establishment of the oncology councils. Whichever points you want to respond to.
All of them.
All of them, yes.
Well, a short comment mainly. We see the need, we see what we need to do in Greece. The last 5 years, we've made progress, but we come out of a 10-year recession that has taken resources and from us in terms of money, in terms of people, taking it away from the national healthcare system that was under a lot of pressure, and it fell behind in relation to other efforts. So we're now attempting to achieve this recovery of the system. There's a great effort being made by Agios Savas, by Mr. Nicolaou, passing the treatment to the patients' homes. That's next day. But in order to get what other countries have, those specialized centers, the comprehensive cancer centers, well, I could just give you the political answer and say, yes, in a couple of years we will have them. But the truth is that we need a radical change with specializations, especially in the public sector. I agree with you. There are benefits. This is the direction we will be taking, and we need to have a roadmap in how much we can achieve this year, how much we can accomplish next year, so that we can reach the results that we want. Because aside from breast cancer, there are other specializations that need to happen, which means that we need to completely redesign the national healthcare system, and that cannot happen overnight. We need to do things one step at a time. We can analyze what's going to happen in 2025, what's going to happen next years. And digitization is something that will come. It's something that's already underway. We have found the resources from the RRF, and the first results are going to be we're going to see the first results. Already we see them, but we will see a great difference at the end of 2025 when the large digital projects are going to be delivered, so that we can move on to the next era in treatment. Now, exactly when we're going to reach our goals, well, it will take some time, but as long as we stay on course, we will achieve the results.
So a couple of questions for the other panelists, just about Ecothen a bit more. First of all, you gave us quite a lot of information about some of the benefits already that you've witnessed in this program. What would you say are the main challenges in terms of further rolling out or transferring aspects of hospital care into the home? What would be, do you think, the main challenges there?
Προσπάθω.
We are trying through Ecothen to establish in our country a culture for home care, which is something new. We are not alone in this regard. The Ministry of Health has included Ecothen in a general umbrella of measures, and through the RRF, we're going to get in our country 14 million euro for medical devices and for medical personnel. That's one aspect. And the other aspect is digitization. Our company, ESMO, in collaboration with the Ministry of Health, has achieved a great leap forward in terms of the electronic patient record for the cancer patients, for the treatments, for biomarkers, and we have truly we have been able to turn the page in how we look at things.
I will ask you a question anyway, so you can have another intervention. I just wanted to ask you, from your experience, how important is self-examination and education in terms of educating women in terms of self-examination? Obviously, screening is very important, and treatment, which you talked about a lot, but just interested to hear if you have a view on that and whether that's effective or can be effective. Sorry, based on your experience of the breast cancer clinic, and both of you, I'm happy to, yes.
Self-testing is important, but for us, it's not a way to prevent breast cancer or to detect. It is important for women to do that. Nonetheless, I would insist that the important thing for us is to continue with the FOFI Γεννηματάς program, to enhance our efforts to increase women's participation in the program, because it is a very important one. Because by participating, by using the program, we will get recorded information, data that will help us formulate the right policies for controlling breast cancer.
Want to say something on this? No. Okay. Well, just to go back to the Minister, after everything you've heard from the other panelists, what do you think is, I guess, the most important thing that the government can do and your department can do in terms of developing this holistic approach and improving patients' care in the coming year? Is it, you've talked anything else apart from the digitization and the establishment of the oncology centers, any other innovations that are coming?
No, I will not talk about innovation, I will talk about the basics. I told before that
we need to look at where we stand in radiotherapy, in chemotherapy, and we need to facilitate patients' access to the system. All the rest and any innovations will be helpful. They will be adopted, but first we need to build the foundations and the necessary things so as to save a patient's life. And that, the important thing is how long it takes for the chemotherapy or the radiotherapy to start and how easy it is for them to navigate this path. As you said before, we have the diagnosis, and then what happens? What do I do? This is our first goal, and it's something that we need to accomplish.
So I'm very conscious that I'm keeping everybody from their lunch, and you've had a long wait for that. So I'm going to end the session now, and please join me in thanking the Deputy Minister and our other panelists. We'll have a photograph, and in the afternoon, after lunch, the focus will shift a bit to innovation and funding of innovation. So we've got 3 sessions after our lunch, but let's have a photograph.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers? To discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge. This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία αιχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers? To discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge. This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
...4,6 δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτή. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτή. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτή. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμή του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Από κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way.
Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Got to stay in control, to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.
Huh? Oh, sorry. Oh, good. I was going to call. Yeah, I'll call you, but you can sit if you want. Okay, ladies and gentlemen, we're going to get started in one moment. Just let a few people enter the room and take their seats, and we'll get going. Yeah. Please, ladies and gentlemen, take a seat, and we will get started in one moment. Thank you. Okay, I hope you all had a nice lunch, and we've got a few sessions, all very interesting. The next session is Cancer Care in the Digital Era. I'm going to invite our speakers to join me on the stage. So first of all, we have Demosthenis Anainosopoulos, who is the Secretary General for Information Systems and Digital Governance at the Ministry of Digital Governance of Greece. Welcome. Next, we have Manolis Tsiknakis, Professor of Biomedical Informatics and eHealth at the Hellenic Mediterranean University. Take a seat. Oh, welcome. Nikki Tsuma, Chief Executive, E-Government Centre for Social Security Services of Greece. Welcome. Yeah. Hi, take a seat. Anastasios Boutis, Consultant Medical Oncologist and Director at the Theogenio Anti-Cancer Hospital of Thessaloniki and Treasurer of ESMO. Welcome, sir. And we have a commentator, Anastasios Kyriazoliou, a medical oncologist at Attikon University Hospital. Welcome. Okay, let's get going because we're always up against time. And I'm going to hand straight over to the Secretary General to give your opening remarks, please.
Greek or English?
Your preference.
I thought it was in Greek, that's why I'm asking. Or should I transfer to English? Okay.
Your native language is good.
Okay.
We like to hear it.
Okay. Καλησπέρα σε όλους.
Hello, everyone. Good afternoon, and thank you for the invitation. The truth is that it's the first time that I'm talking about issues related to cancer in particular. As it happens, I attend presentations for medical systems and medical data quite frequently, and I will tell you why data is important. But specifically for cancer, it's a very sensitive topic for everyone, so no need to say more about that. But to start and to just talk about the Ministry of Digital Governance, which is the parent of IDICA. I must mention a couple of things that we have already accomplished and a couple of things that we are going to do in the future. But first of all, how much time do I have? Maybe 25 to 30 minutes? So the most important point I'd like to make is that everything we have accomplished so far over the last 5.5 years, starting with the achievements related to the vaccination program, that made our country a model internationally in terms of how automated the whole process was. I'd like to talk about something that I want you to to consider. Nothing of what we have done was a given, and nothing was accomplished without an effort, significant effort. And just to let you know how important this is how we feel, but especially when it comes to medical and specifically cancer, we have a lot more to do, a lot more to give, especially in relation to digitization, to personalized treatments and diagnosis, treatment, the use of robotic tools, etc. And even so, more so in other areas that are related to research to some extent, international research and research that is carried out in our country as well. I believe that we have exceptional scientists in Greece as well. But in terms of AI specifically, two things I want to mention, two main pillars. First, everything related to infrastructure and data and what our country has accomplished in this regard. And second, everything related to the AI Act, meaning the regulation of the EU and what it involves in this sector. Because I'm a representative of Greece in the EAI work. So in order to use artificial intelligence in any area, especially in medicine, you need to have data, a lot of data, a great volume of data. Second, data that is quality data. And thirdly, you need to have multiple sources. But what is also important to accomplish that is to have this data, to have quality data. And in order to get information from different sources, data from different sources, you have to be able to source them from different registries, different agencies of the state, for example, because we're talking about different hospitals, about prescriptions, about lab tests, different sectors, and patients or citizens who work with all of who relate, for whom this data is about. They have to be treated in the right manner. So you cannot have information contradicting each other in terms of the tests, in terms of the treatment, in terms of even their address. And we have worked a lot in this area in order to clear up registries, in order to find mistakes, errors, so that you can have one single number for everything, and you can have cross references, you can have interoperabilities in order to deal with tens of thousands of problematic cases where you didn't have the right correlation between different registries. And also, we have identified thousands of cases of double social security numbers, and we were able to delete them so that each citizen can be represented by one unique number. This is about consistency. If you have consistency in your data, you can have quality, and you can use this data with AI. Our country, Greece, is one of the 7 countries that have submitted proposals for AI factories. And those proposals have been approved for funding up to 30 million. What are AI factories? It's not infrastructure. The supercomputers needed for those for this are there. But practically, what that means is that by investing in 3 sectors, LLMs, because we need to have a language model for Greece, in culture issues, and the third important aspect is health, then we can get for the sector the supercomputer infrastructure needed, the data that will be the ecosystem, with the right researchers, the right members of the academia, the right doctors, the right people to use this data. Now, in Greece, a very specific ecosystem that has to do with health, with cancer in specific. If we use the right people to do the right research with the data that must be there in order to be used, not only data about their health, any type of data that may be needed for this purpose. And with the right computer infrastructure, we can invest so as to get the right outcome meaning the right conclusions, the right targets, and the right results. We cannot be specialists in everything. We cannot invest in everything and improve ourselves in everything. But in this sector that we have chosen, we want to be the leaders. And you understand, in Europe, everything related to health, to medicine, to biomedicine is very important so that Europe can maintain its competitive advantage. In relation to data, we believe that we will create this ecosystem within 2026 because AI factories will start in 2025. So within 2026, we will have this ecosystem that will allow us to invest human resources, computer infrastructure, and data so that we can have the best possible outcome for everyone, for all stakeholders to use. Now, lastly, the use of this data by the private sector, because private sector also carries out research, and the ministry promotes a bill that will allow the private sector to use data by the public sector. This is something that will be here shortly because it's something that Greece was missing up to now. And we're talking about data for social security, for taxation, for anything. And there is no framework to allow this type of use. So we're going to create the framework. And that's it about the law. Now, about the regulatory aspect. With the AI Act, there's special consideration for medical imaging, specifically in relation to cancer. I don't want to go into details about research of the past in relation to prevention or early detection and the results. We heard the numbers. This is all known information, but in practice, this is something that touches on issues that the AI Act includes. So there's specific section for medical devices and how these are to be used and what is to be done with the results that arise, and also something important with high-risk systems. Now, hopefully I will have the opportunity to talk again later on, but we are participating in this AI Act issues, especially for the subgroup that has to do with medical devices, and I think we're doing our best so that our country can use this and we can implement, we can proceed always in compliance with the AI Act. Thank you.
Thank you very much indeed. So Manolis Tsiknakis, Professor of Biomedical Informatics and eHealth. Over to you.
Good afternoon. I would like to thank you for inviting me for the second year to this very interesting event. I will try to be very brief, and I hope that I will observe the time. In this limited time, I will present to you the role of Greece in one of the big and iconic efforts made by the European Union in the context of the European cancer-beating plan, which aims at the federal infrastructure for the management of cancer imaging. And generally, it relates to the UKIM project. Before I talk about this, I would like to say that the European Union, back in 2020, when it first started to present the plan, the European Cancer Beating Plan, stated that 2.7 million in the European Union were diagnosed with cancer. 1.3 million lost their life because of the disease, and even though Europe represents 1/10 of the global population, it records 1/4 of the cancer cases in the world. The overall cost, based on the analysis of the European Commission, was over the 100 billion euros. So I believe that it was very clear that the European Union had to establish a cohesive plan in order to deal with cancer. So the European Cancer Imaging Initiative that is implemented by the project entitled EUCAIM is a quite ambitious initiative. It is the flagship of this project, and it is a flagship because it is based on the two main issues mentioned by Mr. Anagnastopoulos earlier, and these are the effort to complete the necessary developments using big data and using AI. It focuses on imaging. And this is not random, because imaging, medical imaging to be more exact, constitutes a fundamental source of data and plays a significant role both in the early detection, about which we talked quite extensively in the context of the previous sessions, the precise diagnosis or the choice of the optimal management of cancer, and also the development of a personalized therapeutic protocol. Now, what is the ambition behind this initiative? As I have already said, is to establish a federal, not a central database, a federal database, a federal infrastructure that will interconnect autonomous, heterogeneous data that will lie in the different European countries or in multiple agencies and specialized cancer treatment centers. I would like to briefly mention that this initiative was based and actually came about as the result of some former research and development projects that were implemented in the context of the Horizon program. And they were called AI for Health Imaging, and they were focused on specific kinds of cancer. One of these 5 projects that had been funded was the ProCancerae project that was focused and continues to focus on the prostate cancer. By the way, I had the honor and the responsibility to moderate this project. Now, the EUCAIM project has the same very ambitious goals, both in terms of the size and the quantity of the data that it will collect and homogenize, so as the quality of this data, as it has already been mentioned, is the right one, so that this data can be used by modern technological approaches and by AI. And at the same time, the prediction is that by the end of this project, we are now in the middle of the implementation process, to have already produced tangible results, 50 different specialized models. This is the objective, in order to deal with the different subtypes of cancer. Always, of course, with full respect of the Code of Ethics of the European Union, which means GDPR, and of course taking into account the provisions and the regulations that apply in relation to AI. Now, a few words about what Greece is doing. I will not take more of your time, just 1 minute. Greece has an important role to play in the implementation of this project, since it coordinates one of the big thematic units that aims at shaping the framework and the technological solutions that will be used in order to homogenize data. and to develop the appropriate tools that will guarantee their quality, the evaluation of the quality, and a series of other computing tools that will support the infrastructure. Greece takes part, and by the way, I have the honor to coordinate this thematic work group. So Greece takes part in this project through the Aristotelian University, the National Kapodistrian University of Athens, the National Research Institute, and the Hellenic Cancer Society, while at the same time an important role is played by the Research and Development Department of an Italian company that has its headquarters in Athens, and which is taking part in this project with Greek engineers and other Greek scientists. In conclusion, I would like to say that the EU CAIM project and the overall effort is indeed a project. And before we heard the discussion about the different project strategies, there has been an effort to ensure that after the completion of the project, there will be continuity. There will be the sustainability of the results of the project. So the infrastructure that will be developed will continue to exist. Now, the way that this will be done is based on the utilization of new tool, Digital Europe, and more specifically, the Digital European Innovation Consortia, and always in the context of the project. In this project, we have representation of the different ministries of the country and Ministry of Digital Governance included, and the Ministry of Health. In other words, the competent political authorities monitor the operations of the working group that will shape the proposal for the development of EDIC. And our hope, and my hope, is that at the end of the day, our country, along with other European countries, will take the final political decision to participate in the founding of EDIC, and thus ensuring the long-term sustainability of the results of the project. Thank you very much, and I apologize for taking more time.
Thank you very much. Obviously, it's good to hear more about this project in detail, but we have 3 more speakers and not so much time. So if I can just ask everybody to try and stick to the time, and then we would be able to have some questions and discussion. Otherwise, we will not. So over now to Nikki Tsuma, Chief Executive, E-Government Centre for Social Security Services. Welcome.
Good afternoon, and thank you for the invitation and this opportunity to present some information and some thoughts on cancer treatment and modern means. We've seen many times technologies being presented as a cure-all, a solution for all problems, especially for cancer. I'm sure that you've heard or read about innovative new technologies to treat cancer. As a computer engineer, I'd say that to achieve a technological solution, we work daily on our systems, and the reality is that every day we're taking steps forward. I'm not an oncologist, so I don't know about the disease, but I am the head of IDICA, the agency that develops applications, systems, and services for the healthcare sector in Greece. I can obviously not tell you what our research is doing at their labs, how treatments are improved, and how the research effort improves the quality of life of the people who are dealing with cancer. What I can tell you is that we work closely with the different healthcare agencies in Greece and in Europe, with those who shape our policies and those who work in healthcare provision, so that we can contribute to their work. 2 or 3 weeks ago, the Minister of Health, Mr. Georgiadis, announced the launching of the comprehensive oncology care system, oncology patients care system. This is a system and an iconic project that includes the National Registry of Neoplastic Diseases with national coverage, which was a request of doctors and patients alike for many, many years. So this national registry is there. It is operational. It has been created. This project also includes treatment and oncology and blood protocols for following up the patient treatment plan, and also informational system on the blood work of patients. With these actions, what we accomplish is everything that we had been discussing so far, meaning one single management system for this data on a technical and also on a medical or research or treatment level. The treatment, oncology, and blood protocols will be common for all doctors in these hospitals, and also the systems to follow up with the disease, to monitor the disease, and or provide treatment through these protocols. These applications have been developed under the IDICA coordination and under the institutional coordination of the Ministry of Health. These are digital tools that support both the work of the doctors and the patients' daily lives. We are currently designing and will soon provide tablets to help patients use a number of tools, such as they will be able to access their treatment plan and get reminders. They will be able to self-report some symptoms through questionnaires that are selected by their doctors that use the same system. They will have access, qualified access to their data in their file. They will be able to communicate with the treating physician or the physician's team. There will be an interoperability with the system, the hospital systems, so that those 12 oncology hospitals can have a unified approach. They can get information, useful information for the relevant healthcare providers, and also get information on other issues such as health, diet, etc. There will be an ability, the possibility of remote meetings with the doctor, and we are also standardizing the history of the patient based on international standards, the medical history. We are going to be able to use the material and essentially create a community of patients that can communicate with each other and can communicate with the physicians' community, the doctors that are treating them. We will be managing the patient's informed consent for distributing their data to other doctors aside from the treating physician. There will be the ability to record side effects from drugs, and also the ability to support end-stage patients at home, to provide home care. So this system, which will be fully comprehensive, completed this year, fully integrated, that will provide full data for oncology patients available for use both by available to the ministry in order for the ministry to formulate its strategy, and to the patients and the doctors in the form of a community that will be created through the use of the system. As I mentioned at the beginning, there is no one technology that can cure every problem, but there is that technology that can improve the quality of life of the patients and to help us monitor all those critical indicators that will eventually help us upgrade that the quality of lives. We are in open communication with the Ministry of Health and the healthcare professionals, and our goal is to offer reliable, safe, and high availability services that will contribute to upgrading our national healthcare system and improving the daily life of our citizens. Thank you.
Thank you very much. Over to Anastasios Boutis.
Thank you very much for the invitation. It is a great honor to take part for the 5th consecutive year in this event, in which all the institutional representatives that are involved in oncology care in the country are taking part. I'm delighted to see that every year that we are meeting, we get to hear some new developments that are not simply theoretical, but have been put into practice. And this proves that we are making steps forward. We should not forget that health management and that oncology care, in order to be comprehensive, require solutions that promote the overall care of oncology patients, always with a safe, fast, and useful way. And the Society of Oncology Doctors that is represented here today keeps track of all these developments and also keeps track of all the needs that have emerged, especially after the COVID-19 pandemic. So the Society, along with others, has made significant steps forward. The first was the development of an electronic file of patients that we gave for it to be used to the scientific oncology community, and this actually allowed for the very first time to easily record, store, and search data that aim at providing better care to oncology patients. It also allowed the collection of critical scientific data, which means that now we have the possibility to measure and evaluate the clinical results that have been produced. And of course, all this data can be utilized even at a later stage in order to extract some scientific conclusions that will benefit the overall scientific community. The second thing that I would like to mention is the National Registry of Neoplastic Diseases that has been developed. This constitutes a landmark for the oncology care of patients in Greece. It is something unprecedented, and you will allow me to say that during the last 50 years, it has been riddled with problems. But in February of 2024, the law was passed following the ministerial decision that allowed the establishment of this national registry. And now we, the health professionals, the doctors, are in the position to enter the data of patients in this registry. And this will, in turn, give a major boost to the production of a serious scientific data that will then be used by the state in order to draft health policies for the oncology patients. This data will also be used in order to develop scientific and academic initiatives. And for the very first time, we will have the possibility to extract and share information and data with the international scientific community, something that to date was only done through the use of indirect data and only with neighboring countries. I don't think I need to elaborate more on that, since many important developments have already been mentioned by the previous speakers. Ms. Tsuma actually mentioned a lot of them. Now, what are we going to do as of now? We are going to legislate a better reimbursement framework for biomarkers. With regard to that, our society coordinated a work group in which the institutional representatives took part, but also patients' associations and health economists. So we will get to see what this work group will produce. Moreover, we expect to see the full implementation of therapeutic protocols that are now in the stage of parameterization and digitization. And during the last few days, we have seen the emergence of the integrated system for the care of oncology patients. We have the honor as the Antikarkenic Hospital of Salonika Theagenio to be taking part in this. So in the coming weeks, we are going to use for the very first time the therapeutic protocols. Now, something else that is very positive is the interconnection with the hospital drugstore. And for the very first time, there's going to be a digital management of the oncology councils, which is a major step forward. At this point, I would like to close this brief intervention and say that it is a great honor and pleasure for us as scientific oncology community to play a central role and to cooperate so harmoniously with the state and with the rest of institutional agencies. And once again, I would like to express my gratitude to all these agencies, to the Ministry of Health that has been supporting us. And of course, I would like to thank all our patients that have allowed us to digitize the data. Thank you very much.
Okay, thank you very much to the... Now I hand over to our commentator, Anastasios Kyriazoliou, medical oncologist at Attikon University.
Καλησπέρα και από εμένα.
Good afternoon, and thank you for the honor and the invitation. I was kind of wondering why you have invited me and why you have given me the role of the commentator, and I guess someone had to be the one to complain. I think I'm going to play this part. I'm going to be the least grateful among you because my view is that digitization is the fundamental equality of, it gives equality to citizens before medical services. And this was a great accomplishment through the vaccination program. Of course, that was a service given once, so it was a lot easier to create the system, and it made easier the life of the patients as users and the doctors as users. Oncology patients, fortunately, we have turned them into chronic patients, and the case here is more complex, but it is obviously clear that data is important for the ministry, important for the governments, for them to be able to allocate their resources. But on the other hand, we need to consider that we have created, and it's a good thing that we have done so, we have created a patient-centered system and doctor-centered system, and now it is time that with digitization, with everything that we have starting to do, because I'm part of those 12 hospitals that hopefully will start using the electronic patient folder and now record. Now we need to eliminate the standard, the model, the paradigm of the patient that was carrying around a suitcase of documents. Let me just tell you that I was looking to buy a laptop with a CD player, and there are none. But technology is moving forward. But still, in our minds, we have the patient that is carrying around that suitcase of documents. We have this patient that we've seen it maybe in Thessaloniki, in Crete, everywhere. And we have patients that see different doctors and no one knows about it. We still have this idea of a patient and a doctor. I have 115 messages unopened, and all of them from my patients. So this type of equity brought on by the electronic registry for our patients is the most important thing, and hopefully it will make the life of the patients easier and better, because these are the lives that we need to address first. The system should be patient-centered first. We need to make the life of these people easier. The ministry, IDICA, all its agencies need to immediately have this registry, not just for those 12 hospitals, because oncology is not just for these 12 hospitals. There are other private healthcare centers too. There are other hospitals that need to be included. So we should stop making the lives of these people harder. That's all. Thank you.
Excellent. Thank you. Very little time now, unfortunately, for the Q&A and discussion. But let's turn first to the Secretary General to see if you want to respond to some of the questions or points that have been made. I mean, my question would be, you set out quite ambitious program of what is to come, what you intend to do, including the creation of these AI factories and so on. But what do you see as the main kind of challenges in improving this digitization process and establishing those factories? Is the problem funding? Is it a question of having the personnel, qualified personnel? Is it a problem of the data itself and insufficient data or unhomogenized data? What would you say is the kind of biggest challenge? What will be the biggest challenges in the coming period?
Thank you for your question. Ευχαριστώ πολύ. Νομίζω το μεγάλο θέμα είναι αυτό το οποίο...
I think the most important issue is what Mr. Kyriazoglou mentioned, and thank you for asking the question. And we like having this type of complaints, especially when it's not really a complaint, but rather hints or suggestions in the frame, in the context of an effort that everyone understands needs to be a joint effort, irrespective of the policy being implemented, irrespective of the table around which we sit. We are now from the side of the ministry or the agency or sometime, so we can be on the side of the patient. These things happen. And it's not nice to say that now that we're in this position, we are not being taken care of. So that's important. So generally speaking, this folder or this bag of papers, this suitcase of papers, the certificates, everything that you needed to submit to the public sector in order to get service, this is not the case anymore. It's not happening because of gov.gr. We know that with the interoperabilities that we have established, we are avoiding all these things. This is why citizens can log in, make an application, and then we, as a state, transfer all the data that's necessary so as to provide the help we need or process the request. For example, they say they can get the information on how many children I have and cross-reference, or information on the tax, on the taxation, or whatever, the income. We have done that, and that helped us create services such as the vaccination program, where a father would go in and make an appointment for their child. That meant that we knew how many children that father had, which is information that we didn't have until recently. Something that may seem simple now, but we need to go through 4 different registries from the state in order to get the information and put everything together. So we are going to have more, and Mrs. Zuma can tell you more specifically on the patient file, patient record. But on my side, I can tell you that really we all understand we need to improve on this, and we have taken steps forward in this direction. And we realize the reason behind this, and we realize we don't have a lot of time to do it. So the most important problem, and what answers your question, is consistency. Consistency, we need to be very consistent in what we do, irrespective of the government, of the ministry, of the agency, the minister, whatever. We all need to serve the same purpose, and we will going to accomplish this. We're not lagging behind other countries. It's a goal that we need to accomplish and stay ahead. And I think that's the central message, that we want to be ahead in this sector. Thank you.
Thank you. Maybe I can jump to Ms. Tsuma again, just to ask you what you see as the main challenge, and how will EDICA, cope with this workload, for example, entailed in this whole digital revolution that is taking place? Is that something that you're confident that you can manage?
The truth is that in EDICA, the solutions we develop need to be comprehensive and need to be applied to the entire population. And because of that, we bear a major responsibility and at the same time a major apprehension of what may happen. But since the country has obviously made significant steps in the direction of digitization, I would like to highlight that today I talked about the project of the oncology hospitals, which is just one project in a huge framework of projects that are taking place right now. Of course, I said that because with all these other actions, what we are trying to build is the national file of oncology patient, which in 2 months' time will be ready. And in this project, we have collected all data. And stop looking for PC with the CD player, because the RISPACS project, has led to the installation of RISPACS in all hospitals of the country. And now the images arrive at the cloud, and these images coming from the hospitals are in the file of the patient. So there's no need to carry CDs or to try and find PC with a CD player. This file will include, apart from the oncology data, all other medical data of patients. The system, however, of the oncology hospitals makes provisions for the daily management of oncology patients. When, for example, a doctor wishes to check the file, this doctor will not get all the information that the oncology doctor has. And the same stands for the oncology patient when they are trying to find some additional data. This is how the file is structured. And I would like to say that one of the major challenges is that we have this parallel project implemented in all hospitals of the country in order to have all the hospitals of the country at the same level. This, of course, will allow us in the future to assist the doctors that work in the hospitals. They will be in the position to have access to the files and to the data. And yes, you're right. Maybe I have consulted you today or have consulted another doctor in the past. The point is that this will change in the future. And this, however, will be the major challenge. But I believe that we will make it.
Thank you. So we're kind of out of time already, but I just wanted to give our two other panelists the chance to respond, if you want to the question or the point posed by our commentator. If you would like.
I would just like to say that what is needed is for us to be honest. Up until very recently, the level of digitization of the Greek society, of the country in general, was lagging far behind. Are steps being made? Yes, significant steps have been made lately. Are we at the point that we would like to be? No. If we want to be honest, of course. But we all understand that this effort requires time. And in order to connect us to the UKM project, I would like to say that we need to distance ourselves from the rationale of project and to come up with strategies and plans that will be sustainable and that will create value for the Greek citizens. National projects, I mean. Thank you. I believe that all the important points have already been mentioned. Now, in my view, the biggest challenge is the coordination, the central coordination that needs to happen, as well as the utilization of the scientific workforce of the country that is highly specialized and of a very high level. I believe that the national institutions can actually shoulder the burden of this digital revolution, and this is actually the case compared to the past.
Join me in thanking all our speakers. That's the end of the panel. And we're continuing on the same theme, but widening the lens beyond AI in the next panel. So maybe we'll have a photograph, but thank you very much, all of you. Thank you. Thank you. Okay. Our next session is entitled A Glimpse into the Future of Cancer Innovation. And as I said, AI is not the only technology that is transforming cancer research and treatment. So this next panel is going to look at other innovations. So let me introduce all of them. Klaus Schluter, Vice President, Europe, Middle East and Africa and Canada, Value and Implementation, Medical and Scientific Affairs, MSD. Welcome. And have a seat, please. John Soulakos, Medical Oncologist and Professor of Medical Oncology at the University of Crete. Welcome, sir. Ilias Athanasiadis, Medical Oncologist and Director of Oncology Clinic at Mitera Hospital, and last not but least, Ioannis Bukovinas, yes, you're testing me, Bukovinas, Medical Oncologist and Head of the Bioclinic Oncology Unit Thessaloniki. Great panel, great to have you with us. Let me hand straight over to Klaus Schluter to get us started.
Thank you so much. I've prepared some slides and will present hopefully interesting innovations to you, how the future could look like in oncology treatment. First is my forward-looking statement. Just to remind you, even if we made great progress in Greece, but also in Europe, cancer will be a challenge for the healthcare systems. Cancer will be, we will have growing numbers of cancer patients, we will have growing numbers of deaths caused by cancer, even in the future, even if we use the current armamentarium of treatments, diagnostic and prevention we have in our hand. Therefore, we need to look for breakthroughs, innovations, in order to be able to fight against cancer in the future even better than we do this today. And this is a slide from the World Economic Forum, and you see there are a lot of breakthroughs we have to watch in the future in order to innovate cancer therapy, diagnostic and prevention. And I would like to touch on the top of this list on the personalized cancer vaccine, because our company is delighted to develop together with our colleagues from Moderna an individualized neoantigen therapy or you can say, an individualized cancer therapy for the future oncology patients. Why is this rational to do this? It's important to understand never two cancers are the same cancer. Every cancer is different from another cancer. Tumor cells are able to develop, to create antigens which are on their surface. And those antigens are different from cancer to cancer, from patient to patient. And the idea is to develop, to understand the gene, the DNA, the gene of those proteins, and to understand this and to analyze this, and then to produce antigens which are close to or similar to those, or to produce an mRNA, to use the mRNA technology, and then to send the genomic information to the cells, and they produce antigens and antibodies against the cancer surface, and against the antigens on the surface of the cancer. This is the idea behind this individualized treatment option. We are developing this together with Moderna. We are combining the mRNA technology with gene sequencing, which is the base for the production of those new class of patient-specific medicines. Those are medicines which are only for one patient, for one cancer. Really personalized, individualized medicine, and this is how the future hopefully will look like. Just to explain you the production process. It starts with collecting the tumor tissue as well as blood samples from the patients. And this is used to understand the gene sequencing of the tumor in comparison to the normal cells in the body. And this information then will be used for designing the individualized therapy. It will be used and will be included into the mRNA. We all know this process from the COVID-19 vaccines we had in our hand a few years ago. And this is possible for 34 tumor-specific neoantigens, and they are included in the mRNA, will be sent to only produce for one patient and will be injected in the patient. This seems to be very easy, but it takes 4 to 6 weeks before this is possible to administer to the patient. And this is the process we are working at the moment on, and we have this idea behind this. You see this? We send the genetic information to the cell. The cell is producing antibodies which then are able to fight against the cancer cells, the surface of the cancer. This is the methodology, and we have extremely promising results seen in the phase 2 trials, which have been published during the ASCO, the Congress of the American Society of Oncology, in 2023. Those are patients with melanoma, and on the black curve and on the top you see the patients who received pembrolizumab, which is a standard of care, together with this new individualized neoantigen therapy, and on the blue or green line you see the patients which only received pembrolizumab. And you see the difference in terms of relapse-free survival compared to the standard of care of pembrolizumab. 22% events in the group of mRNA plus pembrolizumab, and 40% in the group of pembrolizumab. And if you look to the distant metastasis-free survival, the numbers are even more impressive, 8% events compared to 24% in the control group. This is really convincing, and this has been the reason why we, together with our colleagues from Moderna, decided to start phase 3 trials in many countries all over the world. And I'm happy to say that we have also clinical trials running in Greece and other European countries. And I would like to share with you the challenges we see in those clinical trials at the moment, because we believe the healthcare system needs to be prepared for those individualized, personalized medicines. It's important to understand the way of the production, and you need to discuss this and to have to prepare this with the authorities which are approving personalized medicines. Those are, in a nutshell, vaccines. For vaccines, normally in Europe, you have to get a batch release for each single batch you are producing. The question is, do we need batch releases for each single patient? Because it's always another product. It's not a one-fits-all medicine like we know this from other medicines. You need a cooling process. This product needs to be transported with minus 90 to minus 60 degrees Celsius. And this is a logistical challenge we see. Of course, we need this dialogue with regulatory authorities, and for the future, we will definitely, you understand, it's a complex process, which also means a lot of costs based on the production side. So we need to find ways how we can make this affordable for the healthcare systems in the future. Those are the challenges. I don't want to go into the details, but it's a good message that we are able to have clinical trials in Europe. And I just wanted to show you the clinical trials MSD is running in Greece. It's not only about this new product, it's all about our oncology portfolio, and we have increased the number of clinical trials in Greece because of the excellent infrastructure we have in Greece, because of the excellent scientists and researchers we have in Greece. And I would like to thank the Greece healthcare system for making this possible for us as a company to execute those clinical trials together with our company here in Greece, and especially the V940, the new product, will be an interesting product also for clinical research in Greece. Thank you so much.
Thank you. Some very exciting news there in that presentation. So, Professor Ioannis, over to you.
Thank you very much. Thank you for the invitation. And I would like to thank you for including all three of us as a team. You have given us the opportunity to present to you the basic principles that bring us all together, even though we are working in different cities of Greece. We have decided to make a joint presentation. So I would like to touch upon the main points that will be further elaborated by Elias and John later. So allow me to make a brief introduction. Apart from innovation in drugs, the management of patients through liquid biopsy is of equal importance. I come from a laboratory, I come from a university where the first sample of liquid biopsy arrived in 1994. In other words, we have a 31-year-long experience, and we are delighted to see that what we initially believed in has become a reality now in oncology. Why? Because it will help us understand the basic problem, which is none other than the clonal progression of the tumor and the resistance mechanism to whatever we are doing. However, this will be analyzed a little bit more by Mr. Bukovinas. I would also like to say that we have undertaken the management of patients through the provision of care by the right people in the right centers, and we have also promoted our interconnection with the scientific networks. And I will give you an example at the end of that. The last point I would like to talk about is the targeted screening. The model of population screening should be left behind. We have reached the point where we need something more. One of the applications that will be developed is the identification of the early development of tumors. And by the way, we are very proud of having a Greek abroad, Nicholas Papadopoulos, that is leading the cancer mood score that pertains to the detection of tumors in the blood. Now, the detection of risks. In other words, identifying the groups of people that we need to focus on is another major bet that we need to win. And in order to win it, we need to have data about their quality of life, about their DNA. It seems that all these risk models that are based on the PRS, and by the way, there is huge literature produced by many countries, Finland being the first. It has some hundreds of thousands of analyses of its inhabitants. All these can assist to the identification of the different types of cancer risks. And allow me to share with you a couple of examples that are typical of the importance of scientific interconnection. I would like to talk about the MCAPES program that allows the recording of different types of tumors. We are now in the position to provide different sorts of treatment to patients without them having to pay. This, of course, is a major development since the state is not in the position to cover some increased costs that these patients need to shoulder when they are subjected to this test. And the second is the example of the precise identification of sarcoma, something that saves 1 out of 3 patients from a false diagnosis. These are some of the examples I could share with you. The rest will elaborate on the other points I mentioned.
Thank you very much indeed. And over to your colleague to continue.
How do I change this? Go back. So I'd like to
Well, thank you for the invitation. It's an honor to participate in this conference that brings all these different agencies together, and especially for us to be here and tell you each from our own side how we see things. First of all, let me tell you how I have seen oncology progress through my lifetime and give you this glimpse to the future. So oncology is a relatively young science. Oncology, the American Oncology Society was founded in 1964. Essentially, they started with cancer was treated by doctors of any specialty until at some point we started having success with testicular cancer and other types of cancers, and then we needed an entire team of doctors to to treat cancer patients. It was important for all people to beat cancer, and this is why we created this team. And we brought together many different people that had one common vision to develop a cancer treatment. It's what we have experienced all these years. It started with a few people in humble positions, but they had a common vision. This is the story I'm going to share with you and what made them special. They had a vision and a vision towards the future because they believed that this was going to happen. It was not enough to rest on the success of the past. We needed to analyze cancer in a better way and get more individualized treatments that gave hope to people. And hope is contagious. And this is how we established the project of hope, a process where hope goes from one person to the other. And then there's a demand for better organized, individualized treatments. To give you an example, MD Anderson started in 1946, a humble establishment, but a visionary one. The Anderson family has lost a woman, a family member from leukemia. They spent a lot of money to the cancer treatment research. And then in Texas, they had this vision, and they created the Texas Medical Center in this real estate that was available. And now it's one of the largest oncology centers in the world. It's a huge establishment, nothing to do with the previous one. And they were proud of the fact that hospital beds were less, the area for the hospital beds was less than that of the laboratories. And there were people working together to bring together the biology of cancer and treatments. So now we have a different type of oncology. This oncology, as you heard in the previous speech, is based on accurate diagnosis and gene type. Cancers develop in their own way, and each of them has its own course. No people are not the same. So individualization is also personalization, because people, the cancer depends on each person's characteristics. All that along combines clinical research and treatment. So the clinical trial of today is the treatment of tomorrow. And it's part of what you do every day. And this is why we're found, all of us, in the same space here. We want in Greece as well to have access, better access to new treatments, to new ideas, and to all these things that will bring the treatments of the future. This is why we believe we have created the foundations that will attract the new treatments. Without new drugs, we cannot accomplish what we want to do. And people are part of this. We represent people, and we prioritize all these things to do them so that they are human-centered. Care for people is a priority. Progress, whatever you do for the few, then becomes available to the many. We talked about Mitera Hospital. It was a general hospital mainly for giving birth, but now part of the change is to create a daily care unit. In the past, hospitals were full of patients. Now we have outpatient centers. You cannot hospitalize hundreds of people every day. So the one-day clinic is what we created in order to have treating physicians and pharmacists and all of them be able to provide care in an organized manner. And this is the environment where you can actually create the right conditions to treat cancer. You approach the right surgeons, the right radiologists, and the right people who treat cancer as their main profession, not as part of the profession. And you also create the tumor boards, because it's a way for people to work together, think alike, and not work individually. So this is the right environment to provide the newest treatment. So what is a cancer center? Not all hospitals are cancer centers. Sometimes they're general hospitals. But we're talking about a hospital with a large number of patients, all specialties involved, surgeons that are oncology surgeons, professors of oncology, a good internal medicine department, nuclear department, a molecular oncology, in order to have access to all these treatments. This comes with a set of obstacles and challenges. First of all, you have conflicting interests. The fact is that not all hospitals want to proceed with this type of treatment. Some hospitals have a different vision about treatment. So both us and the hospital have to have clear boundaries and rather clear prioritization. A priority for us is to overcome the obstacles to access to new treatments. And these problems can be many. A lot of people are being excluded from care, especially in the US. A lot of them don't have access to care. We at private companies see insurance companies develop sometimes even unethical methods to keep people from paying people. So this is an opportunity, talking about insurance companies, because in the States there are insurance programs that pay for new experimental treatments and create strong opportunities. And here's an opportunity for insurance companies, if they to add value to this process. And finally, if we give power to patients to have a say, to be part of the process, we believe that's an important step for the future. This is all. Thank you for your time.
Thank you very much. So finally, Ioannis Bukovinas. And may I ask, could we bring some new water and glasses for the speakers? Because I don't think we changed them. So, yeah, go ahead.
Good afternoon to all those who are still here. I'm sure that you have heard very interesting presentations by the two friends and partners. I would like to touch upon one point that Yannis mentioned, and that is the multiple uses of liquid biopsy. This is very important because apart from the early detection of cancer, what he said about Nicholas Papadopoulos, there are a series of applications that are in development. All of these aim at identifying the profile of the tumor in the blood. It is wishful thinking, of course, to have always biopsies, but this is not always feasible. So if we want to customize treatment today, we need to use the biomarkers of the past. But now we mostly use the liquid biopsies. And of course, there are many steps that we need to make. We are still in the beginning. Still, the applications have proven to be very successful. And I would like to show you an example that has to do with the personalized treatment of the patient before the operation, after the operation, the early detection of relapse, and the better understanding of the mechanisms of resistance to one specific drug. This is the biggest trial that was announced in January in ASCO GI. Of course, it was conducted in the United States, 1,800 patients in stages 2 and 3 of pancreatic cancer. One can see the impressive results of this study with the 2-year monitoring time. They could change the treatment. 1 out of 6 patients could or not get treatment. The oversight of these patients was focused on detecting areas that were difficult to access with MRIs, like the lungs and the peritoneum. The measurement of cDNA showed that it was highly beneficial when one identifies early a light burden of disease in the treatments that are aimed at the local treatments of metastasis. And of course, there is a correlation with the previous references. And this means that there was a high chance of having a prognostic disease-free survival with a minimal residual disease, as is it traced by cell-RNA. And the adjuvant treatment was successful only for those who had a positive circulating DNA. So you can see the revolution that is taking place. You can also see that now there is the possibility to have a more early understanding compared to the past. Of course, there are many other challenges that pertain to the cost of these approaches, with the time required to get the result, with the fact that there are different techniques that can be followed. And for the time being, we don't have strong indications about the clinical management of patients. So through a liquid biopsy, and I'm giving you an example of a patient of mine, we have an EGFR positive metastatic cancer of the lung that had received the simertinib for 1.5 years. There was a generalized progression of the disease, and this is how we got the results, which shows that there are still clones that express the EGFR exon 19, but there are also 2 new clones that express the mirror of this mutation that responds to a previous drug, gefitinib, and at the same time there's KRAS Z12 mutation that responded to sotorasib. So what kind of treatment are we going to administer? We have 5 different choices. The now new rationale of the oncology board is not enough, since an oncology board that comprises some people of a center of experts that can be scattered around Greece or around the world is not enough, which means that this center needs to be turned virtual. And there have to be also the necessary conditions to analyze the individualized information you get from any biopsy in order to get a good result. Of course, this has been established in many countries. I believe that it is the future in which we need to invest. many challenges, of course, pertaining to all this. Who are going to be the members? What is going to be the standardization? What is going to be the flow of the patient? The time required to get a result, which may be detrimental to the patient. Some variables that are of unknown clinical importance, the random findings, all of these will not have value unless we have access to drugs that are being developed and are targeting specific mutations that may come up following some tests. So innovation has value only when there is access to novel treatments. And of course, at the same time, what is needed is the ability to make changes, like the changes that can stem from the real-world data and that can change our daily practice. Thank you very much for the invitation. Later, I will tell you what we can do in Greece about that.
Well, thank you very much, all the panelists, and it's very nice to have this joint presentation kind of by the three of you. We started late, so I think we can go a little over the time in the program, so we can have some discussion up to 5 o'clock. So Mr. Schluter, first of all, wanted to give you the chance, obviously, to respond to what your co-panelists have said, anything there. But you, in your presentation, you really pointed us in the direction of all new trends in pharma R&D regarding new treatments for oncology patients. I guess the question is, how can healthcare systems adopt this or integrate this, these innovations in a sustainable manner?
If I may, I would respond to the colleagues in the panel. I think this is the right way to have centers of excellence together. If you look to the US, for example, our company has a huge research lab in the center of the Boston University. Scientists are working one day for our company, next day for the Children's Hospital, next day for the university, and doing research. And this is the connection between private and public research and development. I think we need this. We need to include digital understanding, digital expertise in those centers. And I think this is what we in Europe are missing in many, many countries, to have this comprehensive cancer centers, also including all non-medical innovations which are important for cancer patients in the future. This is my comment to you, and I think those approaches, the innovation in diagnostic, the innovation in therapy will go hand in hand in the future to hopefully cure cancer at one day. I have also 40 years experience in medical, and I remember when I started to be a physician, the diagnosis of cancer meant you will die in 6 months. Today, cancer are chronic diseases, and we are able to treat patients for a long time, and this is a great progress, but we can do even more. Coming back to your question, for me, this is a task for us as developers. We have to translate the individual value of one single patient to the value for the healthcare system, in order to find ways how we can finance those innovations in our countries. This is a challenge for our countries, for sure, but I think we will be able to find ways to demonstrate that this is cost-effective, and we need to demonstrate that this will not only be a value for the single patient, but also for the healthcare system. And we are prepared to discuss this with healthcare, with the healthcare environment and the healthcare system. Last topic I would like to mention. In Europe, we need to prepare the regulatory framework in order to be able to bring those innovations to Europe. Sometimes we are extremely complex in Europe. If you think about all the EMA processes, the EU CTR, all those, the clinical trial regulations, all those processes are hurdles to bring innovations to patients in Europe, and therefore we have also to create the right regulatory framework in order to be able to bring those innovations to the European patients and healthcare systems.
Thank you very much. Well, to turn to the three of you now, yeah, I'm sure you were all nodding when, in response to that call for more collaboration between the public and private sectors, the need for these more collaborative cancer centres. So maybe you want to comment on that. And maybe also on the question of the regulation in Europe, which obviously affects Greece. So feel free to respond to that. But I wanted to ask you a question in turn as well. So perhaps first, Mr. Soulakos, just from an oncologist's perspective, how does pharmaceutical innovation improve cancer care for the patient?
This is absolutely the basis of our work. We are talking for innovation in cancer care because we have new, more effective drugs, and this gives us the opportunity to explore all the other possibilities that we have, like ctDNA, molecular MTD. If you have a molecular MTD and the decision is that we need a drug that should inhibit AKT, for example, we should have an effective and tolerable drug for this. Otherwise, it doesn't matter what the molecular MTD say, isn't it? So, and just a brief comment for the morning session about the comprehensive cancer centers and etc. in Athens and elsewhere. You cannot have a comprehensive cancer center without an academic institution attached to a hospital. It's not a comprehensive, it's comprehensive care, cancer care, yes, but it's not the whole thing. And also, in the recent years, this should be also associated with a collaboration with private sector, either a pharmaceutical company or a company that develop biomarkers, new image techniques, etc. For example, I have in mind the paradigm in Toulouse in France, where in the local university they built a new facility with Pierre Fabre laboratories and a new cancer center. This is a comprehensive cancer center.
Mr. Athanasiadis, maybe you could tell us a bit more about the innovative approaches that your one-day treatment center in Mitera.
And I'm going to respond, but also to respond to your comments, which are very creative. Let me tell you that we are very much eager to develop our connectivity with other cancer centers. And actually, the direction of the hospital is ready to give us all the technology so we can have like mutual conferences and creating a network. Actually, the three of us can be part of a network because we're working the same way and we have the same devotion to science, even out of the university or in the university. And thinking that it's actually our dream that we can connect to you and be part of a network, because I do believe that if we have good data, what we create out of our patients is actually a treasure. Because if you take all together with all treasures, then we can have actually useful information about the real-world data. And now about what you presented about the new antigen therapies, we'd like very much to see how it is applied, because actually we'd be willing to have the point of excellence that you need to get into this. So to your question, I would say that we are really eager to develop the structures. This is what we are doing. Actually, we are in a private hospital. We believe they have a dream to develop cancer care and not just to improve their income for the next year or two. So they are very ready to listen and most of the time ready to apply this. And so it's wonderful that I hear your comments and we are ready to proceed.
Great, thank you. And finally for Mr. Bukovinas, I wanted to ask you what From your experiences, what are the challenges for adopting treatments for the rare cancers?
Θα μιλήσω στα ελληνικά.
I'm going to answer in Greek. I think that this is a great, those rare tumors is a great area to create new sources for developing drugs, new nests, this drug indication, especially for drugs that have a benefit for, or don't have a benefit for pharmaceutical companies, so they can apply at the NMA to get an approval for a new drug. This is an important change that occurs in EU. Second, we have a networking of specialists for rare tumors. There's recently a new effort being made for ultra-rare cancer tumors, less than 1 among 100,000 people, which we're making an effort to create a network for some of those extra-rare tumors and get real-world data, because that may change the treatment plan for any patient. And we have these orphan drugs. Our goal is for even a greater range of cancer cases, such as breast cancer, or sarcomas, or other tumors, they can become a new area for pilot implementation, given that we have the technology available. For example, T-cell therapy for sarcoma, the first approved treatment in the US, which requires collaboration, dedication, and mainly an investment from the part of the society. And by society, it's not only the state, it's the pharmaceutical companies, it's the scientific organizations, the universities, the national healthcare system. All of that, they may invest, because there's no mistake here. It's nothing, it's only progress. Recently, oncology is nothing more than the art of managing rare tumors. With molecular biology, any cancer is part of a rare tumor category. A red mutant lung cancer is a rare tumor. So this is how we need to look at things from now on.
Sure.
It's a clear development that we see more and more research and development which is independent from the cancer type. It's because we understand more about the genetic of tumors and cancers, so the recent developments are independent from any lung cancer, bladder cancer, or renal cancer. It's more to understand the methodology, to find ways how we personalize, how we identify the genetic base of the cancer, and then you can treat it. So we see more and more tumor agnostic developments, and this is also my hope for rare diseases, like you mentioned before.
Well, thank you very much, all of you, for a very interesting, exciting session. Please join me in thanking all our speakers. We'll have a photograph. Okay, so we're coming to our final full session, and then we're going to have a wrap-up, short final session. So this session is looking at the funding issue, funding cancer innovation. Let me introduce our speakers. Thank you for changing that. For this session, we have Aris Angelis, Secretary General for Strategic Planning at the Ministry of Health of Greece. Welcome. Please take a seat. Next, we have Nandia Yoyozotu, non-executive president of the National Organization for the Provision of Health. Welcome. Take a seat. Emanuela Braudaki, senior consultant, Health Policy Unit CMT Proptiki. This is via connection, so not with us in the room. Hopefully, we've got that connection sorted out, and we have, apparently we have a change here in the program. Vasiliki Rafael is not able to make it, so I think we have a colleague from the Greek Patients Association to replace her, sorry. So I think I just about have your name, Anastasios Samuelidis, is that right? Something like this. And you're the Government Affairs Officer at the Greek Patients Association. Thank you very much for stepping in and joining us. And we have a commentator as well, Vasilios Babounis, medical oncologist, director of the 5th Oncology Clinic, Iaso Hospital. Very nice to meet you, and have a seat. Okay, so we've talked about innovation, and we're going to talk a bit more about innovation now, but particularly we're going to talk about funding, and all this is very expensive, and it's investment is obviously at the core, and continuity of funding for management of cancer treatments and patient outcomes. So this is what we'll be discussing. So I'm going to turn first to you, Secretary General, to start off.
Great. Okay. So thank you very much for your kind invitation. I'm very happy to participate again in this event. I think it's very important to bring policymakers and experts from the academic community, clinical professionals, and industry representatives in the same room for important aspects of healthcare, and in particular oncology treatments. My colleagues have prepared a very nice, well-structured and perfect speech, but I think it might be more structured and user-friendly to just stay here and say a few things out of our recent experiences and lessons learned from what we have been working on at the Ministry over the last few months. I think one of the most important issues modern healthcare systems are facing in view of all the new treatments that are coming to the market is the issue of sustainability. Given that any innovation that comes into the market comes with a very high price tag. We are very fortunate to be receivers of new innovations, both incremental innovations in some instances, but also in some other instances of breakthrough treatments that might completely cure and change the lives of patients. But the issue is that we have a very well-defined budget, and we have to reallocate the budget to provide care to different types of patients that have completely different types of needs. And so healthcare systems are facing a technical challenge, which is how to allocate the resources in order to make the most for their patients, the most for the healthcare systems, the most for society. And this is a very tricky question, given the technical challenges that the healthcare systems are facing in order to make this comparison in terms of the health outcomes and health benefits that different services, different treatments, different drugs, different medicines are offering to different patient populations. And so I think one of the most important reforms we are currently working on in Greece and at the Ministry is the reform that is being provided with the support of the European Commission, with the support of DG Reform, and with the contribution of WHO, which relates to reorganizing and modernizing our national health technology assessment framework. We do have an HTA process in the country. Actually, we have more than one process. We have multiple processes. And we do need to actually strengthen the framework in alignment with the new regulation, the new EU regulation on HTA, and this is what we are currently working on. I'm not sure if the previous panels have mentioned, have focused on what health technology assessment is, but in essence, this is a multidisciplinary scientific approach on how to evaluate the benefits, the risks, and the consequences of new treatments, new medicines, new medical devices, in order to ensure that the government, the ministries and payers are actually paying for what they can maximize the health outcomes and the societal health-related quality of life and health outcomes. And so at this point in time, what we are doing is we are doing a complete multidisciplinary process, engaging all the relevant stakeholders and experts in order to assess the current landscape in Greece and understand what are the gaps in view of the new requirements of the new legislation that will require a number of updates, both in terms of legislative reforms, but also in terms of methodological developments and applications. We are in the process of understanding what are the gaps in the country and what will be the way of intervening in order to close these gaps by looking at what best practices are currently taking place in other European countries. And so we have a vision to actually be able and have completely reverse the efficiency of the system by following the best practice that other countries are doing in similar contexts. And so we are in the process of completing the project by the end of the year, well, by the beginning of the next year. And we have WHO as the project management of this important piece of work. So HTA will be one important aspect of what we are currently working on, which again, at the end of the day, it will provide a better value for money for the system by ensuring that what comes into the market is both clinically effective, but also cost effective and sustainable for the healthcare system. So this is one of the most important pieces, reform pieces we are currently working on. Should I pause here or should I?
Yeah, maybe we can pause and then in the discussion we can come back to other. This is a big thing, obviously, the HTA, but we can talk about other things, priorities.
I can then add a few things about funding and ways of financing.
Yeah, maybe then quickly just to say. Yeah.
So one aspect, so this is the aspect what I just described relates to how we assess the value for money, the incremental benefits of new treatments that enter the market that we decide to reimburse, we decide to pay as government, as payers. At the same time, of course, something might be very cost-effective, clinically effective, and cost-effective, and have high levels of efficiency, but at the same time, we might have issues finding the resources, finding the amount of money to pay for this, for access to these interventions. This is especially challenging for new treatments that might come to the market with high uncertainty in terms of the health outcomes, both health outcomes and cost consequences. And one of the tools we are actually now studying, we are designing for implementation by the end of this year, hopefully, relates to the use of an innovation fund as a conditional reimbursement tool in order to ensure that what receives an initial reimbursement status through continuous data collection, we lower the uncertainty in relation to its health outcomes, and we make sure that it actually provides good value for money. So this will be, in essence, a new fund with new additional funding from other sources that at the same time will act as an advanced tool through data collection, through continuous data collection, in relation to the health outcomes of these treatments, to ensure that these treatments are actually good value for money. And so this would be another additional tool that works on a complementary basis with the wider HTA restructuring we are working on.
Okay, that's great to kick us off. So Nandia, then over to you.
Καλησπέρα και από μένα. Ευχαριστώ πολύ για την τιμητική πρόσκληση. Θα μου επιτρέψετε να μιλήσω.
Good afternoon. Thank you very much for the invitation. You will allow me to speak in Greek. The truth is that as a president of the negotiation committee during the last 3 years and as a member of this committee during the last 5 years, we have been through the early stages of this whole process, and now we know that we need to transform ourselves. And the truth is that 2 committees in Greece have taken on the role of the health technology assessment bodies. And actually, they have been very successful in their work based on the results that we can see. We don't want to praise ourselves, but still the results are very good. And very soon we will have a health technology assessment organization that will not stick to what we are currently doing as negotiation committee. As a negotiation committee, we have certain constraints that we need to observe when we're talking about drugs that will be included in the reimbursement list. So this new organization will follow the example of other organizations that operate in other countries of the world and will focus on the impact on the health expenditure. We see all the systems being digitized, and this will allow us to strike agreements apart from the agreements that we are now having and that are confidential and that pertain to scalable discounts on the basis of volume or closed budgets that define a specific volume per drug. So as of now, we will be able not to just calculate the risk in the agreement, but to measure real-world data in order to see how much a drug should be reimbursed on the basis of its efficiency. Now, the challenge is to reach this type of agreements, especially for the novel treatments. And if we manage to do that, the companies that truly believe in the product will be able to set very high goals that we will then monitor in order to see whether they can deliver what they promise. Of course, we need all the support we can get at regular intervals. We need to check the different indexes that we will have included in the negotiations, and then the agreement managers should be updated, the EOP or EKP, so that they can know how to pay for a specific drug or for a specific treatment. For me, this is the biggest challenge. The whole purpose is how to ensure that we will have the treatments and that we will make the systems sustainable. And by systems, I'm not talking only about the public systems, but also the systems of the private companies. This should be done by having the patients at the center. The patients need to get the treatment on time and the way they should. Of course, up until now, we have received all necessary support. We needed support for the biomarkers-related issue. Biomarkers is something that does not fall under the responsibilities of the negotiation committee, but maybe we can actually include this in order to guarantee that we will have the best utilization of the biomarkers that will lead to savings for the system. And I will stop at this point. And maybe I will get the floor later.
Thank you. So we should have our connection. Yeah. So we're going to turn now to Manuela Braudaki. Hello. Welcome. Can you hear us?
Hopefully you can see me and listen to me, right?
We can. Yes. Please.
Great. That's lovely. Let me also share in a moment a few slides here. And I will continue my presentation. So you can see my slides, right?
Yes, thank you.
Okay, that's lovely. Thank you very much. And yeah, I will continue in Greek for a while, but thank you very much for the introduction. Emanuela Braudaki.
My name is Emanuela Braudaki. I'm a senior consultant at Health Policy Unit. I would like to thank you for the invitation. It's a pleasure to be with you, even remotely, for health reasons. The presentation today is on EU funding sources, so I can add to the previous two presentations talking about how the system in Greece is being funded right now and how it can be funded in the future. And I will mention some opportunities for funding from Europe. The results of this survey that was carried out with the help of the pharmaceutical company from Medivh, but it was repeated at the start of January 2025. We've analyzed the European funding tools, EU for Health, Digital Europe and others, and with the use of the AI tools that we developed internally, we found that in Europe we have 894 projects have been approved solely on cancer. Projects where Greece has participated in, those projects have already started. They have had their kickoff meeting, but we expect more projects to start within the next months. Considering the European plan as a basis for beating cancer, those European funding sources have already committed 14 million euros up till 2027 to fight cancer. 1.8 billion is still available for other projects in the future. Mainly with the EU for Health and Digital Europe, they have a lot of funding still available for the next 2 years. On a European level, the Horizon Europe has already been used up to a great extent. 89% of the previous 894 projects have been funded through that. And the Horizon and the other funding mechanisms, the projects there have mainly focused on early detection, diagnosis and treatment, and a lot of actions have been focused on breast cancer, lung cancer, and colon cancer. Now, the countries with greatest absorption of funds and projects are Italy and Germany, Spain, and we see that Greece is lower, but still in a good position, maybe around the 11th position, the countries that have received most of the funds. Now, the position of Greece, slightly different than the previous time that we ran the same survey. In 2025, Greece has received about 60 million from these funding sources, and we have not included the RRF projects in that or the EPA projects that have also funded some initiatives for cancer, and the NSRF, which we expect is going to be focusing on health. Now, those European projects that Greece participates in are 83 in number, with the participation of many different Greek agencies from the entire range of the private sector. But the absorption rate in Greece is lower than that of other European countries. We focusing more on some individual points. We see that Greece has a lot of common points with Europe, but also some differences. For example, Horizon, again, in this case, has funded 63% of the projects, but this is significantly different because the European number is, at the European level, the number stands at 90%. We also see that most of the actions relate to research and other interventions such as prevention and digitization. We see an increased participation by private companies as well and the public sector. That, again, is a difference in relation to Europe, where we see that 40% of the participation is mainly research and academic institutions. The projects for specific types of cancer, mainly breast cancer, lung cancer, and colon cancer, But there are other projects for different types of cancer which shows a certain fragmentation in research in our country. In contrast, in Europe, this distribution is more or less similar between the different types of cancer that has been studied. To sum up, what all that means for Greece. Greece has used to a great extent the funds, the resources available from the EU, but there are a lot of there's a lot of potential for making even better use of these funds to develop innovative action, improve research and technology. But that requires targeted use of the available European funds to and support these initiatives, and of course, collaborations between private and public entities. To accomplish that, there are two things I can propose, and it would be interesting to discuss them later on. First, to support the asthma contact points in Greece and support initiatives such as that of ESMO, of ELOC, and also to use studies such as the one presented here that provides accurate information, timely information, so that the institutions can be aware of the new funding sources. But what is important in order to enhance collaborations in Greece and on international level is to get the continuous support of the state. And I'm happy that we have the representative of the ministry with us, Mr. Angelis, because it is important for the ministry to continuously support and fund and promote these collaborations, perhaps by creating a national package to fund innovation. So I would propose an extension of the Innovation Fund to support innovation with national resources or through agreements with the Globacan, for example, so that we can have this collaboration between healthcare institutions and pharmaceuticals and all stakeholders. Now, the discussion today has revealed a lot of challenges and difficulties, and we all need to work together to overcome them. Thank you.
Thank you very much for that. So it's good to have the representative here from the Greek Patients Association. So I'm going to hand over to you now.
Thank you very much. First of all, I would like to convey the greetings of the President, Ms. Vavkoufzi, who unfortunately couldn't be with us today due to a health issue. I will try to be as brief as I can. I understand that it's quite late. You all have been here since morning. Earlier, the other panelist talked about this cost sustainability ratio. I would like to introduce another critical factor, the factor of time. We all know very well that when it comes to cancer, time is of essence, and the need to beat time is what leads many patients to private expenditure, to catastrophic expenditure. And that in a case that is very class-related. So we understand that this is quite an explosive mix. So what do we do? First of all, we record the needs. We now have the tools that we need in order to do that, and we develop new ones. We need to gather all these under a national action plan that will describe a mechanism for the recording of needs. We also need quite a bold HTA process that will ensure the participation of patients because their experience is of high importance. And now to the question, where are we going to find the money? The answer could be that if we all sit together, we can be creative. And I would like to mention something that impressed me, actually. Yesterday, on social media, a patient actually launched the crowdfunding in order to raise some money and undergo chemotherapy in a private hospital. The money that was needed was collected in a matter of hours. What does this mean? It means that for the citizens, the treatment and the right therapeutic approach to cancer is of high priority, and that for the Greeks, the money that is allocated for cancer is money well spent. Thank you very much.
Indeed. So now over to our commentator, Vasilios Barbounis.
Yes.
Floor is yours.
Ευχαριστώ πολύ για την τιμητική πρόσκληση.
Thank you very much for the invitation. I heard very carefully to all the interventions of the institutional representatives, and I can say that the following points are, in my view, absolutely necessary in order for us to guarantee the funds that will finance innovation and novel treatments. The first has already been completed, but we expect it to give results, and that is the National Registry of Neoplastic Diseases. It is a very recent development of great importance because it allows us to measure, and only if we can measure can we produce results. And the second point I would like to mention pertains to biomarkers. The funding of 37 of biomarkers, the most necessary ones, will cost 7.5 billion euros, but the cost will be offset 10 or 15 times, and this is a major gain. As it has already been mentioned, large part of the cost of research for novel drugs comes from the European funds. And even though in the past years we started with 20 million euros, now we have reached the 5.5 billion euros. So you can easily understand that the cost is very high, and this the high participation costs requires an allocation of risk. Moreover, it is very important to promote and apply prevention over treatment, since it is very cost-effective. And that is why we have incorporated the vaccination of girls and boys against HPVs. Now, at a more technocratic level, the treatments need to be novel, but they need to prove that they bring about benefits for the quality of life, something that makes the negotiation committee, the HTA negotiation committee, and the drug price negotiation committee more important than ever. We know that they have been supported in many different ways, and that is why they have given so very good results. In order to invest in innovation, we need to disinvest from drugs or treatments that are obsolete or have no value or efficiency for the system. You probably remember the study of Professor Mosialos and of his partners that showed that only a small part of the novel drugs had real benefit when it came to survival and quality of life. So it is very small, if not inexistent, the marginal relation between cost and the clinical benefit of the novel drugs, something that should be taken seriously into account by all the competent authorities, but also by society and patients. We should always measure the value of a novel drug and not the different form of Kaplan-Meier curves, which through creative statistics can be false. Of course, we should not forget that there are inequalities in the system. There are groups that are excluded. And these inequalities should be our main priority, because there's no point introducing novel drugs if these drugs are not available to all. If we combine, on the one hand, the need for prevention and the fact that approximately 40% of cancers in Europe could have been prevented if the lifestyle had changed, then this can actually lead us to economies of scale. And the next thing, that is the National Fund for Cancer, is another major point. These could come resources by excluding drugs that have not proven positive impact on the quality of life of people. In conclusion, the governments and the different decision makers should have a clear picture of what is coming in the future. And now, zone scanning is a very useful tool that, in combination with a separate fund for cancer, and with the conviction that novel drugs have value, and not just price, that they are cost-effective, but have value for the consumers, then I believe that there can be financial space to fund innovation, and so that novel drug can become accessible for all European citizens. Thank you very much.
Well, thank you very much to all the panelists. We've kind of already come to the end of the session in terms of our time, but I want to give you the chance to respond, obviously, to many points that have come up, which I guess demand some answers from the ministry. So I'm going to let you have the floor, and probably that will be the end of the session.
Okay. Yeah, so thank you so much for all the valuable comments. I think everyone would agree with what most of our colleagues here have mentioned. I'm only delighted and glad to hear a medical oncologist only support the principles of health economics and the need of why do we need a more critical, scientific and robust assessment of the benefits and outcomes of new treatments. After all, it's not the case that all new treatments are innovative. And given the fact that healthcare systems cannot really pay for all new technologies and products that enter the market, given that the rate of increase in terms of the financial capacity compared to the rate of entrance of new treatments is completely, has a huge gap, right? It only becomes more important to focus on tools and procedures that can help us make more informed decisions in relation to what is really more beneficial and more cost-effective, what is more affordable for the healthcare system in order to come up with more sustainability in the healthcare system. After all, it's not a question about what is innovative, but how we can ensure that the innovative treatments can be funded in a sustainable way, and there is no easy solution, right? Most of the European countries, actually all European countries, are facing the same issues. So it's not an easily answered question. We do need to think outside the box. We do need to have collective consortiums and collaborations with different stakeholders in different countries, different regions. We do need to explore new tools, more collaborative actions, but at the end of the day, we need to come up with new ideas about how we can make more efficient reallocation of the resources for the best of patients and society. And again, there is no easy solution. We can explore additional sources of funding, but there is always a competition, because if you are into the discussion of how you will safeguard an additional amount of money from central government, that means that this funding will be lost from another department of the government. So, the discussion goes at a much higher level. Obviously, all ministers of health and all ministers of health would like more resources for their own portfolios. But at the end of the day, this is a central government question, and the central government has also to be persuaded with the needs of our sector, after all.
Yeah, thank you. Yeah, obviously, it's always competition for resources within the state, within the national context. Every ministry is fighting for, more for their budget. I just maybe wanted to ask you as well about the competition at the EU level, and some of the points that were raised by Emanuela. We look at Greece in terms of Greece's ability to, compete and access the funds that are available. 11th place is not too bad, I guess. But maybe we can see improvement there. We see Germany, we see Italy actually competing more successfully in terms of accessing those funds. So I wonder if you have any thoughts about that. Greece has also, just at the level of the RRF funds, been very well prepared and very successful in that regard. So there's always obviously room for improvement.
Of course, we're fully supportive of exploring all additional potential resources of money and funding, but at the end of the day, the government can only come at some point in the life cycle of a disease and intervene through the provision of health services, right? It's much more important to inform the public about the usefulness of healthy behaviors, healthy behaviors. It's much more important to try and shape a wider, broader strategy for preventive mechanisms, for ways of actually avoiding the occurrence of illness in the first place, because if you see the statistics for our country, I think we are close to the bottom case of obesity and inactivity, and it's very ironic and it's very sad in a way. As the Minister has mentioned, we are the country that have invented the term gymnasium. Gymnasium used to be the place, the gym, where young adults were going to train and also learn lessons, and then this was evolved in a type of a school, and we were supposed to be the first entrance in healthy lifestyle, but at this point in time, in 2024, we're probably some of the most inactive adults in Europe, right? And we have probably top or second place in terms of smoking. So everything depends from your own behavior, and people need to be aware of the consequences of all their consumption patterns. The government can come at some place and offer them a diagnostic, and they can support them towards a more preventive way of living. But at the end of the day, everything depends on us, on individual behavior, and so it's a collective action at the end of the day.
Okay. It's been a long day, and I'm not inclined to prolong it further for you, and people have been sitting in their chairs for a long time. I think everybody on this panel, had the opportunity to set out their stall, if you like, and did, provide, the information that we all wanted to hear. So I'd like to thank all of you, including Manuela, who joined us remotely. Please join me in thanking all our panelists. We have a photograph, and we do have a wrap-up, which is going to be short, which will follow directly after this photograph. So stay in your seats, please. And it was very useful. Thank you. Okay. Thanks again to the panel. So we're now going to have some closing remarks. And in particular, we're going to talk about Greece's cancer priorities for 2025. So I'd like to welcome back on stage with me Xenia Saridaki-Zoras, who we heard in our opening session, and George Kapitanakis. Please, I hope, are they in the room? Yeah, good. Welcome back. Have a seat. Yes, sure. Oh, yeah, use the podium. Yes, so we've got about 5 minutes to each, I think.
Hope I will need less than that.
Less, great.
Είναι κάπου η παρουσίαση. So, είπαμε και το πρωί, 40 χρόνια.
So, as we said in the morning, 40 years our anniversary. make time for what is worth it for our company, for our society, rather, for our conference. Our priorities for 2025 or beyond, not just about maintaining and improving everything we have accomplished, but expanding them, growing them based on the needs of our patients and the challenges shaped in the oncology sector. ESMO, in collaboration with the state and international institutions and the European community, sets as priorities the completion of the oncology digital transformation, securing equal access for all patients to the necessary biomarkers, supporting prevention and early detection, and creating the right conditions so that Greece can have the palliative care that any civilized people should have. Prevention and early diagnosis is the basis of any oncology, modern oncology system, and establishing a culture of prevention is an important pillar for us. In collaboration with society and alone, of course, we want to make targeted interventions in 2025, but these are not limited to individual improvements. We need to propose strategic actions. ESMO has not been asked to participate in this prevention program. Nonetheless, we hope that in the near future this will happen so that we, pathologists, oncologists, members of ESMO, those who are more competent, will help shape those programs. A few other things that we believe should be priorities is access to financially sustainable treatments, clinical trials and new treatments, tumor boards, the need for comprehensive implementation and upgrade before the first oncology treatment, improvement of the national healthcare system personnel, survivorship and quality of life, and palliative care. I think these are all the things that we've been discussing about all day, from the first panel and up to now. We are committed to continue with our work. We continue with our vision and with the support and the love of our members. We want where we want to go, and this is why we have found a way to accomplish that. And because we believe that 2025 is going to be a decisive year in terms of developments, I want to personally commit that ESMO will continue to lead the way in shaping policies and interventions by playing its part for a more equal, modern, and accessible healthcare system. Because in those 40 years that we have our history, not only for today, but for the future generations, we want to continue doing so. And hopefully we will see you in our conference at the start of April to celebrate our 40 years as well. Thank you.
Thank you very much, Sonia. George, over to you.
An exceptional conference has reached its end. I would like to congratulate the organizers, the wonderful moderator that has been with us all day. You have managed to keep the time allocated to us. And I would like to thank all those who contributed to the organization of this event. If we want to talk about the priorities and identify what we need to do, we'll have to repeat what Ms. Saridaki said previously. So allow me to just add that what we need to do is to move from planning to implementation. We need to move from theory to practice. And this is nothing more than what the title of the annual conference of ELOC was saying. So for us, this year is a year that has to do with the practical implementation of everything that has been designed. And as you can see right on top of the slide, the first priority that we set is that finally our country in 2025 will have a national action plan against cancer. This is a main priority. We need to understand that and place all the necessary emphasis. Here you can also see that I have had lung and prostate cancer, which in our view are two types of cancers that need to be further analyzed. We should also check the issue of biomarkers, and of course, we are certain that there's going to be timely access to novel treatments and to innovation. Of course, this requires funding, requires some changes, requires different things. What we should also take a look at is the daily life of the patient. We need to understand that the patient has to go through all these different difficult stages. If we know which are the stages, we will be able to coordinate the navigation through the stages, and we will be able to ensure collaboration among the different disciplines. All these should be priorities of us in 2025, and we should work hard on these. Where are we lagging behind? Palliative care. We need to take significant steps. The same stands for the social and economic inequalities that exist out there. We need to focus on them and overturn them. And of course, we need to launch a new era for clinical trials. We know that there is a work group that has been established. We know that the framework has been set, but in 2025, we need to promote clinical trials. Moreover, mental health, the incorporation of mental health, or the mental dimension of cancer, if you like, is something that we need to analyze even more. And we need also to take a look at the major project that was announced today and that was mentioned by representatives of EVICA and by the minister. It is the project of digital transformation. This needs to proceed and be implemented. And of course, there has to be the strengthening of the quality of life and of survival. We heard about home-based care. We have heard a lot about survival. We need to focus on that and further develop it and improve it. And now, in agreement with Ms. Seridaki, and by the way, I would like to congratulate you on your anniversary. I would like to say that we are also in favor of a harmonious collaboration with the state and with all competent authorities so as to push, if you like, some of these priorities. And with these thoughts, I would like to thank you all for the organization of this event. Last year, I had shown you the Acropolis on the picture. Now I'm showing you Santorini because it's always a good thing to see the sea.
Of you. It remains for me as moderator to thank all of you still sitting here in this room. Thank you for your participation. I would like to also thank Nectaria Pasrevaki and her team, especially Anita and Sophia, who helped organize this event. And of course, this event took place, as I said at the beginning, under the scientific auspices of the Hellenic Society of Medical Oncology and the auspices of the Hellenic Cancer Federation with the support of MSD. And yes, this was our 5th one. I hope you'll all be back next year to hear the results of the priorities that have been discussed and set out today. So everybody involved in making sure that this event happened, thank you very much indeed, and see you next year. And a photograph? Would you like a photograph?
Κανέναν δεν μπορεί να αφαιρείται το δικαίωμα στην ελπίδα. Γι' αυτό και εμείς στην Ελληνική Ομοσπονδία Καρκίνου συμπορευόμαστε με τους ανθρώπους που νοσούν από καρκίνο, γιατί συναισθανόμαστε τις ανάγκες, συνδημιουργούμε το πλαίσιο και συνεργαζόμαστε με όλους τους φορείς ώστε να έχουν άμεση πρόσβαση σε έγκαιρη διάγνωση, κατάλληλη θεραπεία, ψυχολογική υποστήριξη και ομαλή επανένταξη στην κοινωνία και την εργασία. Ελληνική Ομοσπονδία Καρκίνου. Ο άνθρωπος στο επίκεντρο. Μάθε περισσότερα στο elok.org.
How far must we go to find answers, to discover new medicines and vaccines, and foster a place where science, curiosity, invention, and humanity converge? This is where extraordinary breakthroughs happen. We've been preventing and treating life-threatening diseases for over a century. We've pioneered new antibiotics and led practice-changing research for childhood diseases, cancer, HIV, heart disease, and diabetes. And we're only just getting started. Every day, our scientists from all backgrounds and disciplines work together to use the power of leading-edge science to save and improve lives. Because we believe research is the will to conquer the impossible. And that science will lead the way. Δισεκατομμύρια χρόνια πριν, ο ήλιος μας έχει διανύσει πολύ δρόμο για να φτάσει στο σήμερα. Μας χάρισε φως και θερμότητα. Μας έδωσε τη δύναμη της φύσης. Δημιούργησε τη ζωή, ένα τεράστιο επίτευγμα πέραν της ανθρώπινης φαντασίας. Κι όμως, κάποιοι εξακολουθούν να υποτιμούν τη δύναμη του, αλλά όχι εμείς. 4,6 δισεκατομμύρια χρόνια. Τόσων ετών είναι η πιο προηγμένη τεχνολογία εχμής. Στη United Group αναπτύσσουμε τα δικά μας αιωλικά και ηλιακά πάρκα για να εξασφαλίσουμε 100% ανανεώσιμες πηγές ηλεκτρικής ενέργειας από το 2027. Η φύση έχει επενδύσει σε εμάς εδώ και αιώνες. Τώρα είναι η στιγμή να επενδύσουμε και εμείς αυτοί. United Group. Με τη δύναμη της φύσης.
Check this out. It hasn't been such a long time since people first started shopping online, and it was easy to keep up with the clicks. Little by little by little by more, the clicks added up to be more than the stores, and e-tailers worked harder than ever before, because they had to keep up with the clicks. The clicks came from laptops, then tablets and phones, Monday through Sunday, office and home, 24 hours in every zone, and still they kept up with the clicks. Now shoppers ask more from the websites they're on, their language, their currency, their way, or they're gone, so you'd better keep up with the clicks. All of a sudden, there are so many must-dos if you want to keep selling, like delivery there, no there, or there.
And make it tomorrow, first thing.
No time for borders. Gotta stay in control to stay in the flow and continue to grow. But we'll help you. Keep up with the clicks.